conversation, which we always do.
So can you describe the routine a little bit of what you have to do?
Okay, well, we get up in the morning, I wash you, help you go to the washroom, get you dressed, get your breakfast, feed you breakfast, do the housework, get your lunch, help you go to the washroom again. And if we have to go to the store, if it's nice, you'll come for the walk because it's not too far away. But we don't do that very often.
Mm-hmm.
And yeah, I guess that's a typical day.
What qualifications do you need to do this work with me?
Oh God, well, I didn't have any except for my personality.
So I was really scraping the bottom of the barrel.
You
That's
were very desperate when I came along.
What shift were you applying for? The morning getting me up shift?
Yeah.
Yeah, that's also a hard shift to fill.
Oh, that's why you took me.
Because you never sleep.
Because the 6 till 8, nobody seems to want.
So that was a good time for you. And if I remember, it fit in with your day shift. Like
yes.
Right after me, you had another day job.
That's
that you
right.
went to for 8
That's
hours
right.
a
And
day.
I had spoken to them before I interviewed with you to let them know, because it's still close to here. And I said that, I might be late a couple times a week, and it wasn't a problem. So here we are.
So here we are. So now, did you have any interaction with anybody with any kind of disability before you met me?
Oh, my grandson is Down syndrome.
He has Down syndrome.
He has Down syndrome.
Down syndrome. So how does that impact his life or your life?
We like, he doesn't live with me, but when I see him, we just do the normal things. We go to Walmart, we go to the store, we watch a movie.
Mm-hmm.
We do everything that everybody else does.
How old is he?
He's 22.
22?
Yeah.
So is he in school still?
No, he's finished. He went to I know he went past grade 12. I think he got to do one more year after that.
Yeah.
And so he's not in school any longer.
Did he get his diploma?
He did.
He got his diploma?
He did. He did his community hours at Walmart. Now he thinks he owns the place.
Yeah. Yeah. And so does he work at Walmart now, or he going?
No, he just did his community hours for his high school.
Yeah.
Yeah, he did that.
Okay. So what does he do all day?
I don't know what he does all day. He lives with his mother, so I don't see him. Like, I see him at Christmas, I see him at Easter.
Yeah. So as far as you know, after school, he didn't have employment opportunities, or?
No, not that I know of. He was involved in Variety Village. I don't know if he still is. Like, I used to go to the Governor General games.
Mm-hmm.
And I don't think he still does that, because I haven't been invited, but then maybe he still does that. But he could go there still, maybe for a program or so. I don't know. Because his mother doesn't tell me anything.
Well, does he have, because I know in Ontario, there's funding for families to do, have people for a certain number of hours in a week to support their integration or recreation or employment or whatever it is the family decides to do, hopefully in, with discussion with the person who's the subjects of it all. But do you know if he's able to access any of that?
Not by himself. He's not really he is verbal, but not to a point where you can have a conversation.
Mm-hmm.
I did tell his mother about this program. Now, whether she went forward with it or not, I don't know.
Yeah. Okay. So you had experience with your grandson, but do you have any other contact with people with the disability before working with me?
No.
So if you were, I don't know, if you were in the store and you happened to see someone who had a visible disability, what thought went through your mind?
Oh, that like to see them in the store, and that I would always ask them if they needed help, or with the blind people, or help them cross the road, especially in the plaza when it's very busy.
Yeah.
No, I've always, but like I never personally worked with anybody or lived with anybody.
Okay. So I'm chuckling because I'm thinking of some stories that people who have told me who themselves are blind of being helped across the road.
Yeah, they probably don't like it.
But so how would it happen that you would help the person?
Well, first,
what happened?
First, I would ask them if they need help.
Oh, you would? Okay.
Yes, because I've seen on now on movies and stuff like that. Like, no, get away from me. I don't need your help.
Yeah.
No, I always ask first.
Yeah.
Because I know it can lead to
okay. Yeah,
confrontation. And if they did, then they would tell me the best way, like, would you like me to hold your elbow? Would you like to hold my elbow? Okay. How what's comfortable for you to do this. Okay.
So it sounds like you've sort of got this helper kind of instinct around.
Well, I like to think I do. I like to think that I'm the helper.
And did you ever wonder like what would happen, say, if it was you who lost your vision? Like what were your thoughts?
I've never thought about it. Like, what if it was me?
Okay.
But I'm sure if it was, like I always say, treat people like you would want to be treated. Mm-hmm. And as like you would want your family member treated. Mm-hmm. So I try to treat you as I treat my family members. So now you know how I treat my family. So
so you beat them up too, in other words.
Of course. Yeah. Of course.
Oh my goodness. So do you recall what was your first impression when you met me?
Oh, I was very nervous. Not because you were in a wheelchair. Yeah. But because I was nervous because, of course, I've never done this type of work before. And I'm always nervous at a job interview anyway. Yeah. And then it was fine. Like after we had our little chat, I left feeling good. Okay.
So over time, it's been a few years that you work with me. Has anything changed? Like, have you changed? I don't know. Would you say you learned anything?
Oh,
about
definitely.
People with disabilities from
definitely, yes, I have definitely learned that you can do anything you want to do.
So what would be an example?
Well, like say because I know people that I wouldn't say have disabilities. They I don't know how to say, but they, people that get a hangnail and they have to go on ODSP.
Now, do you know anybody who has a hangnail who's on ODSP?
Yes.
You do?
I do. Well, I can't say they have a hangnail. I don't know the extent of their disability, but they just they didn't do anything for their whole life. They, like, you went to school, you went to university, you got a good job, it can be done instead of sitting at home going, poor me.
So talking about ODSP, so this is like you sound like you think some people, especially this person you're thinking of that do you think they don't need ODSP, or do you think they're exaggerating?
Yes, I do think they're exaggerating. Because I have seen them doing different things that they apparently can't do because they just don't want to, like, people just don't want to work, and they're gonna try to get money the easiest way that they can.
So with this bill that we're arguing against, I know when you and I were talking about it, you over time got to understand a little bit more about what it was about. So like with people with disabilities, like say thinking about your grandson, like would that be a situation that you think is he in danger, if they pass this law that anybody, can just at any time
Well,
say that they want to have medical assistance in dying?
he's not in danger that way because he would never be able to understand and to say that. His parents would never do it.
Mm.
So I don't see him being in danger, but not to say that many families would not be in danger.
Yeah. So there's that situation. What about like a person in my situation, like say you had another grandchild born and they had the same diagnosis as me, which is like a form of muscular dystrophy, which means over time they get weaker and need help with more and more things. Eventually, even help with breathing and like everything else. Like, do you think that's a situation that medical assistance in dying should be available for that situation?
No, I don't, because I think that everybody has a right to live. If you had cancer and the doctor said, oh, you have only 6 months to live, that should be the only reason that you can say, okay, I want medical assistance. I don't want to have all this pain for 6 more months and whatever.
Yeah.
I don't think anybody has the right to be judge, jury, and executioner for other people.
Yeah. So these are the things that we're worried about. Like, we're worried about people, that the death is not imminent. Right?
Yeah.
Like, it could be like maybe you're going to die from your disability. Like in my case, muscular dystrophy, it's eventually going to make me die earlier than I probably would if I never had that disability, because
Yes.
of the complications it presents with everything else. But I'd have that right under the new legislation to just say, like, anytime, that I wanted, like, that's a concern.
Well, of
You know,
course, it's a
have-
concern, because especially for those that can't speak for themselves,
Yeah.
that other people are speaking for them when you don't know what their mindset is. Maybe that person's very happy being like that,
Yeah.
but they can't verbally say so.
And I don't think there's anything, correct me, if I'm wrong, anybody who's here on the panel, but I don't think there's anything that says anybody else can make the decision. Like your grandson, if he can't make that decision for himself, I don't think the law at this time is extending to the family to make that decision for him. So
that's good.
So that's what it would say at the moment. I guess my worry is that today they're saying if he could decide that for himself, he could make that choice. And tomorrow, maybe they're going to change the law again the next time around and say, oh, well, if the person can't make that choice themselves, maybe their family.
That's right. Maybe somebody else can make that. Yeah,
This is what we call the slippery slope, right?
That's right.
And then it becomes to, oh, well, your child is born with this disability and you still want to keep that child.
Well, this is what it's going to come down to.
Then they'll say it's all up to you then.
Yeah, so my child's less than perfect. Oh, well, I can always try again.
Yeah, so
this
is our worry.
Yeah,
right?
of course. And you all have a right to be worried, because it's not right.
Okay, so I'm going to see if I can find my person that I want to talk to.
All right, are you good?
I am good.
All right.
So I'll see you later.
Thanks for the
Thank you for the interview.
Thanks for the impromptu interview. I could have caught me off guard there.
Well, I think that's kind of good.
Yeah, it is good. It's the better way. Okay.
Yeah.
I hope I did okay. I hope I helped you.
All right, so I wonder if Elizabeth slept in. I'm just going to go on mute and I'm going to call my person I want to interview. Hello to the technical person. Elizabeth, who's I'm going to be interviewing for my segment, has been on the line for half an hour or so. And she's not getting in the room and I don't see her as a participant. You getting on now?
Hi, Tracy. Can you hear me?
Yes, I can. Hello.
Can
Hi.
you see me?
Yeah, I can see you winking at me in your picture. Yes.
Oh, okay. Can you
You're
see
not
me now?
live. You're not, it's not a live image.
Oh,
I've got your portrait.
okay.
So I just promoted Elizabeth to a panelist, so that
Okay,
should
great.
do the trick.
Okay.
Oh, I've been promoted to a panelist.
Yes. So I see your name here. And here you are live.
Can you see me live now?
Yes, I can.
Woo.
Your camera needs to be a touch higher maybe to see more the other
Is that
way.
better?
The other way. Yeah, that's nice.
Is that better?
You've got sun, yes, it's wonderful. You've got sun screaming in your window.
Yes.
How are you?
I am great. How are you?
I am good. I'm good. So thank you so much for being with us today and for supporting our efforts to, squash, kill any violent word you want to use to deal with Bill C7.
Smash, destroy,
Yeah.
what's another good one?
The opposite of ameliorate.
What's a good one? How about destruction?
There we go. There we go. So
Yes. Okay. Yeah.
so, Elizabeth, I'm going to let you introduce yourself. And for this segment, you wanted to interview me for some things.
Yeah, so I am really excited to be here today. My name is Elizabeth Moeller, and I am a board member with Citizens with Disabilities Ontario. I'm a member at large, and I've been involved with the organization for about a year now. So I'm a newbie to this scene, but not a newbie to disability. I live with a visual disability myself, and I support two nonverbal family members who live with a disability as well. Also, I am doing my PhD at Western University in health and rehab science, and I'm looking at direct funding, attendant services policies, and how those policies shape who does and who does not have access to services. So I thought it would be really interesting today to interview Tracy a little bit about healthcare and ableism in healthcare, and talk about some of the things that present as challenges to us as people with disabilities when accessing healthcare, in the hopes that, again, we can shed light on how problematic this bill is and the need to really reduce this bill to ashes. There, that's a good one. Okay.
That is a very good one, yes.
Reduce it to ashes. Okay. So to kick us off, Tracy, maybe you can just explain kind of what does it mean when we say healthcare is an ableist practice or ableism in healthcare?
Well, think about what medicine is all about, right? It's about a person who is sick. So in other words, that's a departure from a state of being, right? That people would think would be ideal. So let's call it like a healthy state. The medical profession is all about thinking about a person in terms of illness and sickness and ways to restore a person back to health whenever it is possible, or if not possible, to do whatever treatment is available to bring the person as close as possible to that vision or ideal of being, I guess, typical, maybe, so because of that, it's ableist because by definition, is trying to bring somebody up to a certain standard. So like I'm thinking about, my childhood growing up, as a child with a disability, a child who never walked. And I went to live in an institution in order to get services that were not available in the community. In order to get these services, you had to reside in the hospital. And in the hospital, I met children, like I was with 48 other kids with disabilities, some of whom could walk, some of whom were in wheelchairs, some of whom could talk, some of whom use letter boards or other ways to communicate. And it seemed to be that if a kid was in a wheelchair, they wanted to get them walking, like that was the goal. And sometimes they'd be walking, on crutches, braces and crutches, or they might have like some kind of a walker thing that they pushed around of some sort. But it was considered better if you could walk than if you couldn't walk. So that was sort of a step that they were going to. It was considered better to be able to try to talk verbally rather than use, a device to talk. Like, so like everything was about trying to appear normal. So there were kids who had multiple surgeries just to get their legs straight enough to put them in braces so they could stand up. So, kids went in the hospital, had like, multiple times going, under anesthetic, having surgery, dealing with the pain of the surgery afterwards, being out of school for the time that they had the surgery and rehabilitation or whatever therapy they needed afterwards. And the goal was so the child's legs would look more normal, right? Like their legs would just be straighter and whatever. And if the child couldn't walk, that was kind of considered like a failure, of the system, that they couldn't get this child to walk or even appear, normal. So a friend of mine who is still a friend that I grew up with when I lived in this institution, she went out to school, for starting in grade 6, she was able to go to a regular school. And she had to wear these braces that were like, locked at the legs and locked at the hips, so very rigid, standing there like a little toy doll, and her crutch in each hand. And then she'd have to push herself up on her crutches and then swing her legs through. And like, so that was like her way of walking. And she'd have to carry her books in a backpack on her back. So she couldn't carry anything in her hands because her hands were busy hanging on
crutches,
right? And her school didn't have an elevator, so she had to go up and down the stairs to her class. And so she was always a little bit nervous about getting bumped by a kid on the stairs because, kids are kids, and even adults, people are people. And, so she had this kind of anxiety about getting tripped or pushed over. I don't recall her saying sorry of anybody like making fun of her for the way that she walked, because it was obvious that she had braces and crutches, and so she wasn't made fun of. But another young boy who went out to school at about the same grade, he could walk without crutches. His legs were a little bit, how shall I say it? Like his legs were kind of bowed, like as if he was had ridden a horse all his life, So he had kind of a way of swaying, kind of a really cool way, I thought, of walking around. But kids made fun of him because I guess he sort of looked normal, but he had this weird way of walking, and kids thought he could control that or do it differently. He was the only person they probably ever saw who walked in a different way. And like, so he was kind of bullied at school, and he didn't want to go out to school. He wanted to come back to the school at the hospital, so this is part of, all this ableism thing and, pushing people to be, in a look a certain way and to look
Yes.
as typical as possible. So
Yes.
a little later, when my friend was able to make a decision, like she was going to use her wheelchair at school and not braces and crutches anymore, because now her school was accessible. There was an elevator, so she could use, she went to high school, so she could do that. Like how liberating it was. Because she could whip around, she could do wheelies, she could show off, she had her own set of skills and talents that she could use. It didn't matter how many books she put on the back of her chair, it didn't matter.
Yeah.
And her hands were still free. She had to wheel her chair, but she could still, manage to carry things on her lap or one hand at a time and switch, for hold your cup in one hand, wheel with your other, and then switch,
And it reminds me of how, like, we really try, as a society, silence conversations around our devices and our personal care needs because it's uncomfortable or there's stigma associated with it. But from what you're saying, and I would agree with you, these devices can be quite liberating. A wheelchair that allows somebody to get around and be in the community, or a computer with speech software. But I think there's a tendency to have silence around these conversations or to associate stigma with these devices. And it sounds to me like, from what you're saying, it's like, hey, these devices are actually pretty cool because they allow people to do things that might just do them a little bit differently.
Yes, yes.
Yeah. And so one thing that I was wondering about, because I don't know about you, but I've done a lot of reading around, healthcare and how people with disabilities, especially during COVID, are being treated if and when they go into hospital. And I know, as somebody who lives with a disability, I do not want to be in a hospital right now because I'm terrified I wouldn't have the supports I need. Even as someone with vision loss, getting around a hospital by myself could be difficult, knowing how to fill out the forms if they're in print. And so wondering if you have any thoughts or comments just around that kind of piece around COVID and the lack of supports that we've been able to bring in with us and what impact that's had.
Yes. I'm going to just go back a little bit, a couple of years ago.
Sure.
On top of my disability that I was born with,
Time travel is fun. Let's go back a few years.
Well, but I had a stroke. So that's kind of quite sudden, you just can't pick your time, right? It just happens when it happens. Luckily, I was on my way downtown at the time, so I was right close to the hospital that I normally use. And in the hospital I went, I was in intensive care for a day and a half or so. I was unable to talk at all. I understood what people were saying to me. I was able to sort of indicate yes or no to certain things. So I was asked if did I want to have this procedure done for my stroke, which had, I think, a 9% chance of clearing the block out entirely, or a 9% chance of killing me, or any in between, any varying degrees of eliminating the stroke. So, because it was risky, they wanted to make sure that I understood the risk of, doing it. So I said, okay, I nodded yes to do it. So I was very grateful that the doctors who were attending me in emergency could figure out very quickly that I knew what was going on and that I could make that decision for myself, because otherwise it would have been left to my husband or my daughter to make that decision. So just by comparing with pre-COVID, in the hospital, unable to talk, my family rallied the supports around me. So I had pretty much 24 hours, one of my attendants who knew me with me in the hospital. So these were people who I'd already trained at home. They already knew what positions I'd be comfortable with. They already knew how to turn me without hurting me. They already knew, like, how to do various things. And as I recovered, I was able to sit up and talk and get in my chair. Like, they knew how to use the equipment to transfer me to my chair and sit me comfortably so that I can function and move my arms. So all that stuff.
Just want to stop you there because you've said something I really want to pick up on, and that is that you trained your attendants. And so one of the things I'm wondering is, do you think that that's a really important piece of being able to direct one's own support needs? Because I know that there's a lot of people with disabilities who just have the luck of the draw. Whoever comes in, they receive PSW training or nursing training, and there's not a lot of room for sort of that self-direction piece. I wanted to pick up on that before you move on.
Yeah, for me, it's very important because I do things in unconventional ways. So the time before, when I was in the hospital, which was like decades earlier, when I had my kids, a nurse came in because I had to go to the bathroom. I needed help to go to the bathroom. And I started to explain to her, how to roll me so that, she could put the bedpan underneath me. And she's like, oh, well, I know how to help a patient with a bedpan. Like, I'm a nurse. You don't have to tell me. I'm like, oh, okay. So I'm gonna just play along, right? So she's like, okay, lift up. So what she meant was, I'm on my back, use my legs to like prop my pelvis up so she could put the bed. And I'm like, so I have spinal muscular atrophy type 2. I've never been able to do that maneuver in my life. And she went, oh. And I said, now would you like me to explain how I get on the bedpan? She goes, okay. So I talked her through it and we were fine. And then the next time she comes in with another nurse, she's like, she will tell you everything you need to know. You just listen to her. So suddenly I had an ally with this nurse who at first wasn't prepared to listen to me because she felt she knew everything. Finding out that sometimes when you have a disability all your life, you've had to figure out a different way, of doing things. So it was very important for me to have my attendants. Like, I felt I might die or be killed accidentally in a hospital if people didn't know. So they might turn me and think I'm fine and then rush out of the room without checking. And meantime, they could have turned me with my face into the mattress where I couldn't breathe properly or something like that, right? So I worry about those kinds of things, or not getting moved and then you're in pain because, I can't really move myself at all. It's like being like, I don't know, having Elmer's glue on your back and being pasted on, like I just can't move myself, right?
And it reminds me of so many of the stories that we've heard on CBC and other networks about what's happening in LTC. And it goes back to the same issue. People don't have their support people with them in the trenches advocating alongside. And so needs aren't being met. And unfortunately, we've seen what's happening. And so I do want you to continue your story, but I just think it's really worth mentioning that this is a huge problem right now during COVID, and a lot of people are struggling with this.
Well, and we've known for a long time, the disability community certainly has known, nursing homes are not the place we want to be. Nursing homes will kill us accidentally or probably, deliberately for too vocal and, annoying. But it's a very dangerous place for us to be. Hospitals are a very dangerous place to be. The first order of business is to get out of there as quickly as possible. But if you have to be there to have supports of people that and who can advocate for you, because sometimes they want to do things and you need an advocate to say no, like that is not possible for this person to do. So I had that whole system. I was in the hospital for about 8 days before I was released to come home and finish whatever recap I was going to have from home. And I had that support, as I say, like almost 24 hours. And if an attendant wasn't available, my husband would be there, or my daughter would be there. Like, somebody was there. who could help me or vouch for me or, make sure things were followed up on. So another thing that was an issue in the hospital was I couldn't work the call button. I didn't have enough strength in my hand to push the button when I needed help. So you're, it's very dangerous if you can't let people know that you need something, because you're just depending on them. They're just wandering the room whenever, and then to be able to get their attention and say, what you need. So apparently was some kind of switch that was very easy to work. It was like a little paddle. I just had to touch it anywhere. And there was something, and one of the OTs, knew about it and dug it out of the back closet somewhere. But my daughter just kept on them, like a dog with a bone. She just kept on them until I got this thing that I needed, because even with my attendants there, they might step out to go to the bathroom. They might step out to go get a meal, or, for whatever reason. They might step out of the room, and that might be the moment that I needed to call someone for something, important. So,
and that's really scary. And it's so interesting as you're sitting here talking, I'm thinking, but whoa, wait a minute. Shouldn't, of all places for people with disabilities, we feel safe in hospitals, but no, we don't, for all the reasons you're mentioning. And the call bell one is one I've heard before, and it's really, really scary. So wondering if you can fast forward a little bit. We're going to go ahead in time now to talk to us about last summer, when you unfortunately did have to go to the hospital, and what that was like during COVID. And this was during the time, just for people listening on the channel today, where the bill had not passed, more than the hashtag more than just a caregiver, or sorry, more than just a visitor, was passed, but that had not yet been passed. So that's kind of where we're at in terms of the time frame. So the caregivers, essential caregivers, could not at this point come into hospital.
Yeah, absolutely. And like when COVID came up, and I realized, oh my God, if I have to go to the hospital, they're not going to allow people with me, like I'm going to die a slow, painful death there, because they're not going to be able to come and, turn me or do anything for my comfort, let alone things that might be life and death for me. So I'd already decided if I got COVID, I was just going to stay at home, do whatever I could, probably die, but I wasn't going to go to a hospital. So here I was in emergency, and I had to have an emergency scope done of, they go through your mouth down to your stomach. They were checking for me having a bleeding ulcer, which they suspected. So when I went to the hospital in emergency, my husband was with me, and I said, I really need my husband to be with me, in emergency. Sure. And so they said, okay, so he was allowed to be with me the entire time in emergency. And it was, really important, because they wanted me to transfer onto a gurney, I guess you want to call it, like a stretcher kind of bed. But they didn't have the lifting equipment or anything, in an emergency to lift me. And I use a different kind of what they call a sling, like the thing that's underneath, a 2-piece one. So it goes under my knees and it goes around my back. And I hang there, from my armpits to my knees. I'm just hanging there. But I don't fall out of it, which people are going to think I will, but I don't fall out of it. Anyways, there's another way that I can transfer onto a bed that my husband knows how to do. And so it was good that he was there, because he was able to get me on the bed, get me comfortable, like find extra pillows to prop me this way and that way, whatever. So then they took me to go get the scope done. He was allowed to come down the hall with me, not into the surgery area, which is typical. And the anesthesiologist was great. He explained what he was going to do. I explained my concerns, because having anesthetic with my disability, when you're weak and maybe your lungs don't work, I want him to understand all of this, which he did. And then they put me under for the procedure. And yes, indeed, I had a really exciting bleeding ulcer. I would have bled to death. If I hadn't gone there, I would have bled to death. Wow. So they were able to cauterize that, seal it off the bleeding. And then after I came to you and my husband was there, he's like, okay, so now we want to admit you for 5 days because you need an IV intravenous for iron because my hemoglobin was very low as a result of all the blood that I had already lost. And so what they normally do is they give you an IV to get your hemoglobin up, very quickly. And I said, well, I don't want to be admitted to the hospital. I'm, worried that I won't have the support that I need. He's like, I'll make sure that you have everything that you need. Like, don't worry about it, but you really need to be admitted to have this IV. And I said, well, can I not do this at home? I know I've seen people in the community with IV, things hanging off their chairs. And, oh, no, we have never heard of anyone doing this at home. So the doctor said, no, this cannot be possible. So anyways, off I go to be admitted up to the ward. And my husband was allowed to come with me while I was admitted. And then he went home to get my stuff, like my charger for my wheelchair, for instance, and like my slings that I use for transfer, like whatever. He went to get some stuff. And when he came back, they wouldn't let him back up to the ward.
Wow.
He was
That
just not, and that
really
was a
scary
surprise.
moment.
Yeah. So, here I was with my cell phone, rapidly running out of power.
Oh, wow. I can't imagine.
And he's like calling me saying he's downstairs and they wouldn't let him come up. And but he had my stuff. So one of the nurses said they'd go down and get the stuff from him. And here I am. So I'm in my chair, but I can't work the call bell. I can't get their attention. But they said they would be like able to hear me and they would come if I needed anything. So I started to need something. My arm was starting to fall off my armrest, and I thought, oh, okay, I'm gonna just give them a call. And so I started calling at like I think it was 20 after the hour, and it was like a 10 to the hour before somebody like came in because I could call verbally, but it was like a long time before they came in. I'm thinking, I've got to talk to these people about how to get me on the bed. And once I'm in the bed, like I'm not going to be able to call as loudly because at least I could drive my chair like near the door.
Yeah,
like you're not supposed to you weren't supposed to go outside your room, right? Because of COVID. So I couldn't go down the hall and get them at the nurse's station. I just kept trying to call them, and I was testing, to see if it was going to work. And they didn't hear me. They didn't come for a very long time. And I thought, if I'm in bed and I'm having trouble with my position that I can't breathe very well, I'm in danger here. So I called David and I said, I'm going to go home. I'm not going to stay. So when the nurse came, I said, like, I'm leaving. She says, you can't leave. I said, yes, I can.
So just to stop there for a minute. So maybe people don't all know this, but can we leave a hospital or a facility if we're not feeling safe? Because people may not know that that's even an option.
I did not feel safe and I left. They call it, they say you're leaving against medical advice, AMA. They have a short form for it. So it must happen often enough that they shortened the term, right? So I'm leaving AMA. And they're like, you can't leave against medical advice. I said, I can leave and I'm going to leave. I don't feel safe. Well, why don't you feel safe? Because you can't hear me when I call for help. Like I don't feel safe in that kind of condition at all. So anyways, the nurse took me downstairs so I could, meet my husband. And then there was a form I had to sign, which I signed, also whatever, to get out of there, just to say that I'm leaving against medical advice. And I said to her, okay, so am I supposed to like not eat solid foods for a couple of days or something, like because they did this procedure? And she says, I can't tell you anything because you're leaving against medical advice.
Wow.
Even if she knew the answer to my question, which I don't think she did, but even if she did know the answer to the question, she would not be at liberty to tell me that because I'm leaving against medical advice, right?
Wow.
So I left and I called my family doctor in the morning and told her what happened. Or actually, I sent her an email. I emailed her first thing in the morning to tell her what had happened.
Right.
and to ask her if she had any advice for me. And so she gave me a call, and she told me to take a certain amount of iron every day, orally. And she talked about my, if there was any restrictions on diet or whatever, which there weren't, just as tolerated. And, so obviously there was something that I could have done at home. And then later that same day, I got a call from the surgeon who did the procedure. And he says, I got a call from your family doctor. And I says, oh yeah, she's great, isn't she? He goes, in all my years of practicing, he said, I've never had a family doctor call and ask me questions. So she had actually called around and asked a few people, what should I do since I was at home? What should I do? And he said, what she recommended to me was exactly what he would recommend to me. So obviously there was something that I could do at home. Right?
Yeah, and that's so interesting. But another point you've raised is the importance of finding your allies. So it sounds to me like your family doctor is a pretty strong ally. And it's, I think, really important when we're well, and I'm taking myself into this equation, that we find the time to really look into a good family doctor who's going to advocate for us. And that's something I know I need to work on, because it sounds like when you have that one person in your corner, it's a lot easier than if you're running to a walk-in clinic at the last minute, you don't have a doctor and you're stressed out. So it sounds like that's been really important to you.
Yeah, and it's the luck of the draw, because I deal with a particular hospital, St. Michael's Hospital in Toronto, and they have a family practice clinic, which I've been a part of since before my kids were born, so like over 30 years. So the doctors there come and go, but you get like a doctor assigned to you as your primary family physician. So it's not like every time I go, I just see whoever is there that day. Right? It's not like they're just doing continuity of care based on what's in your chart last, which sometimes it's like that, but you actually have your own doctor that you can see, and they get to know you as a person. And for me, this is very important for them to advocate for me, because they have to know under normal circumstances, like I am active, I have things that I do. I'm able to talk, I'm able to be reasonable, I'm able to whatever I can, you know what I mean? Like they know what I'm like. So if I suddenly come there and I'm like, I'm not acting like my usual self, my doctor is going to know how that's a departure from my usual self. So it's not quite like ableism, I guess in a way it is, but it's like, instead of comparing me to like everybody, the norm for everyone else, she's able to think about what's normal for me.
For you in that moment. Yeah, that sounds really important. And I'm wondering, just to kind of bring it a little bit to MAID, I attended, and you might have attended them too, some really great webinars by the DeBever Institute a couple of weeks ago, and they had 3 wonderful panelists. And one thing that really resonated with me this was the second panelist, Dr. Ramona Coelho. And she talked a lot about reasons why people might ask for MAID. And one of the things that really struck me is that they're not being given supports to live. So they're not being offered a full chance at a quality of life. And I'm wondering if you could maybe talk a little bit about that.
Oh my God. Like, I'm deathly allergic to peanut butter. And I have said to my family all my life, if it ever comes down that you're going to put me in a nursing home, just give me a peanut butter sandwich. You know what I mean?
And it's so interesting that you say that, because Dr. Coelho cited one of the individuals that had requested MAID, and I believe it was someone in their 20s who was living in a 30-degree room with 3 other people who were several decades older than her, in the middle of summer, and didn't have access to any of her stuff, and just had no quality of life and was giving up hope. And so just maybe we can kind of talk about some of the really harsh realities around that.
Yes, like living in a nursing home is awful. There's no way to sanitize that. We've seen from what has happened, how vulnerable that population is. And, person might say, oh, well, they're old, they're going to die anyway, so they die this year instead of next year, or this month instead of next month, but that's not really the point. The point is, you know, there's nobody there. You know, if you need to be fed, are they going to be able to take the time to wait for you to chew and swallow? Are you going to be able to get more than a couple of bites into you, you know, before they have to move on to go feed somebody else? Because there's just not enough one-on-one time, right? Like in a nursing home, the PSWs that are there typically will have, oh my gosh, like anywhere from 7 people to 14 people that they have to get up and ready for breakfast. So, you know, some people need like a little bit of assistance, but some people need a whole lot. So it'll be like, you know, they'll come back to them after they get everybody else up, you know, and so some people don't get up at all. Do they get to eat? They might not get to eat at all. And then it's like, what is written down? Is it written down that person did not eat because we didn't have the time? Or is it written down like, oh, the person refused their meal, or the person was not hungry? You know, like my uncle passed away in the middle of COVID. He was in a nursing home. He had advanced Alzheimer's, but he was doing well. Like his wife, my aunt, went to see him, I think 3 times a week at least. But there were other people around. There were like volunteers around. Like there were people to keep him engaged and interested in doing things, you know, in the facility. But anyways, when she finally got to see him towards the end of COVID, when they allowed visitors in again, so-called visitors, they're much more than visitors. They're essential, you know, to that person's survival. But anyway,
essential caregivers.
Yeah, in the 3 months that she had not been allowed to see him, he had lost so much weight. So clearly he was not eating because he wasn't interested in eating. Like there was nobody to get him interested, nobody to like, anyway, he had just lost so much weight, and he died like in the summer, you know, of last summer. And, you know, he might not have had to die like that soon, and certainly not that way. It sounds like he died slowly of starvation and lack of stimulation. You know what I mean? Like just being in a room, imagine like being in a soundproof room if you also can't see, and then maybe a couple of times a day someone comes in for 5 minutes to do whatever it is that needs to be done, and that's all you get. And plus you've got a situation where your brain is slowly deteriorating. I mean, that's going to happen much quicker. So nursing homes are terrible places. Like they should not exist, and some countries have decided not to have them. We don't have institution for kids anymore, like where I grew up. We don't have that. We decided kids should not be growing up, you know, in a big hospital. So we have like maybe small group homes or something on a smaller scale where you're seeing more individually, and people, you know, can take more time to do what you need. But for me, I would never go into a nursing home. You know, I would rather, you know, end my life if that was all, if that was going to be my life. I would not feel safe there anyways. So I'd rather just go quickly and, you know, I'm a planner. So, hey, I can just plan when I'm going to go. But, you know, not to make light of it, but a nursing home would not work for me. And if my family couldn't cope with me at home for whatever reason, if we couldn't cope with the supports that I could bring in through the direct funding program, which we have in Ontario, you can hire your own attendants, which I've been doing for the past 16 years. You know, if we didn't have, if that would not take the pressure off my family to do anything in between, I would request MAID under those circumstances. You know, I would. I've got like a chronic pain situation happening, had for years and years, and it's been very difficult to keep that under control because it's getting worse over time as my spine is deteriorating. It's gradually getting worse. And so every time we get the pain medications where it's kind of tolerable, then suddenly, you know, I need different medication or more medication. So over time, that's going to get worse. If I get to the point where they say, Tracy, there's nothing more that we can do, there's no medication that's going to work, anything we would give you would just knock you out, like you'd be unconscious, like at this level of whatever medication. And if that was going to be my life, then, under that circumstance, I might want to choose MAID. And the way the law was written before these amendments were coming in, I would have had that option, I believe, under MAID. I would have had that option. And if not, I always have a peanut butter sandwich.
Yeah.
Right.
And so I just wanted to sort of really back up a little bit, because it's a really interesting something you said, and I agree with you that nursing homes should not exist, and other countries have abolished them in favor of smaller scale settings. So in Denmark and Norway, they have, and we used to have them here after the war, they were called Abbey Field houses, where, people that needed support lived in a smaller home-like setting with staff, but they had their own private areas and then some public space if they wanted to get together with others in the house. And so I think in Sweden and Denmark and Norway, they call them nursing flats, where people who do need help can get that help, but it's in the community. And I think part of it goes back to stigma, that we don't value people who are older or disabled or ill. We put them in chronic care hospitals or long-term care homes. We out of sight, out of mind. And it took COVID for us to see how bad things were. But these problems have been going on for a long time.
Yes.
And I think part of why people are being discharged, especially younger people, into long-term care goes back to ableism. I don't think healthcare providers know about the options to live in the community. That's part of it. I also think that there needs to be more options, absolutely, and more funding. But I think the big problem really is that until we think about more options that don't involve long-term care, we're going to be in this huge issue.
Yeah, and I mean, the kinds of things that people help me with, that people that I hire, they don't have to be a surgeon to do what I need. They don't have to be a nurse to do what I need. They don't even have to be a PSW. They just have to come with an attitude that's like open-minded, and, physically that, they can do the things that I cannot do, right? So, I mean, I'm not asking them to go on the roof and, change the ceiling tiles up there. Like, you know what I mean? Like, I wouldn't do that myself, so I'm not going to ask my tenant to do that. You obviously can't ask them to do anything illegal. So if I decide I'm going to be selling heroin, like, they're not allowed to help me put it in little bags or measure it out or whatever, because I can't ask them to do anything illegal. But basically, I can train them to do whatever. We did have to get an exemption with Ontario's Healthcare Act, because there's part of it that says when it comes to an invasive procedure, has to be someone that's is qualified to do it, like a nurse. And by invasive procedure, they mean like a needle, a catheter, like an indwelling catheter, an enema, like things like that, so we had to get that changed, that under direction, or like under something about like under a nurse's direction or something like that.
Yeah.
So, a nurse has presumably has trained me how to do it, and then I'm training my attendant that way. Or I could ask for a nurse to come in from home care to train the attendant to do something, if I need them to do that. But like with COVID, with all the PPE and the hand washing, like, I'm responsible as their employer to make sure they're keeping themselves safe.
Absolutely.
So like, and they know about the hand washing. I've got stuff here for them. I've got masks here for them. They all wear a mask except for one person who has like too much trouble to breathe through one. It's just like, and she's been working with me for years. So if I haven't got COVID yet through her channels and networks, I shouldn't, because all our circles are staying the same with the same people that we have. So I don't need people who are trained in the conventional way, as a PSW to work with me. And that works fine. I've had people that are PSWs, and I mean, that's fine. I still have to show them my weird way of doing things. It might
Yeah.
not be the way that they were taught in school, like how to turn a person.
Yeah.
It's very different if the person is, usually more mobile and they're just in the hospital for like, something, as
Yeah.
opposed to someone like me. It's like, I got to put my leg this way, put my arm this way, because if you roll me, you're going to break my arm if it's not out of the way, and things like that. Like I have to be able to explain, and then they have it, but they're allowed to do these procedures. If I did need a catheter, they would be allowed to do it if I trained them. There's a needle that I take every day, and I train them in how to do that needle. So they're allowed to do it, because to call in a nurse to do a needle every day, like I could never go out. I could never do anything else because I'd have to be home waiting for the nurse, and you don't know when they're going to come. Like they're sort of like the plumber or the Bell telephone guy. Oh, I'll be there between the hours of this and this.
And do you think that that's part of what makes people choose to move on to direct funding? Because that agency and autonomy to live life on your terms and get help when you need it is really liberating, as opposed to, well, in an agency and certainly in long-term care, I guess to quote some of the literature, state control is afforded to disabled bodies. So you get up when you're told, you eat when you're told, you go to the washroom when you're told, go to bed when you're told. So do you think that that's one of the reasons that people move to direct funding, is that autonomy piece?
Oh, absolutely. Because before, I've been disabled all my life. I'm retired now. I've only used direct funding for the past 16 years. So obviously I did something before that, right? And before that, I lived in an apartment. They're called SSLUs, for Support Service Living Unit.
Yep.
SSLU. So I lived in a setting like that. So I think about 16 people who all needed an attendant, and one organization was providing that service. So there was staff, they had like an apartment there for the staff to be, it was like their office lounge area. So in between what we call bookings, the times that where we have appointments for them to come and provide service. So you pre-schedule. I was working, so I would be getting up at say 6 a.m, and a person would be with me from 6 until 7:30. And then I have time booked for when I was expected to get home. I'd have time booked for when I was expected to need to go to bed. And then on the weekend, I would also have time booked when I needed like lunch. And then at these times, I would also, go to the washroom. So they choose the staff, the staff, they train the staff to work with us on top of whatever training they have. They have to hire people that are PSWs now. I'm pretty sure they're required by government to do that in order to keep their funding. So they can't just hire on the basis of attitude anymore, or not solely on the basis of attitude. So you don't have a say, but the particular service provider that was helpful to me was called Access Apartments.
Yes.
So they have a pretty good reputation for trying to be consumer centered in terms of how they organize their policies, but you don't have a choice of who's coming. So sometimes they send me someone who is like, very short, who couldn't manage to do my washroom thing the way I needed, because if someone is too short, they just can't get the leverage to get the maneuver.
Right. Yes.
And if there's more than one person, it's fine. It's like, oh, send the other person to help me go to the washroom. But it's not fair to the one staff that's always getting called to do the stuff that's harder.
Yeah, for sure.
So the other person like making me a cup of tea and helping me with my making my lunch and maybe, folding up some laundry. But the washroom piece I have to, which is more, physically demanding, would go to someone else. And so I'd end up asking my husband to do it, and, or I'd come home and I'd miss my booking because with Wheel-Trans, I'd come home late. So I missed my opportunity for dinner. And although there's staff in the building 24 hours a day, it sounds like you've got access to service 24 hours a day.
You really don't.
Well, you don't, because other people are booked for service.
Yeah.
Right? So I don't have one person just for me. I'm sharing that with, 8 other women. And sometimes, a couple of guys, depending on what they needed and who was free to help them. So eventually we just decided we were going to take the plunge and buy our own home, which we were in a position to do because both of us, my husband and I, were both working full time. So, it's made me nervous, to do that because you feel like you don't
Wow.
have that safety net,
Yeah.
and but because of my husband and living with my husband, I felt like secure to do it. But
Yeah.
so part of it was really that I didn't have a say about who was coming to help me. And then if they say if the staff booked off, because staff would have sick days and holiday times and whatever else. So if a staff booked off and they couldn't get one of their own people in there to do this shift on a relief basis, they would call an agency. So you would just get
Mm.
some
A
person
random
coming
person.
in
Yeah.
who, probably had a PSW, but not something that I had been able to show, like, here's how you help me get on the bedpan.
Mhm.
I need someone to show them. I'd want some there when they
Mm.
tried it the first time themselves, to make sure that they didn't get hurt, make sure that I didn't get hurt, or that, I didn't fall, because if I fall, I'd probably land badly and break something. So it just became like so much that I was asking my husband anyways. I thought, maybe I will just do this. It's extra work, right? Because you're administering it yourself. You're not paid to administer the program yourself. It's one of the things that makes it more cost effective.
Yeah. So it sounds like there's a lot of invisible labor or invisible work taken up by people who manage direct funding, because you're doing your own hiring, training, onboarding, bookkeeping, all that yourself. And so it sounds like it's sort of a trade-off. Like, certainly you have a lot of freedom, but it does sound like there's a lot of responsibility on your shoulders.
There is responsibility. What I can say is, after you've been doing it for a year or two, then it's easier because you know what you're doing, right? Like I
Yeah.
was on a bit of a learning curve. The bookkeeper that I found, she was doing it for another person as well. And now she actually, I think she's got like over 20 people on direct funding that she's supporting for the bookkeeping. So she can really assist and make things easier. And there's times where, with the COVID top up that was given to staff, the extra $3 an hour, and then it was $4 an hour before that. But she figured out a simpler way of sending the documentation to the Center for Independent Living in Toronto, who administers it.
Yes.
A simpler way of doing it that was less labor intensive for us, like the consumers, and gave the assurance that the money was going where it was supposed to go, right? Like I wasn't taking this extra money and putting it into my own PPE, or deciding, oh, I'm going to try and like leave the country for a while and go somewhere else, right?
Yeah.
Like, just to make sure you're using it for the intended purpose. And so I was really lucky to get a good bookkeeper. So now I've sort of got it down. There's some extra things that I do that I'm not required to do, but like, for instance, I will do my staff timesheets. I have it on a computer, on Excel. And then when there's a change, I put the change in, and then I just have to print it for them to sign off. Whereas normally you just give people a blank timesheet and then they fill in their hours themselves. So I started out doing that. And then some people, their handwriting is messy, hard
for
to
sure.
read, and if they came a couple of minutes earlier, like they'd break down the earlier time, but their shift is for a certain amount of time, say 2 hours. So if they wrote down that they were here an extra 15 minutes because they got here early, like there's saves like that. So I wanted to clarify when they're here on paid time or not. Like if they
for sure.
if they're coming early because of the way the bus schedule lands, it's like, come in, relax, you're not, don't worry about it, or, that kind of thing, so that it's clear. I don't want to be taking advantage of someone who's consistently early and I'm not getting paid for those hours, because over the course of a month that could add up, but to get back to your question, yes, I was able to hire my own people. You develop a rapport with them, you develop a relationship with them before we were doing this segment. I was talking with my attendant, Mary Ann,
Yes.
and you do have that relationship. So when COVID came up and I'm talking to staff, like, what are you going to do? It's like, Marianne's like, I'm not going to leave you, like, no matter what, like, I'm going to be here. If I got COVID, she's going to be here. She's going to wear her booties and a gown and a mask and a shield and everything else. I've got everything in my basement that I'm going to need. I'm ready for like the zombie apocalypse.
I'm coming to you, Tracy. If there's an apocalypse, I know where to go.
Yeah, come see me. But anyways,
wow.
She's not going to leave me. And then I've got like another person, who was like, she has signed up for, she told me she just started working for me and made some commitments around shifts. Mm-hmm. And we had talked about like COVID and ways to do it safely, that we both could feel safe and comfortable. That was all working out. And then she needed serve. And she's like, she didn't want to not work with me because it would interfere with her serve, but it wasn't enough hours that it would match what she would have gotten on serve.
Yeah.
So anyways, she says, like, you know what? I made a commitment to you. She says, I will come and help you, but on a volunteer basis.
That is beautiful.
And I thought, oh my gosh, like, I didn't even know this person. Like, this is a brand new person. And she's just the type of person, she made a commitment. She didn't want to let me down, but because of CERB, it would have impacted her ability to do that. And so I don't think she's doing anything illegal if she's helping me out on a volunteer basis.
Yeah, and so I guess, I'm just looking at our time here and we're really rolling along, but I did wonder, sort of just to wrap up, to bring everything back together to healthcare, to MAID. Obviously, we want the bill dynamited, destroyed to dust and ashes. But I guess, what is the one thing you would say to the policymakers, to government? What do we need? Maybe there's a couple of things to really make sure we have a quality, rich, textured life.
What do we need to have a quality,
rich, textured life?
Rich, textured. Oh my goodness. Well, first of all, what anybody else needs, because we're all human beings, right?
Yeah.
So we need to feel safe. We, need to be in a loving relationship with, I think, at least one person in your life, who's not paid to be with you. Mm-hmm. I think we all need that. However, we define it, and whoever we love, and all of that is very important. But I think you need, oh my God, the one thing that I need, getting back to the MAID bill, is I think for people to understand that life is what you make it. Having a disability is not a death sentence. And with MAID is kind of encouraging people to turn it into a death sentence, because people aren't seeing enough of, just having us in the picture like they would anyone else. Like, how many times, in a movie, you just have someone who has a disability who's just playing a part, and the part doesn't have anything to do with their disability, right? Like, maybe they're like the tech person, like in one movie that I saw, there's a person who was the tech person who happened to be in a wheelchair, in the van, the surveillance van, like doing, and their disability had nothing to do with the plot. They were just there. Like, you need like more of that. I think you need more of our kids going to school together. Like, are you growing up with anybody? So you'd see, like, how kids were, whether they walk with braces or raced around in their wheelchair or used Braille or like whatever. Like, you need that exposure as a kid, because otherwise, as an adult, if you're hiring someone, you've never seen anybody
Mhm.
doing anything like you do, you know, like
Yeah.
you've just not seen it. So I don't know if I've answered your question as
No, that's a
succinctly as you
great
wanted,
answer.
but you know, I just think we need to be there. We need to be like included, like with CWO, when one of our slides we show sort of what's this difference between integration and inclusion, right? So
Mhm.
integration is like you're
You're
kind
there,
of
but you're
there.
not really. Yeah.
Yeah, you're
And
in your own
that's,
little bubble, right?
yeah. And I think like inclusion really means looking at the nuanced approaches to inclusion, like not just being physically present in a space, but really engaged in what's going on.
Yeah,
Yeah.
yeah.
Well, on that note, Tracy, I want to thank you for taking part in an interview with me today all about ableism, healthcare, MAID, and the in-between. I'm Elizabeth Moeller, and I'm with Citizens with Disabilities Ontario on the board and member at large. And I've been really lucky today to speak with Tracy O'Dell, who's the president of CWDO, among many other things. And thank you very much, everyone, for listening in.
Thank you, Elizabeth. Thank you
Welcome.
for coming back and join us when you can. I know you got a very busy schedule.
I'll be back.
Yeah. Okay, so I'm going to switch gears then. I don't know, do we have any way to take any questions from people that are watching on YouTube or no? Okay, so Elizabeth is gone. Okay, I'm going to assume no. So I'm going to move into sharing my screen. I've got a PowerPoint presentation. I will be reading the text that's on the screen because I know that on this medium, it's not going to be picked up by screen reader technology. So I'm just going to get my little thing up. Right. I want to get into, just give me a minute till I get into the right mode. All right. So I've got head, I can see the head of the interpreter. I just wonder if you see the slides, if you could give me a nod. Thank you. So for this segment, I wanted to talk about a major research paper that I did as part of my master's program in critical disability studies at York University in Toronto. And this was like primary research. They told me, don't do that. You won't have time to do primary research as part of this program. But I really wanted to do this topic. And so I did do this research myself. The name of my paper is called Not Your Average Childhood: Lived Experience of Children with Physical Disabilities Raised in Bloorview Hospital, Home and School from 1960 until 1989. And then on the slide is my name, Jeffrey Brome, who was my supervisor, David Paul Lumsden, who was my advisor, John Radford, who was my reader, and this was completed on November 24th, 2005. So my topic was to explore through live face-to-face interviews, explore a person's reflective experience of growing up in a particular institution called Bloorview Hospital, Home and School. This institution was in Toronto. It was a long-term care facility for children with physical disabilities in the 1960s through to 1990. And what I will add is at the present time, Bloorview merged with a rehab facility called Hugh McMillan Medical Center, and is now called I'm just trying to think of it. Sorry, the actual name is Bloorview is part of the name, but it is an entirely different place now. So I just want to make it clear. The place that I'm studying no longer exists as an entity. The contribution made by this research is that it adds to the body of literature about childhood experience of institutionalization. So children in care or orphans, Aboriginal children, children in correctional settings. So there's not a lot that could be found about children who were institutionalized because of physical disabilities. It also adds to the literature of adult experiences of psychiatric survivors and people with developmental disabilities. My particular research questions were, what is the lived experience of persons with disabilities who grew up in residential institutions, and what similarities and differences are there in each adult's perception of their experience, and what factors might account for those differences. My supporting research questions were, how did the childhood experience of institutionalization affect people with disabilities as adults? Are these outcomes positive, negative, or a mixture of each? And how does the experience compare to that of a child raised in an orphanage or a psychiatric facility? My methodology was primary research. I did face-to-face interviews with 16 adults who were raised at Bloorview. I interviewed 8 men and 8 women. It was emancipatory research. It was qualitative research and variation on constant comparative method. The grounding in the literature, I used Wolfensberger with regard to the architecture of the building, the language of the building, in other words, the messages it conveys. So we could refer, for example, to sorry, yeah. He always said, with a name like his, how can you not get into integration topics? Wolfensberger, The Principle of Normalization in Human Services from 1972, also referring to Wolfensberger, The Origin and Nature of Our Institutional Models from 1975. Looking at Foucault, Birth of the Prison, by Michel Foucault, Discipline and Punish, The Birth of the Prison from 1977, and Governmentality, also by Michel Foucault, in the Essential Foucault, Governmentality, sorry, in the Essential Foucault from 1978. I looked at Goffman's work on the total institution. Total institution is, in quotes, everything done in this, which means everything is done in the same place and under the same authority. A total institution means things are done with a large batch of others. You're treated alike. It means tight schedules, formal rules, and there's a hierarchy of authority, and activities funnel out from an overall rational plan. And that's from Irving Goffman in 1961. The work is called Asylums, Essays on the Social Situation of Mental Patients and Other Inmates. with the work of Simmons, traces the history of institutions in Ontario. His main focus was on developmental disability. So I was looking at Harvey Simmons from 1982, work called From Asylum to Welfare. Also in literature, looking at Jeffrey Rion, who evokes a personal history through painstakingly studying of documents and records in the archives, captures the daily experience from patient's point of view through letters, reports, records, schedules, lists, and other documentation. Really well worth reading. This is an amazing book by Jeffrey Rion. Remembrance of Patients Past, Patient's Life at the Toronto Hospital for the Insane from 1870 to 1940. And that was published in the year 2000. I'm going to just pause one moment here because I'm finding I just need to get a little drink. So I'm going to be away from my screen for just a second. But I hear my husband out in the kitchen, so as he's working at home, I'm going to take this advantage to get a drink. Be right back. I need something to drink. I'm talking here and I'm dry. Water. Water is coming. Continuing on with grounding in literature, the Law Commission of Canada prepared in the year 2000 a document restoring dignity, responding to child abuse in Canadian institutions, and looking at Sobsey, Dick Sobsey's work in 1994, Violence and Abuse in the Lives of People with Disabilities, The End of Silent Acceptance. In case you're wondering, I'm just drinking water. It's not vodka and it's not gin. Thanks, hon. So with my grounding in literature, I was looking at the social, in brackets, misunderstanding of, in brackets, disability. So you can read that social understanding of ability or social misunderstanding of disability by these authors, Goffman, Wolfensberger, Radford, Kleinman, and Charlton. So the overall finding of my research was there were two distinct cohorts that existed between 1960 and 1989, with the latter group having a relatively more positive experience. The building effect had been underestimated in research design. And there was, you could see the effects of advocacy, particularly with regard to transportation. I found that the residents operationalize a hierarchy among themselves. Oh, 1 second. David, can you come here for a moment, please? Just go to the other side, my arm fell down. Just gonna get my arm put back on something that's collapsing here. Just backwards a little bit. Note to you though. Oh, thank you, that's great. Okay. All right, so residents operationalize a hierarchy among themselves, which was based on mobility and assertiveness. So how mobile they were and how assertive a person was. It was not based on any specific type of disability or diagnosis, which is a departure from Murphy's and Kleinman's analysis. Residents experience emotional, physical, and sexual abuse while in residence. That confirmed Sobey's findings, found that there were some staff who preyed on residents, some residents abused drugs and alcohol, and some residents preyed on weaker children. Peer relationships were valued both within and outside the institution. Some lasting friendships were formed. So in fact, finding people to participate in the study, it was through that network that I was able to find people, because some had stayed in touch with others. So that was very helpful to finding people to interview. So some lasting friendships formed. Some residents were role models for the respondents. Residents looked to friends both in and outside of Bloorview. Bloorview is the name of the particular facility that was part of the study. So residents looked to friends both in and outside of Bloorview to shape long-term plans for living in the community. Residents found creative ways to be rebellious. So they found ways to smuggle in alcohol. They refused to follow rules. They used the mobility they had to go AWOL, like absent without leave. Reprisals took the form of physical abuse related to disability. So one of the staff would take your wheelchair away, for instance, as a punishment. So you'd have to be in bed and you couldn't go anywhere because your wheelchair was gone. Or meds were adjusted up or down, according to, if a person was getting too outspoken or just being too much of a nuisance. The person reported to me that they felt that their meds were increased to control them. Most residents had difficulty expressing their sexuality. Age-appropriate sexual expression was not condoned in the institution. The girls were prescribed birth control, whether or not they were sexually active. And this happened immediately after they started menstruating. Family relationships were highly valued. Those who were admitted at a younger age missed their family life. Those who were admitted when they were older keenly felt the loss of the family dynamic. Therapeutic interventions were not valued by most residents. So things like physiotherapy, occupational therapy. There was a program called the Satellite, which was not regarded as therapy. I'll go back and talk about that in a minute. Other results. Recreational programs were highly valued, innovative, and contributed to the self-esteem of residents. Educational experiences were very highly valued, but they were inadequate within the institution. Respondent support an ongoing role for institutions as a resource for technology and for fostering independence. They felt they had a role to provide current information, to provide access to technology, and to provide instruction in independent living skills. So in conclusion, Bloorview was considered a total institution as defined by Goffman. Respondents described being stigmatized and channeled through a service system which felt like a punishment. So that's in line with Foucault. And respondents experienced distanciation, abuse, and were relegated to deviancy roles. Most respondents felt their success was in spite of Blurview, not because of it. All the people that I interviewed were active in the community, although most of the respondents were relying on ODSP for income support. So they would be active as volunteers or in advocacy or in sports, and some were working. Conclusions that institution has a role as a resource, but should not try to define or confine their clients. So I'm going to stop my sharing at the moment. So that was what I found during my particular research that I had done. It was quite an experience doing it because I left my home when I was 7 years old, 7.5, to go and live in Blurview. And I stayed there until I was 18 years old. So those are pretty important years, you know, when you're kind of developing your personality and you're figuring out your place in the world. I was fortunate because my older sister was there as well. She has the same disability as I do, which is spinal muscular atrophy type 2. So I was never able to walk, and same with her. She's 4 years older. So I kind of would see what was in front of me by looking at her, you know, all the way along. Some people who are watching will know my sister, Sandra Carpenter, and she just passed away last year, you know, in 2020. So we've lost a huge advocate in the community with her loss. But she always had that kind of streak in her, I guess, as part of her DNA. It's very fortunate that she's in the institution for me. She went there at the age of 11. So we went the same year. She went in February and I went in October the same year. It was a very different experience for her. I didn't interview her for my paper because of her being a relative and, you know, trying to keep that, academic distance that you need to have. But she described it that Mom was, you know, running the vacuum and turned off the vacuum and looked at Sandra and said, like, how would you like to, you know, go and you know, live at a residential school? And so Mom always looked at this as us going away to school, you know, like, I guess like rich families send their kids away, you know, like the Queen of England sent her kids, you know, that's just kind of what was done. So Mom just said, like, how would you like to go to school? And Sandra immediately started to cry because she felt like Mom didn't want to have her like living at home anymore, you know. So her, my sister's reaction was very different to mine, because I went to visit one time, so you know that was fine. That was a visit. And then when I was going there to live, I was just like, okay, let's go, because I knew I'd be with my sister again. So I was like, let's go. Like I wasn't sad to be leaving or anything. My mom was out there like crying when my dad was driving me away in the car. And I didn't know like why she was crying. Now I know. But I was just like reading my comic book or whatever. It's like, let's go, let's go. So I left my home in Ottawa to go and live in the institution at the age of 7, and ended up signing myself out. And during those times when I was there, like during the 70s and up until about, you know, I left in 76. So I guess there for part of the 60s as well. But, you know, during that time, there was lots of things going on in the world around advocacy, particularly in the United States. You know, there were people climbing the steps into a courthouse or a legislative building. I forget what building it was, but people were climbing steps to protest that a bill that they wanted was not being signed. And if someone was in a wheelchair, they would throw themselves out of the wheelchair and drag themselves up the stairs. And if someone couldn't throw themselves out of the wheelchair, someone would lift them out and someone would help them, you know, go inch by inch, like up the staircase. So it's very dramatic in imagery. It's been captured in a documentary called Crip Camp, which is you know, just an amazing documentary, captures all kinds of footage of the rebellions going on in the States, which I was totally oblivious to. But at the time that I lived there, the trajectory for a person like me, meaning I couldn't dress myself or get myself in and out of my wheelchair, you know, I would need help with all of those kind of ordinary things, but where would I go? Like, so when kids left, they either went back home to their families that had, you know, already had said they couldn't cope with having their child for whatever reason. So they either went home to their families, or if they were physically able to look after their physical needs, they would go out in the world and, you know, find a place to live and hopefully find a job, or else they would have what was, you know, called family benefits at the time, but that was what we call ODSP in Ontario now, the Ontario Disability Support Program. So it's like your welfare for people with disabilities. Or you went to a nursing home. You know, if you needed as much help as I did, you went to a nursing home. And so basically, they were trying to train me. When I say they, I mean like the staff, the whole, I know what you call it. It's like it's a dynamic of a place. Like it almost has its own personality. It's like if it was a novel, there would be another character in the novel. But I was earmarked to live in an institution all my life. So staff at Bloorview didn't want me to raise my expectations very high, because I would be disappointed when it couldn't come to be. And this was said to me out loud in words more than once. You know, like I compare the term to being like an uppity cripple, right? Like I was considered to be an uppity cripple. You know, I didn't know my place in the world. I didn't know where I was going to be going. And I had better learn that, or I wasn't going to be happy. I did my schooling there until the end of my grade 8 subjects. We went at our own pace. So I whizzed ahead in language stuff. I was good at that. I lagged behind in math because I didn't like math as well, and I wasn't as good at it. My sister gave me a lecture and told me to get all my subjects up to speed, because she said I wouldn't be allowed to go to high school if I didn't have everything up until grade 8. So I understood that to be true. So I, you know, got everything together. The teacher that taught the higher grades at Bloorview, grades 7, 8, and 9, sorry, grades 6, 7, and 8, she was going to be retiring. And so she wanted me to do those 3 grades in the 2 years she had left before she retired. And there was 2 other kids that she put in the same group. So we all had to do our grades 6, 7, and 8 work in 2 years to be able to go to high school. And I really, really wanted to go to high school. I cannot explain how much I wanted to go. And I know, you know, there were kids that didn't want to go to school, wanted, you know, bum around and do other stuff like, and I don't mean just kids at Bloorview, but any kids, you know, like school wasn't cool, right? It wasn't where you can do the stuff you wanted to do. But I really wanted to go. And I was only going to be able to go if I did not need to go to the bathroom all day, because there was nobody at school who would be allowed to help me go to the bathroom. And there was not a bathroom big enough for my wheelchair to go into. And I knew this because it was true for my sister, because she was 4 years older and she went to high school 4 years sooner than me. She had to go there and not go to the bathroom all day. And another girl that was in high school, same situation. We had to go there and just wait until we got back to Blairview. That's when we got to go. So if I could manage to, not need a bathroom all day, I would be stuck with being at Blairview, and they weren't qualified to teach me at those grades. So I don't know what I would have done with myself or what they would have done to try to keep me busy during school hours, but I really, really wanted to go. So I went to high school, and it was the first time they were using this particular high school to integrate us into. My sister was at a different school. She was at Northern Secondary. I went to Monarch Park. And I didn't know why I wasn't being sent to the same one as my sister. That just seemed really bizarre. And I didn't like it. And because it was this integration thing at the high school was so new, we were sort of treated like people were trying to be very welcoming and nice to us, but it came across, and those of you with disabilities who are listening, you're going to know exactly what I mean, but it came across as very condescending, right, in terms of how they were looking at us. So I went to this high school, 2 other kids was like, oh, you can do well here, and da. And I remember the first test I wrote, and I thought, oh my God, this is a real test. I'm in real school, how am I going to do with, compared with everyone else? I studied and I studied for this test. And I got my paper back, and I got perfect, 10 out of 10 or whatever it was. And as the teacher was handing them out, she held mine up for everyone in the class to see. And she said, I want everyone to know that Tracy got perfect on this test. And if she could do it, everybody can do it. And that didn't sit that well with me. And I at the time, I didn't have the maturity or the sophistication, I guess, to understand why, this was I don't know, why at the same time she was praising me, it came across as a put down. But it also served to distance me from the other kids in the class. So now suddenly I was a brown noser, right? So I wasn't going to become popular, by any stroke of the imagination. So I had this trouble. At first I was yeah. I was still in my manual wheelchair when I started grade 9, which was a chair that I could barely push. I went so slowly. Every push on the wheel, I would maybe go 6 inches, I had no power behind that. So I had to get one of the kids to push me to my other class. So for the first week, it was I'll do it. I want to do it. I want to do it. They were fighting over who would taking. And after a couple of weeks, they were fighting over I don't want to do it. I did it last time. No, you do it. Because then they couldn't go with their friends and mingle with their friends if they had me. Anyway, so then I became the burden because I had, to be pushed. I couldn't stand it. So I made some kind of a fuss as only I was able to do at the time at that age. And Blairview consented to give me an electric wheelchair to take to school. And these first electric wheelchairs, they weren't very fast. They weren't scooters, that you see today. It's kind of it went along. But to me, it was wow, I could get down the hall and in a moment's time as compared to when I went slow as molasses in the other chair. So they said I could take the electric chair to school, but when I got back, I had to get transferred back into the manual chair, and I had to wheel myself up and down the hall 15 times to make up for the exercise that I wasn't going to be getting by using the electric chair. So I thought that's okay. So now it was cool again because I had this electric chair at school. It was just so liberating. I didn't need extra time to get to class. Like I could get there. It was like, it was fine. Could carry my books on my lap. Like it was fine. And then when I would get back to Blurview, they'd have to put me in the other chair. And it's like my personality would change as soon. Just seeing the interpreters are getting ready to switch. So as soon as I was put back in the manual chair, I was depressed. I was sullen. I did my 15. They weren't really laps because it was just up and down a hallway. My best friend at the time, Heather, she would sort of hang out with me and real slowly beside me, and we could, chat a bit like while I was doing it. But I was supposed to stay in the chair like for the rest of the evening. So if the other kids were hanging out, we had a room called a teen room, TEEN, teenager. And only the teenagers were allowed to go in there, and we painted it psychedelic purple and pink, and we had black light posters in there, and we got to play our music really loud. So the kids would go down to the teen room, and I would start to go down to the teen room, and I would go down the hall slowly and slowly. And I would get there, and by the time I got there, they'd all decided to go somewhere else. They'd gone out to the balcony, or they'd gone out to the backyard. So off I would go to follow them into the backyard. And I'd get there, and they'd be gone. I wouldn't have the energy to follow them anywhere else. So I was very depressed about, switching these chairs. And I made another fuss, as only I could do at that age. I could make people really, really miserable if I set my mind to it. And so they just decided it was too much effort to do the transfer to put me in the chair anyways, because they had to do the extra lift. It was extra work for them. They had to deal with my attitude. They had to deal with chasing me down because I wasn't cooperating. And so they let me stay in the chair. And so I really behaved myself, and I was a very nice person. And I changed my personality, so they would let me stay in that chair. So that was like, high school. By the time I was getting to be around 16 years old, they were doing little tours for us. They were taking us to different nursing homes to show us where we'd be living. And it's like, this was frightening. This is like showing me the gas chamber where you're gonna end my life. Like, this was not something that was going to help me in any way, shape, or form to know or see what this is going to be like. I really didn't want to go. So I didn't go on any of the tours. There was a small group of parents who were active with Blurview. Most of the parents, once their kids went to live there, gradually lost contact with the child, or sometimes the contact was cut off almost instantly. But it was a rare thing for kids to have parents involved with them and still seeing them at Blurview. My sister and I were two very lucky kids that our families stayed involved. They weren't really involved in the political stuff like this parent group, but they were in touch with us nevertheless. So anyways, one of my friend's his name is Greg. He has also passed away, same disability as me. But his mom asked us both to write up something to describe where we would want to live after Blurview. Since they knew we didn't want to live in a hospital, where did we want to live? So Greg and I sat down in the library one night, and we hammered out a document. I still have a copy of it. I don't know if I'm adept enough to pull it up while I'm talking, but I can do that if there's some time. But anyways, we wrote up a thing where we said, well, we wanted to be able to live in our own apartment. And we wanted staff to be able to come and go when we needed them, like to get us up or to put us to bed or, stuff like that.
the staff could be friends with us if they chose, but they didn't have to be our friend. They could just do their work and that'd be fine. That we would pay for our groceries and we, pay for our rent or whatever, we would do, but we wouldn't be charged money for the cost of the staff, that would be covered by the government. And then from there, we'd be able to, work or go to school or do whatever that we wanted. So basically, we were describing what now would be considered like either direct funding or, community care through the local health integration network, in Ontario. So that's what we were describing, like 40 years ahead of its time. Anyways, we had this thing in just a couple of pages, and Grace mom came back and read it. I thought they were going to take this seriously. So what they wanted was to know, like, what color did we want to paint the gas chamber? Did we want curtains in the gas chamber? That kind of thing, but not something different altogether from being in the gas chamber, right? So I don't know whatever happened to this thing, but there were documents, there was talks going on behind the scenes. And so by the time I was turning 18, my sister was already out. She was living with friends on the outside. We were on a volunteer basis, helping her with everything she needed. But she was the one that told me that these places were starting up, and one of them had a vacancy because a person had left. I forget why the person left, but someone had left. And my sister said I should apply to live there. So this turned out to be like a demonstration project for something that was like going to be like an SSLU model. SSLU is Support Service Living Unit. So it turned out to be that kind of a model. And in this model, you didn't have your own apartment, but you did share it with, depending on the apartment. If it was a 2-bedroom, you had one roommate. If it was a 3-bedroom, you had 2 roommates. There was one bachelor. There were no one bedrooms. And all of the apartments where people shared services were on the same floor of a high rise. And there was like a common kitchen in it. So if you needed help with your meals being cooked, you would go to the kitchen for your dinners, and there was someone who would, make the dinners, and that would all be done. But you could have help to make your breakfast or your lunch in your apartment, as long as you kind of kept it, fairly simple. Like, you weren't going to have eggs Benedict. You were going to maybe have like a boiled egg and toast, or, something more manageable with the time. So I applied, and I had to go and meet with the 2 women who were already living there, one of whom was a student at Ryerson, who knew my sister, and that's how the connection got made with the community. And we hit it off right away, because from their point of view, they were worried about getting a roommate that would be compatible, right? Like, because you're in close quarters with somebody, you wanted it to be someone similar to you in age and similar interests and so on. So they liked me, and I was approved to go there. I believe I got word about this in May. And I thought, they said, when can you move in? I said, I'll move in tonight, because I was in a hurry to get out of Bloorview. I didn't like being there for lots of reasons. I said, I can leave tonight. And I said, well, no. They said, at least give us like, a couple of weeks notice. And I said, I'll be there in 2 weeks then. And they said, well, you're still finishing high school, right? Because I was in grade 13. We had grade 13 then. And I said, yeah. I said, well, when do you finish school? I said, I'm finished school on June the 18th. And they said, okay, so wait till you finish school. I said, okay, I'll be there on June the 19th. I'll come in on a Saturday after I finish school. I was very eager to leave. So I was excited. I was getting people to help me pack, because I was just getting all ready to go and figuring out what you had to do, when you were moving into another place. And then I had to call my social worker, who was at the time, there was a program called Vocational Rehabilitation Services. And if you had a disability and you wanted to go study at university or college, they would fund you to go, but they had to do their assessment to make sure that they thought you were smart enough to go, that you were well enough, that you weren't going to die, before they could realize the benefit of their investment in you. And I'd gone through all of the assessments and everything, and I was just waiting for their okay, because to move into this place, it was called Clarendon, organized by Clarendon. So to move into Clarendon, you couldn't just go and move in and then be a bum. You had to be doing something like going to school or working or something, like even if it was part-time, because it was a demonstration project and they wanted to show what was possible for people living in the community with their own support as an alternative to a nursing home for people, in their younger years who had disabilities. So I was waiting to hear from rehab, to be approved, because once that was in place, that's everything I would need. I could move, I'd be approved for family benefits, I'd be able to pay my rent. My rent was going to be geared to income. I'd be able to go to school because they would cover it. And see, at that time, you didn't have any accessible transportation. You had to hire a private company to drive you somewhere. They only had like about 5 or 6 vans for the entire city. And the cost was roughly triple what the cost of a taxi would be. So there was no way I could afford to go to York University, where I was accepted, and pay my transportation, because the cost was like way out of reach for me. So all of these things were like a house of cards. They were all leaning on each other, and they were all depending on each other, to be able to be stacked, high enough. And I was waiting for this approval from VRS. My worker was very nice, but what I needed was to know I was going to be approved. And I remember talking on the phone. She's like, "It's okay. I will let you know as soon as I hear." And I'm like, "No, like I need to know now, because I need to be able to tell these people at Clarendon that I'm moving. Like, I need to be able to give them assurance of it." And she's like, "I will tell you when I can tell you." And I just remember like screaming through the phone. I was kind of in this, we had like kind of a, what do you call it, but like a little lounge area on the ward where there was a TV and lots of people would hang out there. But I just remember screaming in the phone saying like, "You don't understand, like, this is my life. Like, if I wasn't approved, I was going to be like in the gas chamber from my perspective versus being free," right? Like she didn't understand like how important this was and how life altering this decision had the potential to be for me, one way or the other. So finally she was able to give me the okay, and I was just like through the moon. And the staff kind of picked up that there was something going on with me, and they heard through the grapevine that I was leaving, and they didn't have any idea, of where I would be going to. And I said, "Well, that's my business." And it was nice to sort of have something about me that they didn't know, because they knew everything from what my temperature was every single day since I got there, because they took it every day at 3 o'clock, to like whether or not I went to the bathroom, to whatever, like everything was in a chart and recorded, and I was going to be somewhere where nobody had to keep charts on me anymore. It's just so liberating. So they heard that I was going, and I said yes, and they said I would have to tell them, because they wouldn't discharge me unless they knew where I was going. And normally they have a case conference, and everybody else would decide where the child was going to go. So I was the first person who ever went to my own case conference, because no one else knew where I was going except for me. So I told them if they wanted to know, they were going to have to invite me. to the case conference. So, I went and I told them, and they said, well, what are you going to do about your wheelchair? And I said, what do you mean? What am I going to do about my wheelchair? They said, well, you can't keep it. And I said, it's mine. And they said, no, it's ours. It's our property. Like, you can't leave. So I said, are you really expecting me to leave here, in a couple of weeks, and you're not even going to give me like a wheelchair to sit on? Like, I have been here like for how many years, and you're not going to let me leave, with your wheelchair? And they were like, no, they were. So anyways, at the end of the day, they agreed that I could borrow the chair until I was able to get my own, and then I would have to return their chair back to them. So I was a little annoyed. So I took the chair and I took a big tent too while I was at it. But that was kind of weird. But it was like an amazing day for me, like if this was a movie, like the sun would be shining, and there'd be all these happy music effects and everything else about leaving. I was just so ecstatic. The driver for Blurview, he was the one that usually drove us back and forth to school, so he had the earful every day of what we didn't like or liked or whatever was going on. And so he knew how happy I was to be leaving. And I said, Frank, like I need to get a ride there. Like, but it's on a Saturday. Like, what can I do? He says, I'm gonna come and I will drive you. He didn't care that it was Saturday, his day off. He would be there with bells on, I think he said. And so me and my little van full of possessions all went to leave Blurview, and it was amazing. And so I've lived in the community ever since. And so that's sort of my little bit of the story. So I was interested, but I did go back to do my master's sometime later after I graduated. I was very interested to look at other people's experiences of Blurview. I wanted to know, did other people hate it as much as I did? Were there people who found the experience very beneficial? I found out some very disturbing things that I had no idea of. Like some of the abuses I knew, I saw physical abuses, emotional abuses, people being picked on by staff. Certainly kids did pick on each other because, I don't think we ever escaped that. But some of the extent of the abuses I was oblivious to. Like I was oblivious to some kids that were sexually assaulted there, and even raped while they were there. I was just not in that circle, not aware of it. And it breaks my heart that I didn't know at the time and wasn't able to do something and speak out, because I was the type of person that would speak out for other kids. Often they would lose their nerve when it came down to the final confrontation, and they'd back down and say they never said anything. So that was kind of difficult. I didn't know enough about the life experience of people when they are abused and how vulnerable they feel. Because once you out your oppressor, you're in an even greater danger then, and I didn't understand that. I thought once you outed them, that was it. They wouldn't be doing it anymore because they couldn't get away with it. But, that was a problem. I did find out some very, very disturbing things. I also found out there were kids who were unable to speak verbally, but learned communication techniques there, either by using a Bliss board, like Bliss, Bliss, Bliss symbolics, which are like pictograms on a board that a person could use to put ideas together, sentences together, request what they wanted. So there were kids that learned communication, and that was the group that seemed to have them, for the most part, had the most positive experience there, because for the first time they were able to express themselves. They were heard in the way that they weren't heard at home. And this method of communicating could be shared with the families. So, that they could have a way to communicate. And that was very liberating for people who were not able to speak verbally, probably as liberating as what was for me to get my first electric wheelchair. Was probably on the same scale for them. So I don't mean to say for them, but for people who use that technology. So anyways, I'm going to just pause there. I'm going to ask the person who is doing the transition, because I think I changed my role now to be more of a background support. I just want to make sure we've got people in line for our next little bit. Okay, is anybody in the room that knows who our next scheduled broadcaster is supposed to be?
You
Hi,
better make
Tracy. Yeah, can you hear me?
Yes, I can hear you, Catherine.
So one, there, Amy, I think is the next person. Let me just check the schedule. It was emailed to you
Just now? Okay,
ago.
I'll take a
Maybe.
look.
Ago. Let's see. I don't see anybody waiting.
Where did I get it to? Fuck. Sorry.
Ah,
Where did
I heard that.
my hair drop?
Let's see.
Where did it go?
Downloads.
I just had downloads. And I don't know where it would be.
So my most recent.
I can't sort.
Top right tab.
It's just the picture.
No, top right tab. Okay, go back.
Okay, so, okay, Gabriel.
Yeah,
Okay. I've got a copy of the schedule as well now.
good. Top right tab.
Okay, so let's see.
No, sorry.
We've got,
It's here somewhere. I'm sorry. I don't know where.
okay, I think I've got it. So
Okay.
10 to 2 on Wednesday.
Yes.
We've got, so broadcaster, it says confirmed. So that's probably me.
Yes.
And the next one is Amy Kavanaugh.
Amy Kavanaugh, that's the name. So
Dr. Amy Kavanaugh is award-winning disability rights campaigner.
I don't see her waiting for.
Okay, there might be, okay, might take a while. Because I know it was a little while before Elizabeth got the link that she needed to come in the room.
Oh, okay.
I think maybe someone, I don't know what happened, if someone has to make her a
Right.
had to be a panelist or something.
Oh, Amy, could you email her and see if she's out there in the ether waiting to get in?
Is someone, you want me to email her or is someone gonna email her?
Anybody more? Gabrielle seems to be there.
Yeah, she might not be. Okay, just a sec, let me check my phone. Something just came in.
Where is it?
That might have been it. Yeah. Okay, no. Oh, Gabrielle has contacted Amy.
Okay, well, that's okay.
Okay.
That's coming. And then there's we've got nobody scheduled from 10:30 until 11. So
Right.
I don't know how much, if Amy is going to fill that whole block or not, I'm not sure.
Yeah, I've been back and forth with Jane Field, who has written a song for the occasion.
Yes, I was hoping she would come. Yeah.
So I will, I mean, I don't want to interfere with scheduling, but it looks like a break. But I'll tell you what, when Amy comes online, find out from her if,
How much time she wants.
yeah, how much time she wants, and I'll find out from Jane if she would be available. If
Yeah, because depending on when she can come, because it's 10 after the hour now,
yeah,
you know, so if she needs like a little more time, then it's available. But be nice to have, if you've got the flexibility, we could have Jane anyways, because I was wondering if I could play one of her songs. Am I allowed to do that with copyright? Am I allowed to play one of her songs?
She's written a new verse.
but she has written a new verse for the fishing
Okay,
for the occasion, and she will sing that.
okay,
I think she doesn't have the music for it yet.
yeah,
So let me do that.
okay.
And just say before I do, I'm sorry, when you were talking earlier about the difference between being in your power chair, being in your manual chair, oh my God, do we ever
It's hilarious.
have similar experiences? And I'm in bed and it's the same. So I've been very incompetent this morning and, agitated.
Hit the button, she says. Hit the button. What button?
Yeah. But so I'm having that experience right now. But I'm going to mute and I'm going to message Jane, and Gabrielle is going to keep us posted if she hears back from Amy.
Okay,
maybe-
there's something in the chats from,
Keep riffing about the bill.
oh, so she says Amy is here.
Okay.
Oh, good.
She needs,
Yeah,
she needs the link to be a presenter. So can you send her the link that you were given, Tracy?
yes, to Amy. To Amy?
Yes.
Yeah, okay. Yeah, I'm a little slow, but I can do it. It just won't happen that instantly.
Girl,
Pardon?
you're not as slow as I am.
Okay, well, whatever. I will find the one that you sent to me. So,
Gabrielle, she goes by blonde historian.
yeah,
Gabrielle, or Tracy, do you have her email?
yes, it was on that chart here.
Perfect.
Okay, so that's the Zoom link. Hang on.
All the competent people have this in charge. I'm going to mute and talk to Jane.
Okay, so I'll make sure I'm sending her the ones to come in this room. Come on. Okay, so. Copy.
so yeah, apparently there was a glitch. Imagine. Is that or 100th? Anyway, Amy was not actually confirmed.
Okay.
So I have texted Jane. Let's see if she has replied.
Okay.
Don't know. Back in the top left.
Well, that's
Yes.
as fun as I can do. I can fill the time. It's like having a soapbox. It's wonderful.
Yeah, we will fill the filibuster will not come to a grinding halt, but we don't want to waste the spot because we have lots of people who have things to say.
Okay. Oh,
Are we okay?
no, I'm just saying, Jonathan from 3 o'clock, oh, Beacons is there. Okay, it looks like everything's fine. Because Jonathan Marstrand is available today after 3, but I think everything is booked up.
Yeah, but
Are we continuing if they pass this bill? Or are we just going to keep going?
keep going because people are going to have things to say, and
Okay.
we're going to need each other maybe in ways that we haven't, or that are extraordinary. We'll keep going as long as there is energy and desire to do so.
Yeah.
We won't knock ourselves out if there are too many holes and gaps, but
Yeah, that's the only gap that I really see. Although, let's see, because it's in half an hour. So,
what time
shall
are you,
I? Sorry,
what time are you managing till?
I'm going to be here until I think 2,
Okay, all right.
10 till 2. So I
And
still
if-
have to figure out what my role, what I do as a manager. Is it just troubleshooting, or are there actual things that
this
need to
kind
do?
of thing. What we're doing now, basically.
So I'm in my role because it's from 10 o'clock on. So yeah,
Yep.
okay, good. So we're
The event that there's another, what do they call them? Glitch. That would be on you. So let's just,
oh, okay.
well, why don't you keep talking and
Oh my
I
God,
will
he's so
pester
close.
Jane.
Am I not too like monotone to keep on talking?
What's that?
I thought it was too monotone to talk for much longer.
Hey, well, I didn't find it too monotone. I thought that your reflection, I'll share a couple of things that I can remember that were occurring to me. I remember just when you were talking about your experience at Blueview, I remember Heather, who we know.
Yeah.
I hope she saw this presentation. I wonder if she's out there. Yeah, anybody who is out there, let's just make this broad announcement. Anyone who is out there in YouTube land and frustrated because you'd like to be helping to fill this time or ask questions of Tracy, if you know one of us, and if that one of us happens to trust you 100%, you can text or email one of us and we can arrange to elevate you to this lofty platform.
Yeah.
And I'll add to that, I'm really sorry, folks.
The presidential suite.
Yeah, and when I say us, I'm including Gabrielle, I'm including, our
Whoever else
interpreters.
is there.
So if you, and I'm sorry, but the reason we have to do it, for those who don't know, is that we were terribly disrupted by Zoom bombers twice on our opening evening filibuster. And so we have just had to put in extreme security. So unfortunately, without the opportunity to screen people more fully, we've had to resort to that method, which isn't as inclusive as we intended, but we hope to at least engage as many of you as we can and have the YouTube stream running and hopefully recording. And so at least you can share the experience with us. And, you know, what you could do is set up, you know, a Google chat or another gathering, like we can have pods of filibusters. So you don't have to be alone just because we can't let you in here, and you can certainly participate in the spirit of the day. Now, I can give a bit of an update on the political situation. Would that be useful?
Of course.
Yeah.
Oh, but I started to talk about Heather. I'll do that first. This is how I am when I'm Jane's answering. Oh, well, this is exciting. This is the most excitement we've had for a few minutes.
Okay, I'm here. What do I do?
Okay.
Okay.
Do you have
so-
Jane's email, Tracy?
Right. Jane's email.
Yeah.
I'm not sure if I've got her most current one, but I'll see.
She just needs to know how
You
to
know
check
what?
in.
Why don't you? Can you text me?
Yes.
All right, text me the link because it's so far buried in my inbox. It'll take me an hour to find it.
So when you say text, you mean like to your phone?
Yeah.
Okay. The link to the
The link to
internal one or not?
yeah, the elevated lofty one.
Okay.
Tap in there in that box.
Where?
Messages on the phone. Say sending you a link. I better ask if she's decent. Send.
Sorry, I'm supposed to send it to her?
Or send it to me. If you do you have her phone number?
Uh,
Out loud, we're broadcasting.
I'm not sure.
No, just text it to me.
Yeah, okay. So
It's
I would just have to call up your phone number then.
Yep. So all I was gonna say is that one of the quick snippets of life at Bluefield that I remember from something Heather told me once was that I forget how old she was, but she was quite mature by the time she was at Blueview. She was quite mature by the time she realized that it wasn't normal to get into your pajamas after school.
Yeah.
And now, you know, life goes around. Now it is probably normal. Normal to spend the whole day in your pajamas, but
Yeah, like that. So
May I interrupt for 1 second? There's an interpreter in the waiting room that needs to be let in because the other interpreter has left.
who is it? I can do that.
Do you have your name?
Tap on Sandra.
It's happening. It's happening as we speak. Thank you so much.
Catherine, I don't have your phone number to text it to you.
Yeah, just say. Oh, we don't just need to talk, but okay. Tap it again. More, hit more. Dealing with the interpreter first. Yeah. I hope I've got the right interpreter. If not, we'll be, yes.
Hi,
Okay,
I'm the
good.
right interpreter. Are you ready to
Very
speak?
sorry. Okay, so now, Tracy, email it to me then.
Okay.
Well, a good thing I checked. I sent Jane a message asking, "Are you decent?" And she just out of the shower, but dressed. So good thing I checked. My goodness. What a brazen hussy. Dublin.
Ugh.
All right, so I'm going to email now.
Are you going to let Jane in?
Well, I have to give her the link first.
It's coming. That's coming.
This one?
No,
No.
it'll be from Tracy.
Yeah, it's coming. Like I say, I'm very slow.
I also thought when you were speaking about life before your manual wheelchair, before your power wheelchair,
Yeah.
I thought, one, your description of going down the hall in your manual wheelchair, I thought, like, that is quick time taken to an extreme. And that is
Yeah.
not what we mean by quick time. That is not what we mean. Don't make that your next bill on
Okay.
the floor.
So I have sent you that link.
Okay. I'll just do it when it comes.
She texted
There
it.
it is. Oh, no, let's tap it. Ah, oh my God, just don't know. I've had another email from Heidi Jones who says, hi there. If you need someone in the next hour or so, we're available. Bracket, once I get my pants on. So, yeah, okay, I'll just reply to her and say, yes, come on in.
Shit.
We're just having a little revolution here.
A
Taking
pajama party.
what was that? Yeah, pajama
Pajama
party.
party.
That was pretty. I don't have my pants on. FYI. Not that it matters. Top left. Okay, Tracy.
Yes.
I know I'm just saying, there you are
Okay.
in my
There I am.
inbox.
Okay.
Think. No, didn't hold it quite. Oh, copy. You did it perfect.
Copy link.
Copy. Go to text. Messages. Jail. Paste. Okay. And then arrow sound. Okay, top left. And swipe up and we'll check.
Check what?
Oh, could you email me the link?
So I can go
Yes,
from
I
the
will. Top
computer.
swipe up. Okay, messages. Yep, no, just forward.
Oh,
Yeah.
right.
Forward. Okay. Enter. No, top one. And yeah, sound. Swipe up and we'll check. Go back to.
Check what?
Oh, could you feedback?
So I can go
Yes,
from
I
the
will. Top
computer.
swipe up. Okay. I'm on it. Yep, no, just forward.
Oh, right.
Forward. Yeah. Enter. No, top one. And yeah, sound. Swipe up. Go back to.
Check what?
Feedback. Yes, I will. Top swipe up. Okay. I'm on it. Yep, no, just forward.
Oh, right.
Forward. Yeah. Enter. Yeah, top one. And yeah, sound. Swipe up. Go back to.
Check what?
Yes, I will. Top swipe up. Okay. I'm on it. Yep, no, just forward.
Oh, right.
Forward. Yeah. Enter. Yeah, top one. And yeah, sound. Swipe up. Go back to.
Check what?
Yes, I will. Top swipe up. Okay. I'm on it. Yep, no, just forward.
Right.
Forward. Yeah.
Seems like you just left.
Yeah. So you didn't miss me.
I did. I just
Jane says that she is here, but she cannot hear anything. And I also see that her camera is turned off, but she said in the chat that she's here. Oh, now she can hear. Okay, good.
Hello.
So it's got to get you that we can hear you, Jane.
I just unmuted myself. Does that?
Gotcha. Yes, there you are. Hi.
Hi.
Jane says that she is here, but she cannot hear anything. And I also see that her camera is turned off, but she said in the chat that she's here.
I can hear now.
Oh, now she can hear. Okay, good.
Hello.
So it's got to get you that we can hear you, Jane.
I just unmuted myself. Does that?
Gotcha. Yes, there you are. Hi.
Hi.
Jane says that she is here, but she cannot hear anything. And I also see that her camera is turned off, but she said in the chat that she's here.
I can hear now.
Oh, now she can hear. Okay, good.
Hello.
It's got to get you that we can hear you, Jane.
I just unmuted myself. Does that?
Gotcha. Yes, there you are. Hi. But she cannot hear anything. Is turned off, but she said in the here.
I can hear now. This is like Groundhog Day. Everything is repeated over and over.
I'm wondering if someone has the other, like the YouTube video playing in the background, because there might be a few minutes lag. If you can make sure you have turned off the YouTube video connection, everybody.
This is
So
like
we're not hearing
Groundhog
that.
Day. Everything is repeated over and over.
I'm wondering if someone has the.
Hi, everybody. It's just Mark here. So it sounds like that somebody might have a YouTube stream open in the back. If anybody was watching that on YouTube and was unmuted while they were talking, it just sounded like there was like double sound. So I think somebody might have the stream open, and so it's kind of coming through that way. Hi, everybody. It's just Mark here. So it sounds like that somebody might have a YouTube stream open in the back. If anybody was watching that on YouTube and was unmuted while they were talking, it just sounded like there was like double sound. So I think somebody might have the stream open, and so it's kind of coming through that way.
Mm-hmm.
Here. So it sounds like that somebody might have a YouTube watching that on YouTube and was unmuted while they were talking. It just sounded like there was like double sound. So I think somebody might be so it's kind of coming through that way. So it sounds like that somebody might have a YouTube watching that on YouTube and was unmuted while they were talking. So it's just kind of coming through that way. So it sounds like somebody might have a watching that on YouTube and was unmuted while they were talking.
I'm going to leave and come back so I can shut everything down in case it's me.
So we'll see if that helps. I'm not too sure where that recorded sound was coming from. That's really odd.
So Jane is right. It was her, right? It's not happening now.
Yeah, I think she must have had it's really weird because it was repeating. So that's why I'm like, was it really YouTube? I'm thinking like, yeah, she might have had a stream open and a tab that she wasn't aware of or something like that. Or it could have been just a kind of a glitch. But we'll hopefully when she comes back on, it'll fix the issue.
Mark, you're getting the message from the cart?
I am. Yeah, I just
Person.
assigned the captioning privileges, so that they should be sorted out now.
Okay, good. We'll just wipe that message. Sorry to the captioner and to everyone who relies on the captioning. I think that was a glitch. Tracy, what do you think?
Absolutely, because and I think I think usually when everything happens, it's my fault. So I was checking on Zoom to get the link to tell people to join on Zoom, because the link that was connected with here wasn't like working. Somebody told me. So anyways, I had it open and then I closed it when I realized there was an echo, but it kept happening. So I think maybe both of us had it open. Because it was like Groundhog Day, right? We were hearing this last little bit of conversation over and over.
It's going to be a really cool musical effect.
Yeah.
Okay, like, I don't know what kind of music, it would be very modern, same field. I texted her and told her we'll let her back in now if she behaves herself.
Well, I don't know. Behavior is optional.
You are.
It doesn't last long.
How come you're on there twice?
Because I'm you right now.
Oh, right now you're me. Right.
Yep. Right. So the other thing that I remember from your description of being in a manual wheelchair. I mean, yeah.
Of course you can.
I was in school before there were electric wheelchairs, or at least. Oh, okay. Gabrielle, top 10.
Top 10 changes
Okay.
in your lifetime. Just sorry.
Top 10 good or bad changes in disability in our lifetimes. All right, so
Start with good or bad.
Get your head around that. I think you can do either. So Tracy, if you had to think of the top 10 changes in disability, good or bad, in your lifetime, what comes to the top? I'll say power.
Go ahead, Catherine. I think I cut you off.
Oh, I just number one thing is not just power wheelchairs, but technology.
Yeah.
I remember, a guy who tried with every breath of his life to avoid having to die by MAID, Sean Taggart. He fought and fought and fought to stay at home and have home care. And when he couldn't get it, they wouldn't give him the 2 hours that he needed. He said it's a death sentence, and he requested, made a choice. Yeah, sure, a choice to have MAID. But Sean had advanced ALS, and he had his bedroom so full of technology, like his eyesight was going through. He had a huge screen. He had a dental suction machine that he was using independently. He had like everything in order to be able to live at home with his 12-year-old, I think, his
Nine or 12
young
years.
son, whom he adored and who he lived for. And this is relevant. The point is that what he said to his Facebook group is technology is our cure. And I know what he means. Like, technology keeps getting better as we keep getting more decrepit. And it's like,
You don't need
it's
to.
great. If technology moves, maybe we're just right on the cusp. So riding the wave of technology as it gets more and more powerful. But the other thing is, as that happens, it's getting more and more expensive. And none of it is covered. So maybe I would segue into one of the worst things is that our social safety net has failed to keep up with our needs, what is a real need, a legitimate need. It's not a luxury to be able to turn the TV on in your own home. It's not a luxury to be able to lock your door. It's not a luxury to be able to open the door and get out if you have to. And where in Canada are these things available to everyone who needs them or whose life would be made more dignified, whose flourishing would be more possible with them? You know, it's not a luxury to be able to make a phone call. So those are my top two, good and bad. Over to you, Tracy. Is Jane?
My the bad one, I think. Sorry, I'm just swallowing a muffin here. Is our loss of the vocational rehabilitation program. That was like one stop to get a whole basket of services organized. So for someone like me, leaving an institution, didn't even know, that when you open the cantaloupe, it wasn't rotten inside, that's what the seeds looked like, because I'd never seen one in whole form. But I was able to get my wheelchair, my income support. By that, I mean my sole sources of income, my schooling paid for, and everything I needed to go to school. So my books, my supplies, attendance service. If I was not living in where I was, I would be able to hire my own attendant. If I'd known what I was doing. But all of that was all together. And then, and of course, a payment for transportation. So over time, with that program being disbanded, it was felt that because there was like in Ontario, in Toronto, there was Real Trans. They didn't have to worry about paying for transportation because you would just take Real Trans. It was the cost of it was bus fare. And they thought you'd apply for a loan like any other student would for your tuition, your books, your supplies. And then your income was through ODSP. It was just felt like it wasn't needed. But it meant that from the perspective of someone with a disability, you had to go through multiple channels to get everything met and done. So I think the loss of that program as a way to coordinate your services is a loss. And the other thing on the plus side, I put a couple of things. I put certainly direct funding for attendance services as incredibly useful because you get to live wherever you want to live. You get to hire whoever you want to hire. As long as there's enough people out there in the job pool, you can find folks. And you're given a bank account with a float, so it's not like you have to pay for that and then get reimbursed later. It's like you've got a bank account open with your first couple of months of funding, and then as you use it, it gets replenished. So that program is very, very useful. I would definitely say that.
Hello.
Yeah, I'm just thinking about, I have my second one in mind, but I'm going to stop there and let Jane turn it over to you, Jane.
Hi, it's so good to be here. I'm sorry for all those technical glitches and sound feedback and so on. I know you've been at this for quite a while. You must all be exhausted. And I've been trying to do what I can to revive my activism from 30 years ago when I wrote a slew of songs about disability rights issues. And then I kind of went quiet for a while. And during many of my relapses, I lost the ability to play guitar, which has hampered me somewhat, but not enough to give up. And it's like anything with disability, right? You just find another way to keep moving on, another way to do things. And if you lose one thing, there's got to be something else. And I know if I had time, I would get somebody, a great guitarist like Moon Joyce, maybe, to help me play these songs again and keep me singing. But for today, I can read the lyrics of a song I just wrote last night at the 11th hour, thinking there's got to be a song about this bill and somebody's got to do it. So it better be me. So I wrote Stop Bill C7 Now, and it needs a tune. I've got lots of tunes going around in my head, but nothing that's really landed yet. So do you want to hear the lyrics?
Yes, we do.
Okay. Stop Bill C7 now. They will vote on Bill C7, an invitation into heaven, a chance for us to leave this earth too soon. Aren't we lucky, so you say? We can die and go away, end our pain and leave this world. How opportune. But wait, what are you saying? That my life is not worth saving? What do you know about the way I live? I have friends and I have love. I have hopes I'm dreaming of, and I value everything I have to give. Don't offer me the right to die with this law that you've inscribed, this law based upon your ableist assumptions. If you could not wipe your bum, you'd think life was surely done. Life is so much more than just our body functions. We need laws that help us thrive, laws that keep us all alive, laws that let us live with equal access. Let us stay in our own homes, give us support to live alone, vote for laws that lead to health and happiness. Bill C7 must be upended. We don't need MAID to be extended. There is danger looming large within our nation. There are many lives at stake. Stop before it is too late. Stop this shameful, harmful, wrongful legislation.
Jane, that is wonderful. What kind of tunes do you have in mind? Like
Well,
one
I'm
of
thinking
adding
it
on to
needs-
one of your existing ones, or?
It needs to be sort of a marching song, a rallying song of some kind, but then there's parts of it that are almost hymn-like. Well, you know. So yeah, I'm going to keep working on it. And even if they dare to pass this insane law, we still need the song. We still need to keep up the fight. We shall not give up the fight. We have only started. We have only started. We have only started. We shall not give up the fight. We have only started. We have only started. We have only started.
Mhm.
So this morning I sat down as soon as I got up and grabbed a cup of coffee, which I can do now. I've had varying degrees of disability, as you know, and times when I couldn't even feed myself and times when I could. And it's all good. It's all possible. And I know, as someone who's had to have other people wiping her bum on many a glorious occasion, that it's not the end of the world. And
Oh,
we've
the
got to
door is
do
clear.
something to
Yes,
stop
you remind
people
me of that.
from thinking that disability is worse than death. It's just madness that this attitude prevails in 2021, and all the advocacy work, all the work we've done on human rights, everything can't be set back this way. This is just so outrageous and shocking, but people still think that somehow they're doing a good thing if they let disabled people have the chance to choose death. That this is what we want. This is disability rights. This is something that is good for us. It's just so mixed up. So I wrote an updated verse to The Fishing is Free. And perhaps if you don't remember how The Fishing is Free goes, all my songs were and are still somewhat satirical, tongue in cheek, but with a very, very serious message at heart. So I'll sing you The Fishing is Free and add my new Bill C7 verse. The fishing is free with your disability. You don't need a license like the rest. Movies are half the price. Well, isn't that nice? And the parking spots are nothing but the best. Don't you wish that you were disabled? Disabled is the better way to be. With crutches, canes, and braces, and wheelchairs to run races. Don't you wish that you were just like me? With wheel trans to get about, it's a wonder we go out. It's so much fun to try to book a ride. You phone 4 days ahead, and if you're lucky, so it's said, you might get there, but if you don't be surprised. Don't you wish that you were disabled? Disabled is the better way to be. Some chairs are motorized and high-tech computerized. Don't you wish that you were just like me? The deaf have got sign language, the blind have got their dogs, their loyal, trusted guides are at their sides. Well, everyone has their vices, but we've got our devices. Don't you envy us our privileged lives? Don't you wish that you were disabled? Disabled is the better way to be. When we go out, it's really neat. We're always sure we'll get a seat. Oh, don't you wish that you were just like me? No one knows just what to call us, which label should befall us, and there's some dandy terms from which to choose. My favorite's wheelchair bound, 'cause it has a bondage sound. It's fun to guess what term they're gonna use. Don't you wish that you were disabled? Disabled is the better way to be. There's special entrances in stores. They let us in through the back doors. Don't you wish that you were just like me? I tell you, we've got all the breaks 'cause we've got what it takes. I haven't even mentioned income tax. There are credits and reductions to give us tax deductions. When April comes, I guess we can relax. Don't you wish that you were disabled? Disabled is the better way to be. With all these benefits and perks, that's how the system works. Oh, don't you wish that you were just like me? Pack up all your gear, 'cause moose season is here. Disabled people get to jump the gun. We can start a week ahead to shoot the creatures dead. So look out, moose, you'd better start to run. Don't you wish that you were disabled? Disabled is the better way to be. with government regulations and special dispensations. Don't you wish that you were just like me? With Bill C7 set to pass, what more then can we ask? We've got death to see us promptly out the door, but we've got so much more to give. We need bills that help us live, or we simply can't go fishing anymore. Don't you wish that you were disabled? Disabled is the better way to be. Now we can die before our time. Do you really think that's fine? Oh, don't you wish that you were just like me? Don't you wish that you were disabled? Disabled is the better way to be. Now we can die before our time. Do you really think that's fine? Don't you wish that you were just like me? So that's The Fishing is Free updated for 2021.
Wow.
This song could get longer and longer and longer if they keep trying to pass ridiculous, outrageous legislation.
Yeah.
There'll be plenty more verses to come. Does anyone have any questions for me about what I do and why I do it, or anything related to this?
Hi, Dean. It's a wonderful verse. This is Tracy Godell speaking. Thank you so much for writing that. Was it like, were you asked to write something, or were you compelled to write it? How did that come about?
I was compelled by my inner voices, I guess, because when I heard that this was happening, I just thought, I have to do something. I can't let my community down. I can't let Catherine and Gabrielle down, who are doing so much work on this. And Catherine, and I know many others, have been working to fight this legislation for so long and have worked so hard. And I've been on the sidelines. I've been watching, I've been cheering, I've been angry, I've been outraged, but I just haven't really known what to do. And I just, last night, as I said, at the 11th hour, I thought, what are you saying? You don't know what to do. You're a songwriter, for Pete's sake, sit down and write something. So I just sat down at like literally 10 o'clock last night and wrote Stop Bill C7. And then this morning when I got up, I had The Fishing is Free bouncing around in my head. And I thought, that needs another verse. I have to add to that one. So yeah, it's my own inner compulsion to do something. And I think the realization that it's no good to say, I don't know what to do. It's no good to say, I can't do anything. It's a matter of doing what you can do and sitting down and doing it, or rising up and doing it. And like I said before, it's like everything with disability. You don't give up. You don't say, oh, now I can't use my left hand, so I guess life is over. No, you use your right hand, and then your right hand becomes functionless, and you say, well, I have no hands now, I guess life is over. No, you use your mouth stick. You poke it and you use it and you bite it and you make things happen. You push those buttons, literally elevator buttons. I remember pushing those with my mouth stick. I remember dialing the phone, pushing the buttons with my mouth stick. And we've got to push the buttons of our government in the hardest, angriest ways we have, to show them that they can't do this to us. Why are they offering us the chance to die? Why aren't they legislating access, laws that include support so people don't have to live in nursing homes, palliative care that gives people the chance to live out their lives, not end them just preemptorily, just too soon? And I just started thinking about all of that and thinking, I have to do what I can do. And what I can do is still sing. And there's a lot to be said for singing as a way to rally people, to get people engaged. And we need people watching this. We need people watching us. We need people engaged with us. We need people to get it, to get it. That disability is not the end. It doesn't end anything. And the phrases like, I don't want to end up in a wheelchair, are still in common usage in the language that we hear today around disability and around people's attitudes to disability. It's like the wheelchair is the end, or losing any of our senses, losing one's sight, losing one's hearing. Somehow that's the end. No, it's the start of something different. If you lose something, and I know this from inside my heart better than many, many people do, because I've been in and out of disability. I've been totally paralyzed on a respirator, quadriplegic, my face paralyzed, everything paralyzed. But there was still reason to keep going and to find love and to find the things that I could do. And while I was still quadriplegic, I did things like join a choir, edit a newsletter, direct my own care because of the wonders of direct funding that you were talking about, Tracy, and what that enabled me to do to live an independent life. But without those supports, that wouldn't have been possible, and I'd have to find another way. But I still couldn't see giving up because life is precious and valuable, and I have something to give, whether it's through any physical interaction with society. It may not be, but I still have something to give with my thoughts and who I am and what I have to say. So I'm absolutely rambling. I know.
Yeah.
I don't know if I've made any sense in the past 2 minutes of this little rant, but yeah. So I felt compelled to try to do something that I could do.
Well, it's wonderful. And Jane, I think like you are in a very unique position, because I think of the thousands of people that have registered their support of expanding medical assistance in dying, it's because of their fear of what living with a disability would be like. They're afraid, like, what if I get this? What if I can't speak? What if someone else has to wipe my bum? Like you hear that all the time. You know, you hear that all the time. But like there's that fear of that what they imagine like life could be like, and they don't get to see anything other than disability as a tragedy. You know, like the happy ending in a disability movie is a person gets a way to kill themselves, like that's a happy ending, or they get cured, right? And so that's a happy. There's only like two happy endings if the protagonist of the story is a person with a disability. So people have this sense, and I remember speaking with a friend of mine who was a police trainee, and being in a bar, and there was someone in the bar in a wheelchair, and he's like, oh my God, you know, if that ever happens to me, he said to his friend, just shoot me. But when it actually happened to him, when he was injured and broke his neck and was paralyzed, he says, that will to live is so strong, you know, and he went through his rehab, and he found a job that he could do. It wasn't in policing, but he found another job that he could do, and it was in the disability community, managing support services for folks. He eventually got to move back to his hometown to do it, where, you know, he was
from there and knew like the culture and lots of the people there. Met his wife before he moved, and anyways, things worked out well for him, better than he might have ever imagined, right? So what people imagine is so off base from the reality. And I just wonder, you've kind of been like that song, both sides now, like you've lived on both sides back and forth. And I just wonder if you could speak a little bit to that, like, to speak to what people's fears are, what's real, what is imagined, and like, what is your experience?
Well, you're right. I mean, I did go through that thinking, oh my God, I can't imagine living with attendant care. How do you have somebody arrive at 7 a.m. and drag you out of bed and shower you and feed you and dress you? It seemed impossible in some ways because I just couldn't imagine it. And then like the police officer you were just describing, then it happens and there you are. And you know what? You find that it's just that kind of attendant care becomes the background of your day, not the focus. And how you get out of bed and how you get your clothes on and how you get your nourishment, basically how you get set up for the day, is all background to what you're then actually going to go and do. The books you're going to read, the people you're going to meet, the things you might do on the computer, on the internet, the ways in which you find to participate in the world around you. You find you can do it. It's different. It's just different, but it's not horrifying and it's not the end. And I found, I always found things in common with my attendants that made having a shower with somebody else actually fun. I had an attendant who was from Nigeria quite recently, and realized that I still knew all the words to the Nigerian national anthem because I had taught school in Nigeria back in 1980. And so there we were singing the Nigerian national anthem together in the shower. I mean, who gets to do that? Only people who are lucky enough to need support to have a shower. Otherwise, you're singing alone in the shower. How sad. So needing to have somebody else with you in the bathroom sounds horrifying to many people, but you can turn it around and it becomes a choir in your shower. So, I mean, there are funny things like that happen, but it's just that realization that life goes on in whatever way, in whatever form, whatever shape it ends up taking. And some of that, a lot of that, we have no control over whatsoever. But what we do have control over is our attitudes to.
Absolutely, absolutely. So thank you so much, Jane. We're going to move over to our next broadcaster who's coming online now. And please stay on if you can. It'd be lovely to have you here and to comment as we go on. Come and go whenever you want. But that'd be great. Thank you so much. And we hope you'll be able to share the words to your next verse of The Fishing is Free with us. Love to have it.
Thanks for having me. And yeah, I'll stick around and I'll stop talking so much, but I'll be in the background and on your side and by your side and here.
Thank you, Jane. Oh, it was just wonderful. But yeah, don't go away. And absolutely. It's great to see. Oh, yeah, and Pat said, be sure to tell Hillary she doesn't have to keep dodging the camera. We don't mind. We're in a safe space. There she is. Okay, back to you, Tracy.
All right. So we've got Erin, I think, coming on next, and I haven't been given any introductory notes, so I'm counting on everyone to introduce themselves and what they're going to do. So over to you, Erin.
Hi, I'm Erin, and I'm nervous now having to follow Jane because that was really, really good. And I'm mostly going to be reading my stuff, so it's more like story time than entertaining. So I hope I don't bore everybody. But I have many disabilities. I kind of joke that I've got a disability collection at this point. I have EDS and MCS and lymphedema, and you can kind of see my world's saddest wine rack that I've repurposed for my lymphedema hanging rack for my legs over there, because my legs tend to expand throughout the day and then I have to be in it for 2 hours to deflate them. And my daughter calls it the deplumper. So sounds a little bit like Darth Vader on a bad day. So that's where I live in the evenings. But I'm going to be talking to you mostly about environmental sensitivities and multiple chemical sensitivity, because those are the things that mostly impact my access and people that I know who are actually applying for MAID because they do not have resources and live in poverty, more so than just have the disability. Because if you have money to maintain yourself, then everything is a lot easier. So I'm the chair of the Environmental Sensitivities Coalition of Canada. It's a new group. It was created almost 4 days ago now, and it currently has 55 members. So our goal is to review existing accessibility and human rights legislation and update it so that it's relevant and impactful for people with environmental sensitivities of all kinds. We also intend to create missing accessibility legislation, which is pretty extensive. So I have, like I said, multiple chemical sensitivity, and I'm going to go a little bit more about that later, about how that works. But environmental sensitivities include many, many illnesses, chronic illnesses and diseases like allergies, dermatitis, asthma, mold sensitivity, other respiratory disorders. I have Mycobacterium avium, one of my collection, autism and ADHD, which I also have, migraines, mast cell disorders, Parkinson's, multiple sclerosis, and pretty much anything where you're affected negatively by something that's happening around you or something that you can ingest. So while those of us with multiple chemical sensitivity and other more highly reactive disorders have a much harder time, there's a lot of people who have smaller reactions, and we're all on the same team. So recently, 3 of the people who are currently in the Environmental Sensitivities Coalition applied to be on Accessibility Standards Canada working group for workplace standards for COVID. Online, we had flagged them a few times that the standards that they had put out were not adequate. And they had explicitly stated that workplaces should be asking their employees for guidance on what is safe for them, which makes the employees have to disclose their disability to get accommodated. And that's against human rights legislation. So often people who disclose their disability, who have these more reactive issues, they're not accommodated, and instead they're just fired. This has happened to most of the people who I know who have multiple chemical sensitivity. And especially in the midst of a pandemic where everyone is panic spraying alcohol-based products on everything because they are explicitly told to by Health Canada, instead of being told to use accessible products that are peroxide-based or simply unscented soaps, which also kill the virus, it would be really, really hard for an employee to advocate for themselves. So you're not only asking them to go against the major health authority, you're asking them to set their fears aside, which is really not an easy task. And unfortunately, we found that you need to be a part of an advocacy group in order to be invited into any of the working groups. So if you want to affect that legislation. And we had mentioned to them that this was a little bit discriminatory for folks with our medical issues because no group existed to advocate for people with environmental sensitivities, let alone like the most severe of us. And the standards group then amended their request and said, if you were a disabled person who is applying and you're not a part of or not paid by a group, that you be paid for the participation. So 3 of us applied and were denied. 2 of us never even received a notification of the denial. So what do you do when the group that is supposed to be looking out for you, be the health agency for your country, is actually your biggest access barrier? So you file a whole bunch of human rights complaints and then you start your own coalition. And that's where we are now. So right now myself and about the 55 other people are going over existing legislation. We're creating amendments and logging all of the missing accommodations throughout the disabilities. So we're getting a group consensus on our accessibility needs so that we can have ambassadors from the coalition sit on advisory boards throughout the country and advocate for us so that we too can access spaces safely. Now, in regards to Bill C7, one of the members in the group, she's actually applied for MAID, and her application is coming up in about 10 days now. So it's very personal. Several of the group members are living in complete poverty. They're on disability support programs, which the provincial ones are really underfunded. And they're unable to access the most basic healthcare, food, safe air, water, or service people to even come into their low income housing. They're told that it's up to them to find safe utility workers because the people who are running the housing, they just don't know how to accommodate them. And the utility services are not providing staff who are adequately unscented and chemical free to enter their apartments safely. So as many businesses right now are dousing all their delivery packages in alcohol-based products, again, because Health Canada told them to, even the food is contaminated with disinfectants. So like a while back at the beginning of the pandemic, I got some raspberries from Zayre's curbside pickup. And even after washing them, they made both my daughter and I sick just from putting one in our mouths. My daughter also has the multiple chemical sensitivity and she gets nosebleeds amongst other things. And we had to throw them out in the compost. And that's a luxury to be able to do. I am one of the most privileged people I know with my disease. And my experience, while very limited in healthcare and other accesses, is not even nearly comparable to what someone who is living on disability support has to go through. The idea that a person who is not even provided a safe living space, food, or access to hospital has more ready availability to medically assisted suicide than they do to the supports that could help them be well and get healthy is just staggering to me. It's like tantamount to social murder. So it's not mercy, it's not control over your death. It's being pushed towards suicide because your life is not livable and the human rights that are supposed to guarantee you your access are doing nothing to help you. So if anybody else out there has an environmental sensitivity of all kind, you're interested in being counted or being heard or participating in creating the standards that will represent the human rights of people, then I invite you to come visit me on Twitter. I'm at Erin. I'm not shy. You can talk to me about anything. I will chat you back, follow you, we can message and everything. And I'll give you all the information on how to join the group and you can become a part of the consensus there. So next I'm gonna just tell you a little bit about multiple chemical sensitivity. And I wrote this on International Disabled People's Day because the focus was on invisible disabilities. And this is like, I have all of them. So we got a big group. Environmental illnesses, they're a group of disorders and they're covered under human rights in Canada and in Ontario as a part of the AODA, where I live. But they're hardly ever included in the accessibility plans, like I mentioned. So people who have MCS can react to a large variety of things, and it's often along the volatile organic compounds groups. So these can be naturally occurring, like in essential oils, tree saps, and pollens, or they can be chemically processed. Usually there are natural-based ingredients in the processed product that's a root of the issue, but they're ubiquitous, and current labeling laws don't protect people with reactions outside of the most common allergies. So the most common sensitivity for people with what I call beginner's MCS is perfume and scented products. Features of MCS include migraines, hives, eczema, food sensitivity similar to mast cell activation syndrome, brain fog, dizziness, asthma, hair loss, psoriasis, nervous system control issues, muscle control issues, vomiting, diarrhea, breathing issues, emotional regulation issues, body temperature regulation issues, sweating, nosebleeds. I'm sure there's other things I've forgotten. The day that I wrote this, I had ran the dishwasher and they have rubber gaskets. And so when you do that, then they off gas, and I was writing at the time, so I'm like, I'm sure, I don't know if I missed everything. I have lung lesions, and they're caused by the chemicals, but I had to ask multiple doctors before one even gave me a CT scan to prove that I even had them, because the knowledge management throughout the medical community for this is so lacking. So there's only a few treatment centers in Canada for environmental illnesses, and there's no environmentally safe hotels or places to stay if you can get an appointment at one, because hotels are not forced to be accessible. Most even spray signature scents around their properties. It was over 1.5 years wait to get into the Women's College Hospital in Toronto because it's not properly funded. There are no official treatments. They try to get you seen by as many specialists as they can for the associated symptoms, but often people with MCS don't have traditional test results, and then you're left to deal with your disease alone. Or you're forced to try out alternative medicines, which are not covered under provincial healthcare or insurance or disability support programs, even if you have access to insurance. Because in Canada, we do not make it so that if you get private insurance, they can ask you for your priors, and I've been denied from having cancer prior. So this leaves the MCS community vulnerable to scamming practitioners and commercialized healthcare fraud, which often makes their issues worse. And the alternative practices that do help, they're not sanctioned, and there's been no funding put into the research or attempts at creating the medicines. Promising medicines like low-dose naltrexone are not usually prescribed for the symptoms related to them, and you have to fight to even get a doctor who is familiar with the illness who will try to treat you. And just as an aside, since I wrote this, I have since got LDN as my prescription, and it totally works. So bug your doctors, try to get them to do that for you if you've got MCS. And as I said, the knowledge management on its illness is so bad amongst the healthcare practitioners that people are often prescribed antidepressants and then gaslit about their symptoms. After having anaphylaxis while traveling internationally, a doctor in Toronto Emergency General told me there was no such thing as MCS and that I was having a panic attack. So I went home and I vomited foam on my own. I got no blood tests to capture the moment. And people who have EMF sensitivity are the hardest hit with this issue out of the environmental illnesses. So the only option really right now, and for most people, is avoidance. And for a lot of folks, that means complete isolation. And some of the people now, just having gone through the COVID isolation, just lose their minds when they don't have access to anything. So could you imagine it being always? You don't have safe access to healthcare, hospitals, doctors' offices, physical therapists, and even dentists and dermatologists often sell scented products, and they use essential oil diffusers in their offices, making them amongst the worst of the healthcare providers for accessibility. So even now, with the inaccessible cleaning products being broadcast as the only safe option by Health Canada, we've been completely cast aside, it feels like. And Health Canada even on their website warns about the dangers of indoor VOCs, and then they've created this situation where they're unavoidable. My daughter has no access to her school. So she's been remote schooling the whole time, and I am high risk, so she'd probably be home anyway, but we don't have the option. And it's gonna take a long time for these things to clear. And I've mentioned this to the board of trustees for her school 3 times, and I'm still waiting on replies to how they're gonna fix it. And the people with MCS who have to do treatments to get these pervasive products out of like drywall and other things like that, there's off-gassing protocols we use, and they have limitations. So the pharmacies, so if you want to go get a prescription, they sell perfumes. And they're often the only places you can go to get flu shots. Canada Post locations are often located inside dry cleaners or perfume stores. And pharmacies don't even offer accessible curbside services depending on where you live, even during COVID. We do not have regulations on home dryer venting filtration, to stop the onslaught of dryer sheet perfumes that affect people and the environment. Airlines spray pesticides on airplanes, and they're not required to notify passengers. Many cleaning standards mandated by the government for food services are inaccessible, and that bars disabled people from working in entire industries. So once you're pushed out of the workforce by the inaccessible standards and unenforced standards, you have the option of just not having your disability covered under Canada's disability tax credit program. And then you have to fight to be on provincial disability, and it's below poverty rates. Even the assistive device program in Ontario doesn't cover air purifiers needed to maintain our health. I actually had to turn mine off. I've got like one per room, so it sounds like being in a wind tunnel in my house at all times. So I didn't want to distract everything from that. That's why my voice is a little scratchy right now because of that. So also they're not tax deductible, and neither is infrared sauna use. And those are the only suggested treatments right now. There's no safe homeless shelters, and most low-income housing is not chemically accessible. There's no scent-free, low VOC long-term care centers. Food banks are not accessible. They can't handle requests such as no nightshades, pesticides, or foods without preservatives. We don't have VOC ratings on products. We don't have a scent-free path similar to gluten-free paths for foods, and there's often contamination. So I need a back brace because of my EDS and scoliosis and degenerative disc disease, but I can't get one because I can't find one that I don't react to. So we're recognized in Canada, but we're not supported or treated. And we need that to stop because they can't offer people suicide when they don't offer them life. So funding research into treatments and capturing genetic information for those afflicted to add to drug reaction databases needs to happen. Clearly stating accessible standards and not forcing disabled people to disclose their illnesses to get accommodations needs to happen. Updating inaccessible workplace standards, like for commercial kitchens. Creating a VOC rating standard for products as a part of the environmental carbon emissions legislation. Creating a scent-free food chain. Creating accessible housing. Funding disabled people who can't work and providing them with the tools they need to get well, like knowledgeable doctors, air purifiers, and grocery cards to purchase their own foods. And hiring people with MCS to create your policies and solutions. So something that anyone out there could do personally for us is stop using dryer sheets, because not only does it emit from you, it emits into the air, and it's unsafe to walk down the sidewalk. And if you enjoy perfume, please enjoy it in your home so that other people can enjoy leaving theirs. And I'll cut out the other one thing I was going to do so I can get you back your times here. But I just have an op-ed that I wanted to read. So should they publish this? Here's your preview. Kindness is good for your taxes. Helping people can help you. So we have a universal basic income is a federally accepted way to help people who the provinces are failing and save money. Currently, we fund food banks that don't cover medical diets and they limit visits. People then need to go to the hospital to get vitamin infusions, which are covered and more expensive. They still get sick without food and need hospitals again. People like me who can get well enough to work if properly fed by means like the autoimmune protocol diet, they stay sick and they need permanent support. Half is paid in administration costs for food banks and in support workers managing small money payout requests. Most people can't afford rent at an individual cap of $1,169 per person on ODSP. Ontario Works is even less. And if you think this seems inefficient and cruel, you're right. And Lord help you if you need physical therapy after an accident because it's not covered, nor are many of the medical devices. If you have lymphedema post-cancer, the assistive device program pays for 75% of a maximum of 3 sets of 2 outfits each in a 12-month period. 2 outfits provided, 1 for wash, 1 for wear. So if you need full-length stockings like I do, but you're on ODSP, that essentially means you have 2 pair of underwear for the year. It's not very fancy. So without them, my legs expand so much I can't walk. And even 25% of $140 stockings is an impressive cost to someone on disability support. Most chronic illnesses medicines are not covered under the Trillium program here. Accessible low-income housing has a 10-year waiting period, and units for people with environmental sensitivity do not exist. Ford currently is forcing everyone on social assistance to reapply right now, and is mandating disability and social supports a municipal concern. That causes your property taxes to go up and rent to go up because landlords are allowed to increase by too much each year. Even during a pandemic, there are no provincial bans on evictions. People become homeless, placing even more funding needs on municipalities. Shifting costs to UBI increased people's mental health and physical health in all trials and studies, because relying on begging and charity is depressing, to say the least, and is the best chance for them to get well and potentially be employable. So in high school, just a moment, I had to move out on my own. And, oh, just a moment. You're gonna come in for a sec? So this is what remote school is like when you're trying to get stuff done at the end of the day. This is my daughter, Agent. All right, I'm doing my thing. Can you scooch out for a second?
Okay, that's lunch.
I know it's lunch. I'll be with you just a minute. Close my door, please. Thank you. So, sorry. In high school, I had to move out on my own and I was on welfare. And I went to school and I had 2 jobs at the same time. And I would have been out of support programs much faster and might have been able to afford to finish university at that time, but OSAP was cut by the Harris government. I left university, I had a minimum wage job at all times, but I did not qualify for support and regularly had to collect bottles to make up incoming GOT food, most of which was moldy or I couldn't eat from the food bank. So I know this personally. I scraped by for years and eventually worked my way up to attending university through night schools and weekends. I paid off my loans and I embarked on my careers. However, some people can't work due to disabilities. And I was in this boat recently when I lived in Toronto next to a factory operating illegally in the basement of a building next door, blowing toxic fumes into my yard. It took 2 years fighting the various government agencies to have it shut down. And I had enough savings to wade through that, but 2 years of Toronto mortgage and healthcare costs is too much for most people. People like pretty much everybody would have gotten sick and needed support. And my taxable medical costs the first year that I was sick were more than the yearly income for a person on ODSP. It did not include osteopathy, air purifiers, and supplements, which are incredibly necessary for someone with my disabilities, but they're somehow not deductible. And it's cruel to not provide a path for health and yet berate a person for being unable to work and instead give them a path to death. So everyone deserves to live above poverty no matter what. No one else should have to struggle like I did. Money for the program should be coming from closing tax loopholes on the extremely rich and corporations like Amazon, who pays nothing compared to the average person. The hype about scammers on systems should be directed at these businesses who put their employees in the position where they get sick and they can't recover. These are real people who need our help. And I, for one, am happy to endorse a system to help them. So everyone is one bad day away from a disability, and someday it might be you. And we should be helping people. And that's what I got.
Erin, thank you so much. And it was great to see your daughter. Don't apologize. It's wonderful. We are real people with real lives, worth hanging on to.
Yes, absolutely.
Yeah, so this is why we think people really misunderstand that with regard to Bill C7. So thank you so much. And feel free to come back and watch through the YouTube channel later, or to, join us again. So
thanks. My daughter told her class today, she said, my mom's going to be on YouTube to tell the government not to suicide poor people.
Right? She's right. I,
All the grade 4 class now knows.
yeah, I love this phrase you used around social murder, that's very powerful. So, thank you.
Have a great day.
And Catherine's thanking as well. Her mic wasn't on, but I could read her lip. Okay.
Very much, Erin. So Tracy, I'm
Yes.
just jump in, and I'm sure Jane won't mind. Heidi and Michelle Stack are back, and they have a little stick that they would like to present. So let me, one of us, whoever's quicker, get Michelle in as a presenter.
Okay, I don't know if I've got Michelle's coordinates.
Okay,
Well, I can do it.
I'll do it. It's right here. She's in the room.
Oh, we're saying it's in the room?
Yes. Yep, I've just promoted her.
Okay, good. The power to promote and demote, eh?
Yes, it's
And
marvelous.
unmute.
From bed. Something we do.
It's kind of like
I'm lying in bed on life support.
we need to do that Michelangelo painting, of Adam and God touching fingers, and just have you as one of the characters in that painting. Yes, yeah. Yes.
Hillary or Jane can point up to you, Pat.
Oh yeah, Hillary, point up to me.
No, Jane can do it.
Oh, Jane
there.
can do it. There we go.
Look at that shoulder action. Oh,
Power to the people.
All right, so we're going to go to our next segment.
Before I mute, I promise I'm going to mute. Jane, you can't leave because you have to tell of your prowess at eating potato chips. Later. Go, Heidi, or go.
I got. Hi guys, I'm really happy to be here today. Michelle, can you echo?
I'm
Hi, as most of you know, I'm Heidi Jansen. This is my sidekick for many, many years. Michelle Stack. And we're academics, and is this our revenge? Becoming academics? Yeah, we became academics out of revenge. Yes. We met in high school when we were giving mainstream education one last chance.
I
was pushed out of. Oh, I was in a special school. Right. I was straight from a special school. And making my way out into the real world. Before I discovered there was no such thing. And Michelle was a bad kid. And I really am a miracle worker because I made her into a saint. She became a saint just for hanging out with me. Yeah, before that, nobody wanted their children hanging out with me. Yes. But our friendship almost ended prematurely. Oh, by death, yes. Yeah. When someone stuffed an entire sandwich into my mouth. Can I defend myself at this point? Of course. Okay, of course. So be careful because I'm one of the few tabs here. Don't be intimidated because I'm one of the few tabs here. Yes. So if I may, I'm from a family of 6, and eating quickly, you either eat quickly or you don't get your share. So I thought I was being pretty damn noble because I was like, hey, I'm going to share with you, eat your sandwich or I'm going to eat it for you. Right. So, but I didn't quite understand the choking part. So I did take first aid after that. And we did have somebody work with me to teach me some basics. We survive. And we survived, and we both went on to become academics, and now we teach together. And I must say it's because of you, Heidi, that I got through high school, because when I was late for class, you'd run over my feet, which was very effective behavior modification. I was your de facto aide, so when I was late, it meant you were in a winter coat. And right. Back in the 80s, there were no educational assistants, so you were stuck with me. Not stuck, but yeah. Michelle, congratulations. As of today, I'll have my queue, my place in the queue. To fast track my end, and I'm apparently next. Yes, with mental illness down the road. Yeah, no, I mean, I was thinking about that when we were teenagers, because I had attempted suicide, which is one of the reasons I was out of school for a while. And then we were at Alberta College together, and thinking about how often people assumed you wanted to die. And when you were in hospital, I'm like, I was the one that wanted to die, you wanted to live. But looking at it now in terms of, how glad I am that MAID wasn't there for either of us, right? And then looking at it too, just thinking about, the difference for people that are Indigenous, people that are racialized, that are poor, and what other speakers have talked about earlier, like it's not a choice. I mean, it's what I find so terrifying talking to tabs is a sort of that are involved in social justice, but yet somehow their fear of disability, they think should be able to trump the actual real evidence-based fears of disabled people.
The fear of what might happen to them
mhm.
was putting our lives in danger now.
Yeah, the fear, their fear of what might happen to them is putting in jeopardy your life now, right?
And I know that that was trash in my life now. The government declared me to protect the able from the cuts of disability.
Yeah, there was twice that you were declared to be too productive to be disabled and you were cut off disability insurance. Yeah,
On the first,
support. Yeah.
and then go down into my able to get back on.
And then it took such a massive effort to get back on. Yeah, and I remember the toll that had on you, right? The
Like some people, I'm old now. So the people coming up, the
mhm.
people that are gonna be like the try to I just like to know about that when they more of them.
So can I just because the memory. So I'm kind of old now, but older than me by 6 months. But the people coming up after are going to face those same and that want to go to higher education are going to face those same roadblocks. Did I get that right?
Yeah, what are the most guys what do you want to do and feel that
Mhm.
funding with
Yeah.
how many of them are going to lay or school?
Yeah. So when people aren't giving the funding to do what they want to be able to live, how many of them are going to say, screw it, I'm out of here? Even yeah, and then it'll be made into it's their choice. Yeah. Yeah, I mean, that's the terrifying, is this sort of this discourse of compassion about, like, it's just so stunning that it's made into compassion to kill people and not give them housing. There was a doc that's opposed to the legislation, I forget his name, who was saying, who works with homeless people and was saying it will get easier to get MAID than it would be to get somebody housing. And that's like, I think about the number of people over the years that I've tried to help with getting housing and that or get treatment or whatever. And it's the hoops and and then put into housing that's horrible. So yeah, it's bizarre. I mean, the conversations where people are saying, well, that's irrelevant. How can it not be irrelevant? How can it be deemed not relevant? I mean, it's.
I know you get many
Yeah, I've had many conversations with tabs who are very much into social justice, but are pro expansion of MAID. How have those discussions played out? Talk a bit about that. Yeah, I mean, I think this fear of disability, and also seeing things as static. Like when I say, well, you know, you can, like this sort of notion that one is either disabled or a tab, or that disability is a tragedy. I mean, this is the thing that always stuns me, is that hasn't moved much. When I teach classes and I ask students, think about all the times you've heard language around disability in the last 24 hours and how, like deaf to it, blind to it, like, you know, think about all the ways disability is used. Think about your first time you saw portrayals of disability, to get them just thinking about how embedded it is, so that when they see a kid, I'm in the Faculty of Education, when they see a child or an adult come into their classroom who they identify as disabled, what goes through their head before they even know that person's name. And then how does that impact the way they what their expectations are of that person. And so, and their own fears of disability, like they're taught so at such a young age. You know, it's, and then the kind of hero, I mean, you and I was looking for books on disability for a young person in my life, and just finding books that it's either the, you know, as we know, the hero narrative, like, or a child can't be just a child who is disabled. They have to be either this huge burden who has a friend who suddenly becomes an angel, which was tough on the reputation. Or gotta say, it's like, yeah, what's that? Kaboom. Yeah, no, you destroyed my reputation as being a bad kid. I had to swear even more to try and, you know, make clear that I wasn't your friend because you were just, you know, because I was an angel. Oh, when we took French together. Oh, that's right. I dared you to say something rude to the teacher in French because I knew he'd be too gutless to ask you to repeat. And so that's why you agreed to do it, because he was really pissing you off too. Yeah, so you said something really rude to him. That's right. He did say très bien. He did. And then he was, and then I think I laughed or something. And then did I? But he was so, the whole class laughed. And then but he was too scared to kick me out because he was too scared to have you in the class alone. So yeah, poor guy. Now that I'm a teacher, I have those moments where I'm like, oh, I'm not as bad as, or I'm worse than anybody I've taught in terms of, or was. Experience. It's been an interesting experience being together. Oh yeah, when we teach together, it's really interesting. That's been something that's been fascinating. Remember, I think I told you about this, where we taught, and a student came to me after he had been a special ed director for a number of years. And he came to me, he was close to tears. This was a number of years ago when you came to my class. And he said, you know, before I met you and Heidi, he said, like, when Heidi came in, I thought, oh, Michelle's such a good Samaritan. And then by the end to realize you were truly friends, and how horrible, like how to be seen in that way for both of you. And then he said, I realized that I recently kicked out a kid that was probably like what you were like. And I put a kid that was like Heidi, I just assumed couldn't go to, to university. And I put a kid similar, in a similar situation or similar disabilities right into, a non-academic track, even though the child did really well academically. And so he started crying and just said, I always thought I was so inclusive. But as the two of you were talking, I just realized how entrenched I am in ableism and how I saw myself as this hero. And now I'm looking at it going, oh my God, all the things that the reciprocal sort of learning I could have had, that was cut off in a sense because of ableism. And so he agreed to share with the class. And so there was a really interesting discussion about ableism, and then about ableism and racism in terms of how kids are labeled in ways, in terms of how Indigenous kids are labeled and sort of assumed to be non-academic, or, punitive kind of labeling that is embedded in ableism and racism. So yeah, it was a really interesting discussion. So that was one. And then when we taught this summer, the course we co-taught on technology, educational technology and disability. That was a fun course. Yeah. Yeah, some of the students were taken aback that we were actually co-teaching. We had to work with some to make sure they addressed both of us and that they understood we were co-teachers, co-professors. That's something you really taught me too, is the whole, I generally just go by Michelle when I'm teaching, but you were talking, and it of course makes sense, that for the students to even like to see you on the same level, that you need to go by Dr. Jantz, right? Because of ableism and to really, and that was something that became, I understood before, but it became so apparent when we were teaching, right? It's like, okay, I need to call you Dr. Jantz, and I need to, to make this really, really clear that you're a scholar. And yeah, had to go by Dr. Stack to try and make that. Yeah, that was a really interesting to watch, right? Is the different ways of trying to figure out how to address power and the ableism in the classroom. Yeah. Yeah. Yeah, and looking at like going back to MAID and looking at how entrenched ableism is and some of the assumptions. Sometimes when we've co-taught, we've taught with our students, it's not that they're horrible people, but they've been conditioned. And that really, you look at policymakers that are making these decisions, and I looked at it in terms of policymakers I know, like that are on the left or progressives, and I'm like, what the, but I mean, it's that entrenched conditioning that's been so rarely challenged. And there's still so little, like when I look at the university curriculums on ableism, and I mean, you know more about this than I do, Heidi, in the health curriculum, like to think that, I mean, doctors get no training on ableism. To think they're going to be have any part. Did you work at the ethics center? Yeah. Yeah, you're behind enemy lines, right? Because you work.
But look on me. Trying to flip technology and to carve out like afternoon.
You're trying to get the medical school to carve out one afternoon for disability ethics?
And they already that way.
They've already got a week on MAID. Wow. Well, remember when you gave that talk and it was a nurse who provided MAID and she had never heard the word ableism. And she assumed you would be on the same side as her. And she was like, I came back and it's like, oh, I didn't think this would be a debate. And I'd never heard the term ableism before. Like, oh my God. Like, sorry, I didn't get that was relatively early on. In her defense. Right. Right. And it was fairly early on in this process around it, MAID, yeah. And you've talked to her since then and she hasn't? The disability community has been talking about ableism for yeah, all through this process, yeah. And it still doesn't get in.
Yeah.
And that's like, yeah.
So yeah, Tracy here. So just butting in because I think that's my job. I just want to, is this a good place to cut you guys off?
Yeah.
Okay. Just in case you were leading up to a crescendo. I didn't want to interfere with that. So anyways, I want to thank you both for providing some additional context and doing your stick, as I was told to call it. So thank you very much. You've obviously been together for a very, very long time. So that is great. That's probably another subject we can talk about, our pairs of people who've been, in each other's lives for a long time and the different aspects that role has taken.
But anyways, I would like to move over to our next person who has committed to be a broadcaster for us for the next little while. Up next is going to be Dorothy Palmer. Do you know Dorothy? Have you heard of Dorothy? Maybe not. Anyways, Dorothy will be reading a chapter from her memoir, and I'm going to turn it over to Dorothy to introduce herself more fully and let us hear from her memoir. So please stick around or come back or whatever you can do. So we're going to be here for a while. Okay, thanks again. Dorothy, over to you.
Thank you, Tracy, and thank you everybody who's participating in the Disability Filibuster. As Tracy said, my name is Dorothy Ellen Palmer. I'm a disabled senior. I'm a mom of two. I'm a binge knitter. I made the shawl. And today I am going to be reading to you from the chapter on eugenics in my memoir, Falling for Myself, published by Woolsack and Wynne. This was written between 2017 to 18 into the early months of 19, well before the pandemic, but it has a great deal to say about how we got to this bill, how we got to a bill that makes it easier to kill disabled people. Governments in Canada have always wanted to make it easier to kill disabled people. And that sad history of eugenics is one of the things that fuels, as well as ableism, as well as capitalism, as well as all of the inequities of our current society that fuels this bill. So with that, I'd like to read a little bit to you all. This is from chapter 23. V is for victory and for venom. Today, I realize this. Some people want me dead. It's not a realization I faced easily. As a disabled bastard, as an adoptee who proudly claims the title of bastard, I knew, in the words of Audre Lorde, that I was never meant to survive. But when I first heard disabled activists cite the fact that Hitler wiped out hospitals and sanitariums as proof that the rise of racist white nationalism would produce a 21st century cleansing, I dismissed that idea as unnecessarily alarmist. At the time, I saw myself as too much of the historian to fall for such rhetoric. Eventually I decided this. Euthanasia is the murder of living human beings. Is euthanasia fueled by eugenics, the belief that some bodies are more worthy of life than others? It took multiple repeated examples in the news to convince me that I had personal reason to fear eugenics. It took the cumulative weight of things that I had never before set together on the same scale. Here are 5 events from only the last few months of 2017 and 18 that affected me the most. The first seems pop culture and harmless. It's a movie. Based on a best-selling novel by Jojo Moyes that sold 6 million copies and hit #1 in 9 countries, the 2016 blockbuster movie Me Before You grossed $207 million worldwide. When banker Will Traynor is paralyzed after a motorcycle accident, this young, mega-rich, handsome, smart, funny, well-educated young white man decides, quote, a disabled life isn't worth living. Despite having a loving family, despite being able to buy the best of assistive technology and healthcare, despite falling mutually in love with Emilia Clarke, the lovely Khaleesi from Game of Thrones, Will travels to Switzerland to end his life. Please let me first clarify my position on medical assistance in dying, made possible in Canada in 2015 by Bill C-14. And remember now, this was written well before this bill. Disabled people do not need to be infantilized or protected from a right to consider that choice should we be near death. We do need to be protected from all others, from family, caregivers, doctors, nurses, hospitals, institutions, and governments. Anyone who may want to make this decision about us without us. And that's exactly what this bill attempts to do. We need good health care and community care. We need governments that fund life with dignity, fund disabled life with dignity, so that we don't give up and want to die. We need to oppose the very notion that seniors and disabled people are burdens with a duty to die. And again, that's exactly what this bill does. If there are no supports, our lives become so difficult, so miserable, so poverty-ridden that MAID seems like a reasonable choice that we are in fact being forced into by having no choice. When Will Traynor, the young banker, accepts that duty to die, when he calls his disability a half-life, one it would be too selfish to ever ask an able person to share, when ending his life is portrayed as brave and self-sacrificing, abled audiences fell for it, hook and sinker. Friends I expected to know better called the movie romantic and deeply moving. When I said it was the worst of inspiration porn, so dangerous in the absence of disability positive messaging, even when I argued that no one would ever defend a movie where any other marginalized person kindly killed themselves to unburden their oppressors, too many of my friends shrugged. I heard the voice of my father a half-century ago unchanged. It's, quote, better to put someone like that out of their misery. I heard what fans were really saying. If a life of privileged disability isn't worth living, how can ordinary disabled lives possibly be worth living? There is but one Sherlockian conclusion to ableism. They aren't. On July 26, 2016, in Sagamihara, Japan, 19 disabled people were stabbed to death by a former employee of a residential care facility. He wanted disabled people dead because it would be, quote, good for the country to be rid of the burden. Some in Japanese media called their worst massacre since World War II a hate crime. Canada called it heart-wrenching. They called the murderers clearly deranged. Even my most work friends, quick to see the hypocrisy that any murderer of color is a terrorist, while any white mass murder is simply someone with mental health issues, they told me I was overreacting to call this mass murder an act of ableist hatred. On social media, disabled people feared and mourned alone. This attack got none of the attention of Charlottesville, Paris, or Orlando. There were few hearts and prayers, no Twitter campaigns. When I posted about it, few of my friends could rouse enough empathy to even push an emoji button. That's when I got it. This is the apathy of abled privilege. When disabled people are murdered, abled people shrug. I felt the punch of a similar hand in the 2017 story about a home for unwed mothers in Tuam, Ireland. For 3 decades, the same Catholic Church that shielded pedophile priests and tossed bastard babies into unconsecrated, unmarked mass grave. In the sewer system, 800 of them, babies just like me. Godly nuns chucked into the garbage, whether we were dead or not. Apparently, bastard burdens, like disabled burdens, are not meant to survive. This 4th example hit closest to home, knowing I will soon have to live in one. My former Western roommate comes from a farm near Woodstock, Ontario. I've always equated the best of small town Ontario with her generous and compassionate United Church faith. In June of 2017, Woodstock nurse Elizabeth Westflower pleaded guilty to 8 counts of first-degree murder. For over a decade, in 3 different care facilities, she'd been deciding that disabled senior lives weren't worth living. Like all terrorists, She claimed to be doing the Lord's work. As quoted in the Toronto Star of June 1st, 2017, God called her to kill Michael Priddle, 63, because, quote, Huntington's is a terrible disease. And the surge that she felt telling her to kill him, quote, must be God, she said, because this man is enjoying his life at all. Yet again, the media saw an unstable lone wolf in that nurse. There was no discussion of ableism, no discussion of hate crime, no hatred to be seen, and no lesson to learn. In this fifth example, the scales of disbelief finally fell from my eyes. With Trump's election, as the party of big business paid for tax cuts by the rich by dismantling healthcare, I got called a pre-existing condition. On Twitter, I saw disabled American friends go fearful, then terrorized. Cuts in healthcare meant they would sicken, they would die, and they did. In preventable deaths caused by inadequate healthcare, the disabled community lost activists Carrie Ann Lucas and Bill Pierce. But when activists from ADAPT fought the repeal of Obamacare in 2017, reporters only saw poor souls being dragged from their wheelchairs. They did not see an organization with chapters in 30 states fighting ableism since 1983. There was no mention of disabled history. That was my eureka moment. I realized that this historian had fallen for my oppressor's history. Yet again, just as I'd been as an adoptee, I'd been kept from my own history. I never heard the word disability in all my years at university. But of course, the whitewashing and erasure of BIPOC, working class, women's, and queer history also applies to disabled history. It's all perpetrated by the same white, colonialist, male, middle class, abled historians. It would take volumes to reclaim it all. Let's just say there are some things we should all know. In Canada, the forcible removal of Indigenous children to residential schools is the racist, genocidal arm of the colonial paternalism that saw generations of illegitimate and disabled children sent to orphanages, asylums, and care homes right across Europe. Canada has always quite happily monetized poor little bastards. From 1869 to 1948, 100,000 poor, but not always orphaned, British home children were swept from the streets and orphanages of London, Dublin, Glasgow, to be sent to as indentured servants to Canadian farmers and factory owners. Some of these poor little bastards were treated well. Some were adopted. Some never saw a school. Some were starved, beaten, assaulted, and left to freeze in alleyways and barns, including my uncle. All of these kidnappings were led by a church and a state that smugly claimed to be saving souls and saving lives. Ableism and racism conspire to justify and reinforce carceral culture. Racialized people and disabled people have been stereotyped throughout history as both childlike and subhuman, as both sweet-natured and violent. These discriminatory, erroneous legacies continue to harm, continue to feed racist and ableist beliefs that those of us who are not white and abled need to be both feared and locked up. Canada began building asylums for disabled people even before it was a country, the first in 1839. It built one of the world's largest in 1896, the Aurelia Asylum for Idiots. Sorry, that's even still hard to say today. The Aurelia Asylum for Idiots. It was still open in 1967, centennial year, housing an astounding 2,600 inmates. It was closed by a winning 2009 class action suit, charging, quote, systemic physical, emotional, and sexual abuse against disabled children since 1945, at that point for 22 years. Marilyn Dolmage's affidavit described residents as, quote, being kept in caged cots, having all their teeth removed for safety reasons, and being held upside down with their heads under running water as a punishment for not eating. Yes, Canada has waterboarded disabled children. The government formally apologized for decades of abuse and paid small settlements to survivors. It's a true forced fit of our history. Aurelia, the home of the great humorist Stephen Leacock, has a home for disabled children with 1,400 unmarked graves. Canada continued to erase disabled people who were born that way, but began slowly to care for white male soldiers who were made that way. When troops returned from the carnage of World War I with blindness, amputations, shell shock, and, quote, nervous conditions, the war amps raised awareness and support. Then came World War II. In its cleansings, the Nazis began the sterilizing of disabled people as early as 1933. By 1935, the effectiveness of propaganda protesting the cost of keeping disabled people alive escalated to the active euthanasia of disabled children. I think that link is really important. The more you can propagandize that we're a burden, a financial burden, the more realistic it becomes to not spend money to keep us alive. And that Nazi propaganda is replaying itself in modern day Canada. It's important to note that this propaganda began before the war in 1939. The wartime Nazi euthanasia program, Action T4, eliminated, quote, life unworthy of life. In Schönbrunn, it ran the mass gassing of the entire population of 900 patients in a hospital for, quote, the mentally defective. Action T4 murdered 100,000 disabled people, bringing the pre-war and wartime total to the murder of some 360,000 disabled lives. We all need to know that the eugenics movement was not confined to Germany. As a term invented in France in 1883, meaning good in birth or noble in heredity, eugenicists sought to ensure the selection of the fittest. Churchill, Roosevelt, George Bernard Shaw, and Helen Keller all supported some eugenics goals. In 1919, US high school teacher turned eugenicist Harry Hamilton Laughlin advocated the compulsory sterilization for what he called the 5 Ds. All the degenerate, deficient, dependent, delinquent, and defective. Many states passed legislation based on his criteria. As the head of the Eugenics Record Office, Laughlin testified to Congress on, quote, the extra levels of insanity in immigrants. This resulted in restrictions to the Immigration Act of 1924, and in 1936, he won an honorary degree from Germany for, quote, the science of racial cleansing. Formed in 1930, the Eugenics Society of Canada had many prominent members, including 4 of the famous 5 feminists in the Person case: Emily Murphy, Louise McKenney, Irene Pardbury, and Nellie McClung. From 1928 to 1972, the Alberta Eugenics Board sterilized 2,800 unfit women and children. Without their consent, it disproportionately sterilized Indigenous women, incorrectly deemed to be mentally unfit, quote. Again, it took a court case, that of Liliane Moore, to bring this atrocity to light. Ontario and BC passed similar sterilization acts. Forced sterilization wasn't banned in Canada until 1986 and may still continue illegally today. In the Canada of 150, celebrations of 2017, settler Canada celebrated the state it built on the backs of marginalized people. If your Canadian history does not include the 60s Scoop, Butterbox Babies, and Bernardo Boys, it should. Before anyone claims pride in Canada, please learn all its legacy. Change was never charitably granted, it was demanded and fought for. The Canadian Human Rights Act of 1977 forbid discrimination against ability by the federal government. The full prohibition of discrimination against disabled people waited until the Charter of Rights and Freedoms in 1982. The disability community continues to fight on many fronts: education, housing, poverty, employment, inclusion, medical and legal care, and now against changes to MAID. The Accessibility for Ontarians with Disabilities Act, AODA, passed in 2005, maintaining a barrier-free Ontario by 2025. I don't know any disabled person who thinks that will happen. The law provides for few inspectors, small fines, and only small fines for non-compliance. Businesses appear to have taken a cynical wait-and-see approach rather than spend any money on tax-deductible renovations. Bill C-81, the Accessible Canada Act of July 2018, is our first national accessibility law, but applies only to the federal government, takes 4 years to implement. It's earned increasing critique by the disability community for its lack of specificity, for its lack of funding and enforcement. Given that a full 60% of cases before the Federal Human Rights Commission are filed on the grounds of discrimination against disabled people, the enforcement of existing policy is critical. In December 2018, Canada acceded to the optional protocol to the United Nations Convention on the Rights of Persons with Disabilities, giving disabled Canadians recourse to file a UN complaint if our convention rights are violated. Because eugenics isn't long ago history, it's still alive and still kicking in daily life. I'm going to leave it there to end on time for the next person. I just want to urge all of you to oppose this bill and thank everyone for joining in. Thank you.
If I may interrupt briefly, this is the interpreter speaking. I'm at the end of my time, and unfortunately, I don't think we have anyone ready next to interpret. Thank you for having me.
Thank you.
Okay, thank you, Marianne. And I will investigate, Tracy, but you carry on.
Yes, I unfortunately I've got a job right following this that I have to make it to. Maybe there is someone arranged that I'm not aware of, but my understanding was that Danica finished and then I just worked this last hour myself, but I don't know if there's anyone planned after.
Okay. And Marianne, have you communicated that telling people that there's going to be a gap now?
Yes, I'll reinforce it now.
And we'll make sure it's as short a gap as possible.
They don't have anybody.
Okay, thank you.
Okay.
Dorothy's presentation was so powerful.
Really?
Yeah. Just the book. Yeah, I want the book.
Yes. It's available through many channels. And you can get it as an audio book or as a print book, or it's in many different formats.
Hi, sorry. Yeah, I just unmuted myself to answer your question. It's available from Second It is only available as a print book at this point, although also as an ebook. And I would encourage people during the pandemic to order ebooks in order to not put any more delivery people in the street.
An interesting point. Yeah.
Okay.
I was asked to sing another of my songs, I guess, during the gap before the next speaker. Is that okay, Tracy? Or
Just seeing if Helen Armstrong is here yet. Because Helen is due to be here
Hey,
at
Tracy,
12:30.
forgot that texting you isn't the best way to go.
Oh, does somebody text me?
Yeah, I will email you later, but Helen Armstrong unfortunately never confirmed this time. So the half hour belongs to Jane. And you.
Jane, all right.
well, I could tell the potato chip story that Catherine was asking about at the end of the previous presentation. I was talking about how it's so hard for people to get their head around how could you have somebody showering you and feeding you and all these things that life with quadriplegia demands. And I actually got used very quickly to having somebody shower me. But the one thing I couldn't get used to was not being able to eat junk food in private. And it's true, it's a very private thing to sit down with a bag of potato chips on the couch and just eat the whole thing. And if somebody has to put a potato chip in your mouth for you, it is just not the same. And you feel like you're being judged. If you want another, you want more, oh, okay, you're really greedy, or you're whatever, you just feel judged. Whereas being able to be in private with a bag of chips is a very special experience. So anyway, I was telling Catherine and Pat my sad story one day when I was at their place and how I missed eating potato chips. And, anything is possible. So Pat made a stack of Pringles, which she placed on my shoulder. And then I tried to feed myself the potato chips by using my tongue to get them off my shoulder. And Catherine provided a running commentary like it was an Olympic event, and we were just in hysterics. So, but I think I managed to get one or two of those potato chips into my mouth on my own. However, the whole thing, I still needed to be set up. I would need someone there to place the potato chips on my shoulder. And then, of course, there'd be the judgment of, you want a stack of how many? Anyway, so this song I wrote after an interview one time when somebody said to me, so what's your disability anyway? I mean, you look pretty normal. And I thought, whoa, what does that mean? You look pretty normal. Well, does that mean because I looked like her and she didn't consider herself disabled, so therefore I must be normal, and normal means not being disabled? No, it just didn't make sense. So anyway, I came away from that little experience and wrote Label Me Normal. I'm feeling pretty normal today. It's a funny thing, but I usually feel this way. Now the people with the power may not agree, 'cause they define just what normal should be. They think they've got the right to label me, but this is what I say. You can label me normal, or you can call me by my name. You can label me normal, or you can call me by my name. There are lots of things that labels can do. They can list ingredients, give directions too. Now labels are great for jars and plants, for your insect collection or your underpants, but don't stick them on people, they don't enhance, they just get in the way. You can label me normal, or you can call me by my name. You can label me normal, or you can call me by my name. Normal is a relative term. What's normal to an ant may seem pretty weird to a worm. If we judge each other from our own shoes, it will only lead to biased views. Identity is for you to choose, and everyone's okay. You can label me normal, or you can call me by my name. You can label me normal, or you can call me by my name. You can label me normal, or you can call me by my name. You can label me normal, or you can call me by my name.
When did you write that one, Jane?
1995.
Mm.
Just after my release of my only recording of The Fishing is Free, which had about 7 or 8 songs on it. And then I continued to write songs, but I never recorded them. So that was one of those that came later. Another one that was on my recording of The Fishing is Free, Poster Kids No More, is about the whole notion of the poster child, the smiling child in a wheelchair that people should feel sorry for and therefore give money, and all those campaigns. And it's not that it's not that Easter Seals doesn't continue to do and have always done great things to help kids with disabilities, but it's being aware of perpetuating attitudes that somehow being disabled is other, it's different, and labeling people and putting them into boxes that say this is a disabled child and therefore has to be treated differently in whatever ways. And the more that these attitudes get perpetuated and the more stereotypes there are around disability and what it means to be disabled. So this is Poster Kids No More. They thought we'd keep on smiling for years to come. They thought we'd just be helpless and mild. Without our own opinion, they could just cash in on their image of the crippled child. But Timmy and Tammy are rebelling. Their Easter seals have come unglued. They won't be apathetic, they refuse to look pathetic. They're changing their point of view. They're poster kids no more. Poster kids no more. Throw away those images of yesterday. They don't reflect our lives today. Don't tug at the heartstrings, that's not a smart thing, that's not the enlightened way. 'Cause Timmy and Tammy are rebelling, their Easter seals have come unglued. They won't be apathetic, they refuse to look pathetic, they're changing your point of view. They're poster kids no more. Poster kids no more. It's time to change these ancient attitudes and show the world a thing or two. If you've got a disability, it's just a different way to be, and you can be proud of it too. 'Cause Timmy and Tammy are rebelling. Their Easter seals have come unglued. They won't be apathetic. They refuse to look pathetic. They're changing our point of view. They're poster kids no more. Poster kids no more. Now the poster kids are living life in their own way. They're everywhere doing it all. You'll find us in real life, not in a still life, not with our backs to the wall. 'Cause Timmy and Tammy are rebelling. Their Easter seals have come unglued. They won't be apathetic. They refuse to look pathetic. They're changing their point of view. They're poster kids no more. Poster kids no more. Poster kids no more. I realized I think my voice has dropped about 10 octaves since I wrote that song. That was 1994. I was a soprano in those days. So
It's very sexy, Jane.
What?
Very sexy and husky.
Joni Mitchell's voice has dropped.
Do you want to go back on camera?
Good company.
I'm gonna bring your pills.
Yeah, but I don't need a towel for that.
You don't know that.
Right.
It's me doing it, remember? You don't know.
Sorry, my camera, my mic was supposed to be off. Jane,
Yeah.
we have about, I don't know, 15 minutes or so until our next scheduled person. And as it happened, I have a copy of your music.
In the days when I could sing that high.
I have it. So I don't know if you wanted any of the songs played, if you wanted to talk about one of them and play one and, do that after if you would like, or, whatever you'd like to do.
That'd be fun. Yeah, maybe you could play One Flight of Stairs for me. And I can talk a little bit about that while you figure out how to set that up.
Yeah, I think I'm just going to play it and let the sound just be picked up. So if it's not working, somebody just tell me right away so I can shut it off. So One Flight of Stairs coming up.
Yay for technology.
I think. So let me.
It's good to introduce it though, because the theatre told you.
Say.
Yeah, they're accessible. Mm-hmm.
So this is a love song to access.
Yeah. And it just doesn't want to go on my system. I don't know why. Normally I can. I wonder if it just won't go because I'm on Zoom or something.
So we can just gab if you can't get it going.
Yeah, just gab because it's not cooperating with me.
I was thinking, I was getting very sentimental hearing those songs. I was remembering when, I believe, when we first met, was at a demonstration for gay marriage, equal rights to gay marriage. Am I right? We were both on a stage together.
That's great, with Moxie Fruvis and others. Yeah.
Say that again?
Moxie Fruvis was there, I remember. Gian Gameshi and company, way back. long before his BBC days and ultimate fall from grace. Yeah, so we were on the stage at Convocation Hall, and I guess it was shortly after that you asked me to come and sing at a protest for against what Robert Latimer did, the murder of Tracy Latimer. And I went and sang at that, and we became friends ever since. Yeah.
I wonder if people who are watching might not know the story of Tracy Latimer.
Oh my
I
goodness.
think our activism was, pretty essential then. And for many of the same reasons that we're fighting today. We could see what was coming, couldn't we?
Oh, yeah.
Tell about Tracy Latimer.
Do you want to tell the story about Tracy?
Well, Tracy was a little girl who had cerebral palsy and was nonverbal, but from all accounts, she loved school. She participated in all sorts of ways in her community, in her life. But her father decided that she was in too much pain, and well, takes us to lots of places. How can people judge somebody else's pain? But he felt that he knew she was in too much pain and that he would put her out of her misery. And I believe he left her in the van in the garage with the car running.
Yeah, he was more resourceful. He took a tubing from his tailpipe into the van and just left her in the van and watched her.
Till she was.
And then carried her back to bed and pretended like she was sleeping and had died in her sleep.
Yeah.
Yeah, it's I'm sorry for people who don't know the story, and I hope it's a very disturbing story.
But the shocking part, even more shocking, was the public's reaction.
Yes, I was going to say that. I think even today, public support for Robert Latimer, the man who took Tracy's life, her father, is about 70% of the Canadian population.
Or higher.
He was convicted. I think he served 12-year sentence or something like that, but probably got out early.
It might have been less.
Yeah, but the amount of support that people thought that what he did was absolutely in Tracy's best interest, and that he had only love in his heart, and that's what he acted out of, and all sorts of ways of spinning it was certainly devastating for the disability community, and realizing that there are so many people out there who really feel that we'd all be better off if we were put out of our misery. It's just, yeah, jaw-dropping, mind-boggling horror. And that's what we're up against still today, and even more, worse in that this MAID legislation is across the board, so that there will be hundreds of Tracys that potentially people could see need to be put out of their misery.
One signature from me too.
Yeah, I mean, where it says you need one signature to agree to a medically assisted death, whereas
one other person.
Whereas you need 2 signatures at least to make a will. Like they're just making it as easy as they possibly can for people to say, "Oh yes, kill me now." It's so frightening. So, yeah. So Tracy, were you unable to figure out how to play one of my songs, or?
Yeah, I've got a computer that I don't know. It thinks that I'm not the administrator of it, and I don't know why. But it shows me that all my music is in the cloud and that I can't download it. So I'm not able to do that. I'm sorry.
If I could do it if I shared my screen.
You don't even have to share your screen because it's just audio. Just play it.
Let's see if I can find that. Go down the story while you can. I don't know how to get to, oh, there. Okay. Let me see if I can do it. I am so not technical. So this whole experience, I didn't even think I could participate because I couldn't figure out how to do it. But okay. So, oh, there we go. Should be under Jane Field. This is under first name. Jane Field. Here we go. See. Can you hear it?
Yes, you can hear it.
One flight of stairs between us. We're one flight of stairs apart. But baby, that's an ocean between us. Oh, can't you build a ramp to your heart? Why can't I see you now or later? Why don't you let me come in? It would be easy if you'd install an elevator. I'd come up and then back down again. But there's one flight of stairs between us. We're one flight of stairs apart. But baby, that's a chasm between us. Oh, can't you build a ramp to your heart? Watch out, 'cause I think I'm falling head over heels this time. But please give me something to hold on to. Can't you put some grab bars in your mind? 'Cause there's one flight of stairs between us. We're one flight of stairs apart. But baby, that's the grand canyon between us. Can't you build a ramp to your heart? If you feel for me as I do for you, we can make it work. You'll see our love will be truly accessible, and you'll be on the level with me. There'll be no flight of stairs between us. Not one single stair apart. And baby, there's no ocean between us. 'Cause you built a ramp to your heart. Yes, you built a ramp to your heart.
You can tell the story while you're with.
That's wonderful. And it's, you can read that on or listen to that on a couple of different levels, right? I know when I first heard it, and
this is me just looking at it like very simplistically or with a linear point of view, but I'm thinking, okay, you have a person that you are extremely fond of, and they live up a walk up, right? So I was thinking that's what the song was all about. And then it was a little while later that I realized it was a metaphor, maybe in addition to or instead of, I don't know. But would you like to talk about that, Jane?
It's all of that, sure. The song was inspired by a telephone conversation I had when I called up a theater one day to ask if it was wheelchair accessible. I believe it was Sandra Shamus who was performing, and she's a wonderful comedian who has gone on to do all sorts of things. And it was in the very early days with her first show. And I wanted very much to see her perform. And so I asked if this theater was wheelchair accessible. And the bright reply on the other end of the phone was, oh, yes, we are. There's just one flight of stairs. And I just about fell out of my wheelchair. Oh, accessible, one flight of stairs. So I realized that so many people really didn't know what access meant. And of course, there's the physical access, the flight of stairs, but then there's also the whole attitude access and letting people into the world of inclusion, and realizing that people do need grab bars in their minds. they do need, something, some way to understand other people's realities and other people's experience. And inclusion is about so much more than just putting in an elevator or building a ramp. Inclusion is making sure that everybody can participate, whether they need sign language, whether they need physical access, or whether they need support, attendant care, whether they need financial assistance, all the things that make it possible for everybody to be at the table. And there's just so much more than a ramp that needs to be done. And in terms of MAID, what we don't need is access to dying. We don't need this kind of inclusion. Why us? Why do you include people who aren't actually dying? So what we need is the inclusion of all the supports that make life desirable and worth living and possible to live. So inclusion is just far, far reaching, and we're not there. And with legislation like extending MAID to people with disabilities who aren't facing any foreseeable death, we realize how far we are from a world where disabled lives are really understood, and where disability is not something to be feared, something to dread, something to prevent, something to just run away from in horror. Disability is just another way of being in this wonderful world.
So if anyone's got any comments.
Okay, absolutely. I don't think there's anyone that would disagree. It's just we aren't able to really hear people applaud or see people light their lighters in agreement or do anything like that. But thank you again for sharing your music and your inspiration for your various songs. We have another broadcaster scheduled to begin now. I see that she's in the room, Erin. We would need her video and microphone enabled.
Hello?
Hi, there you are. Hi,
Hi.
Erin. Hi.
Hello, nice to meet you all.
Nice to meet
Am
you.
am I good to sort of start chatting, or is there anything?
Yeah, I'm Tracy. I'm Tracy Odell. Nice to meet you.
Nice to meet you.
Could you maybe just give a little bit of an intro for yourself?
For sure. So my name is Erin Advocacy. I'm 19 years old. Right now I'm a university student. I'm studying political science and English here at the University of Calgary. So I live on traditional Treaty 7 territory. That's the Blackfoot Confederacy, Tsuut'ina, Iskia, Nakota Nations, and the Métis Nations. So otherwise Calgary, Alberta. Yeah, I spend a lot of my time on the internet yelling about ableism and inaccessibility. And so I thought that I could just sort of chat about my experience, especially in the past year with COVID happening and now with this bill. I've learned a lot about what society is like, and I sort of just thought that I could chat about what I've experienced as a disabled person.
That would be great. Do you want me to like stop and ask questions as you go around along, or do you just want to go?
If you'd like to.
Whatever works for you.
Anyone can interrupt me at any time, but other than that, I'll just start talking away.
Okay.
I will say I'm not too bad at talking about myself, so we'll see how it goes. Anyways, I did want to start out. So and when I started doing all my research about this bill, I was, reading as much as I could. And there was a quote from Dr. Coelho, who I think actually spoke at this event yesterday. And it was just something that really sort of brought it all together for me and like made me understand why this bill is just so horrific and disheartening and why it is bad. So I think she said in some interview that like, it's okay for us to offer death, but we must first have to offer opportunities for life. And that was what really hit me, because in my experience in the past 19 years of slowly trying to become more independent, trying to get a university education, trying to just sort of make my own life as a disabled person, there has just been so many barriers. And the thing is that right now with this bill, the government is effectively saying, or at least this is how I'm interpreting it, is that it's so awful and so horrible to live a disabled life that it's easier for them to just offer us MAID. And that is just incredibly heartbreaking, of course, because they're making it more accessible for us to die than they are for us to live. And it's become so frustrating. And I guess over the course of my short little life, and I don't have as much as experience as many of the others here, but I guess over the course of especially the last year, but just even going through high school and trying to move out for the first time on my own, it's just been incredibly disheartening and discouraging. And I am starting to get so tired of being reminded every single day that society truly, most of the time, just wants us dead. And I know that that is like such a blunt thing to say, but the older I've gotten, the more I've learned that it's true. And I am so tired of, opening my silly little social media apps every day to see another thing that has happened to disabled people that could have been prevented, and another sort of, way that society is just reminding us that we're in the way for them. And in the pandemic, that has definitely, I wouldn't say that I've become radicalized, because I was before and I already knew that things were bad, but there's like a specific day I remember at the beginning of the pandemic where I started to see there were all these lists of disabilities and conditions and diseases on them, and it was conditions who would be refused treatment for COVID if they were to get it. And I looked at those lists and they were in a number of different states. And I saw not only like the condition that I have, but also conditions that some of my closest friends have. And I remember seeing that and just thinking, they they really don't care about what happens to us. And my disabled community, I mean, we always have each other's backs, and that's how we get through most things. But trying to explain to non-disabled people how much it hurts to see, you know, even during the pandemic and later on, even currently, you know, to see able-bodied or otherwise healthy people like going around and living their life because vulnerable lives are not theirs, it's ours. It's incredibly hard to explain to people who are not sick how much that hurts. And anyways, so that just sort of reminded me of this bill, because it is very clear that they're just, again, making it more accessible for us to die than they are for us to live. And anyways, I don't know if anyone wants to jump in or say anything. I feel like I've just been ranting. But if not, I also asked some people to give me questions that they had just about like living with a disability, and lots of them were curious about my experience in university. And that has a lot to do with how I transitioned and how this bill is like preventing, or I guess prioritizing this MAID bill over bills where they could make it possible for disabled people to live their life with the caregiving they need and the home care they need and the health care they need. So I thought I could talk a little bit about like some of the struggles I had over the past 2 years trying to navigate that system and trying to get the care I need, because it really is just impossible. And that's another reason why this bill is so frustrating.
So, Erin, I'm not sure what the system is to be able to get questions from people that are watching.
Oh,
YouTube.
no, I've collected some beforehand.
Oh, well then, go right ahead. Okay.
Cool. I thought I might be I thought I might run out of things to talk about, so I have some of those in my back pocket just in case.
Yeah, because I had some questions as well. Like for somebody,
for sure.
For some like your age living in Calgary, like are you living at home, or if you want to live in your own apartment, is there supports for you to live on your own, or what are the options for you?
So that's part of what makes it so tricky. So because of the pandemic, I have moved back into my parents' house. But really, it is best for me in my life to live independently. So before COVID, I did live in my university residence. However, to organize that was absolutely probably the most stressful year of my life, and it still wasn't perfect. So the transition from having like youth home care and funding for caregiving, because I do require basically 24/7 caregiving with my disability. I need help with nearly everything that is physical. So transitioning from youth to adult home care, first of all, there was no information anywhere, like absolutely anywhere. And I just happened to be lucky enough to know some other people who had gone through the same transition, moving out of their homes, going to university. But I always just constantly think about if I was like born somewhere else, or if I lived somewhere else, or if I just didn't happen to have those connections, I genuinely don't know how I would have figured it out, because the government makes it so ridiculously confusing. They don't offer you any information. They're not there to help you really with it. Once you can finally track someone down to answer your phone calls and accept your forms and listen to you for a moment, then they might do their job to try and help you get funding, but they also might not. So for me, I wanted to live alone. I needed to be able to live on campus so that I could get to classes in non-COVID times. And that meant that I needed funding for caregiving 24/7. So I went through 3 appeals, and I had to be assessed multiple times, which is just another incredibly, it removes a lot of your dignity to have, you know, occupational therapy therapists and physical therapists and random people who you do not know. It really does not feel great. as a disabled person to have them come into your home and watch you do everything that you could possibly need help with, especially because that determines how much money you get to pay for those things. So I remember specifically a woman came into my dorm one day to assess if I would be getting money for care or not. And they marked down every single thing I needed help with and the exact amount of time it took. And that's how they calculated how much care I would get. So for example, if I needed help moving my elbow back onto my armrest, she wrote that down as 30 seconds of help. And then she added that to her calculation. And she said, well, how many times a day would you need to do that? And I said, I don't really know. Do you plan how many times a day you move your arms or go to the bathroom or have food? Like, it was just ridiculous. Anyways, so after all this, I sent multiple letters. I had meetings with the people in charge. I met with all these people who watched me do the most private things that someone could do. And I didn't get enough money to pay for full-time care. So they said that they gave me the maximum, and I am very thankful for what they did give me. But it wasn't enough. And if I was in a position of less privilege where I didn't have like a backup plan of having my family nearby that I could move home if I needed, I constantly think about how terrifying that would be. And another thing that has to do with that, I think I'm just ranting again, I'm sorry about that. But before I turned 18, a social worker, a woman, came to my home, and we asked out of curiosity. I was here with my parents, who thankfully I have to financially support me in a limited way right now. But she came to my home, and when she was leaving, I asked out of curiosity, I went, so what happens to people who might not have, someone in their life who can help pay in an emergency for things like caregiving? Because for me, I wouldn't be able to, if my caregivers didn't show up or I didn't have enough money to pay them, I couldn't have a meal. I can't make myself meals. I wouldn't be able to feed myself. I wouldn't be able to go to the washroom. I wouldn't be able to get out of my wheelchair. I would just be absolutely stuck. So I asked, like, what would happen if I or someone else was ever in the position where they couldn't pay for it? And she very nonchalantly said to, I think I was 16 at the time, I was all excited to go to university. I was all excited to start being independent and living my life. She said, oh, well, we would just put you in a home. And that absolutely has scarred me, because again, like, just the same as all disabled people, I have aspirations. I want to have a career. There are things I want to do in my life and see in my life. But if I was just a little bit less lucky, or if any part of my life changed a little bit, it would basically be over. And so the fact that the government is spending all of this time and energy and dedicating all of this enthusiasm to this bill, that is going to put people in an even more vulnerable position when they can't do the things exactly like I just said. That just makes me incredibly angry at them for even considering to do something like this before they would make sure that every disabled person has a house that they can get into and live in, or has the care they need. Yeah, so I guess that's how that was connected. Every day I wake up and I learn a little bit more about what they're doing, and I get a little bit more resentful. But I'm hoping that that resentment can turn into some positive action, because obviously it needs to happen. But yeah, that was my answer. That was my incredibly long answer to your question about what supports there are. The answer is not many. Yeah, I don't know. I mean, a lot of people were also asking just about university and how it was accessible in general. That's another thing that just over the years I've become less and less optimistic. Again, just there are reminders everywhere that non-disabled people don't want us in their society, or at least they aren't prepared to have us be a part of their, society. So far my university education, there was just constantly inaccessibility. I would sometimes go into classrooms and have to leave before my lecture started because there were no tables that I could get under. Sometimes they would just disappear. Sometimes I would have a table, but then the next day it would magically be gone. I wouldn't be able to get through campus without someone like following me around to open doors because half of the buttons didn't work. Half of the, curb cuts were just too steep for me to get up on my own. And again, it's when I was younger, I guess I saw that as just an unfortunate reality. But now I'm starting to see every little thing like that and every little microaggression and every little curb that isn't accessible. I'm starting to associate that and realize that that's just like another reminder of what we have to fight for every single day. So, anyways, if nobody else has anything to add or to hop in with.
Just what are you said briefly what you're studying, but what are you hoping to do after you graduate?
So right now I'm studying political science as well as English. So this is also related to Bill C7. When I was young and naive, for a moment I thought I'd like to maybe be a politician. And since that time, I have learned that all of the most important things, I mean, I guess the reason I wanted to be a politician was because I wanted to like help people who have experienced, inequality and oppression just like I have. But I've learned in my short little couple years since then that it's not the politicians who are doing that. It is grassroots activists and people who organize this event and are here today. So right now I am quite into journalism. I like writing about my experiences with ableism and inaccessibility, disability representation as well. That's something I really enjoy. So for now, I'm looking into maybe going into journalism at some point and being able to focus on those types of issues. But a lot could change. So who knows what I'll be doing a year from now. Yeah.
Do you get reactions from people around their thoughts of you having a disability, and they're sharing what they think about that if the same thing would occur to cause them to have a disability?
So, like, I don't often, not in person. In person, I don't get reactions to my disability. I learned as a child to try and be very outgoing so that people had to interact with my personality instead of simply focusing on my disability, I guess. I guess you can't see it on the Zoom, but I use a large power wheelchair, so it is quite obvious for me. I guess online, it's a bit different. I have accrued a small following on an app called TikTok, which I like to poke fun at my disability, but I also try to educate people on there. And on the internet, it is very different. People, when they have a thought, they like to say it, which isn't so bad for me because I can then, depending on how respectful or not they were, I can either respectfully or maybe not so respectfully educate them as to why what they're saying is just not good or not right. But that's, yeah. I'm trying to think of other things. Lots of people ask me if I struggle, or not struggle, but if I've experienced any feelings of internalized ableism, which again just leads back to constantly seeing reminders around me that I am not supposed to be doing what I'm doing, and I'm supposed to just be cooped up in my home, I guess. That for a long time definitely sort of made me doubt myself and doubt my abilities. There are definitely times where after I've spent, 45 minutes waiting for someone to answer my phone call so that I can see if I will have enough money to pay for a caregiver this month, there are times where I start to think, wow, this is really terrible, and maybe I just shouldn't even bother. Obviously, you have to fight those thoughts, but it's just, yeah, it's hard to not have a sense of internalized ableism when every single place you look, there are signs of it. If no one else, anyone wants to jump in? I don't know if I've said anything of substance at all in these last 23 minutes.
Oh, you certainly have. Please
Oh,
don't worry about that. I love that you want to get into journalism, because we're always looking for journalists that understand, disability from our perspective, right? Like the whole narratives around medical assistant in dying at first was around, helping people to end their lives sooner because they were in pain or they were suffering from a disability, or, like that was all it was about. And very rarely were we seeing the other narrative around lives that are worth living, people looking forward to their lives, and people who had ways to, work with their disability and just, do whatever they want to do like anyone else would.
Absolutely.
We don't see those so much.
Yeah, and another thing, I guess, regarding like the necessity of having more disabled journalists, this is sort of, it is quite related, I guess, actually. So the case of Tracy Latimer in Saskatchewan, I believe. So there was lots of, the other day, I think it was on March 1st or 2nd, it was Disability Day of Mourning. So for people affected by filicide and any disabled people murdered by their parents or caregivers. And ever since I was a wee little child, the case of Tracy Latimer has haunted me a little bit. And so much of that case, her father murdered her because she was a 12-year-old disabled girl, and he wanted to end her suffering that he perceived as suffering. She did not consent to any of that, obviously. But all of the media cases, every single article, even now when you look it up, they're written by abled people, and they sympathize and empathize with her father. And now he is trying to get pardoned for this crime that he committed. Most of the media attitude around the case was completely sympathetic to him. They wouldn't say that he murdered her. They say that he, helped put her out of her suffering, or he pitied her, or whatever it was. And so the attitude towards him was not one that he murdered his disabled child. It was one that he was some sort of saint who should be, forgiven for what he did. And that, it was just so frustrating to look up her name and have every single case or every single article about the case be just absolutely ignorant to the fact that this disabled girl didn't want to die. She didn't consent to being killed. And she was she was living a life as a disabled little girl. And it was very similar to many other people who are living a very happy, very successful life today. Anyways, so with all the articles just being completely focused on why he did it and why it wasn't so bad, that just kind of went to show how different that narrative would be if there were any disabled writers covering that case, because it would obviously change the attitude quite a bit. So, a lot of other people asked me about, I guess I already covered like home care, trying to get all that set up. It's inaccessible, disheartening. It is near impossible sometimes. Yeah.
Do you have siblings?
Yes, so I have 3 older brothers. They're quite a bit older than me. I'm 19 and my youngest brother is 29. So they grew up with me for a while. They are all able-bodied and healthy. So I think it was quite an experience for them to sort of watch me grow up and start to be more vocal about disabled issues. Yeah, I mean, as a kid, they never treated me like different or anything. They would, we would have, I don't know, they were my 3 older brothers. They were not always nice to me, but they would, they would, one of the fun things that we used to do, and it was fun for them maybe more than it was fun for me, but they would use my wheelchair to help practice shooting pucks in a net around my wheelchair. So they would dress me up in some goalie gear and park me in front of the hockey net and shoot pucks in my direction. I don't know what that has to do with anything, but I think it's quite funny. Anyways, yeah, there's not much else about them. They just kind of, I'm the main character in our family. They're the background.
Did you
Yeah.
go to your neighborhood school growing up?
No, so I actually haven't lived in Calgary all my life. When I was younger, I lived in Grand Prairie, Alberta, and there is actually a elementary and middle school that has specific programs for disabled children. However, I guess it was called like an integrated program. So I was completely integrated into the normal, those are my sad air quotes, the normal classes. But I also had a special ed teacher who would oversee things in case I needed help with anything regarding like my aid or physical like accessibility in my classes. So I was very lucky there actually. They had things like, they had an indoor swimming pool that was made for like therapy and doing physiotherapy. So when the rest of my classmates would go to gym, I would sometimes get to go swimming. And that was like incredibly helpful for my range of motion and things like that. So I was very lucky with that. And then I moved to Calgary in 7th grade. And it was very hard to find a school that was accessible to me. My neighborhood school, where I would have gone if I had just gone to the one that I would have been assigned to, lots of the classrooms just had steps into them, just a single step for no apparent reason, which was quite funny because it made this whole big deal about me having to somehow find another school to go to, and it was literally 1 foot of whatever flooring is made out of that prevented me from just going to that school instead. So I had to find a different school. I ended up having to do online school for a year just because there were no accessible schools in the area and we had to plan a lot more in the time that we had. And then I went to high school. I just went to the high school that I was like assigned to go to based on where I lived. It was kind of accessible. Some of the classrooms also had stairs, again, for no apparent reason. They were just there. I had an aide. They did actually build a bathroom that I could get into, but that was only because if they hadn't, I wouldn't have been able to, use the washroom for 9 hours a day at school. So I guess it's nice of them that they did it, but I couldn't see that they had any other choice at that point. Yeah, high school was an interesting experience. I had to spend lots of time doing things like convincing teachers to speak to me and not my education assistant. So even though for much of high school, I was in like advanced placement classes, I would take honors classes, I would do all these things, and I would show up there, and the teachers would still assume that I couldn't communicate with them or couldn't talk to them or didn't know what I was doing. So I'm not sure why they thought I was there, but they would come up to me, look at my aid, and ask questions about her and what she can do while I was sitting right there. So I had to become very good at sort of directing their attention back to me and explaining that if they had questions about me, that they should direct them to me, which was, I guess, a little bit frustrating at first, but once you start doing it, and I mean, by 12th grade, most of the people in my high school knew who I was, which was, I guess, a bit better. Yeah, I ended up being the salutatorian for my class, and I got to do a little speech. I became very close with many of the teachers, but it was still definitely, there were a lot of times where it just wasn't accessible to me, and it was a lot harder than it should have been.
When you were first reading and researching about Bill C-7, medical assistance in dying, what was it about the bill this time around that particularly made you feel like you really had to speak out and say something about it?
I mean, it was just, it is so blatantly, I think, okay, when I read it and when I learned all about it, I felt that for the government to do this, especially right now in a time where, like, the pandemic, 50% of the people who have died are disabled. Disabled people are just being taken out left, right, and center. They're not increasing or helping or, home care supports or healthcare supports. Healthcare is incredibly dangerous for us right now. So what they're doing is the only alternative to MAID. They have created it so that it is inaccessible, and that will therefore lead people to have to, or they'll be coerced into this option. And the fact that it is so easy and so accessible when literally everything else that is made for us to live is nowhere near as accessible as this is. It's just infuriating. Like, to see that the government is so enthusiastically saying, you know what, this is what you need because you're disabled and your life is so sad and scary. Here, have this. This is for you. We're helping you. It's just ridiculous. It's infuriating, and I thought that I should be a part of at least trying to stop it, or at least making sure people know how dangerous it is, because it is genuinely infuriating to me.
I'm really glad you talk about being infuriated by it, because that kind of gives energy to propel us forward, to kind of combat this, because it's not like today they're going to say, to me, Tracy, we want you to have MAID. This is going to be the kindest thing for you at this point. It's still supposed to be, in my air quotes, my choice, right?
Yeah.
But the fact is, over time, it's going to become, I fear, and I think many of us think, it'll become so normalized that it will be expected. Right?
Absolutely.
And what are you doing? Expecting all of these services, for you, because you have a disability. What are you doing? It's going to be made. You're going to feel like obliged to do it or guilty if you don't do it. And if the door is open, like that is a concern that I think a lot of us share.
Absolutely. And I mean, medical care is already unsafe for disabled people generally, especially that's been shown in this pandemic. You know what I mean? Like the fact that they consistently prioritize abled lives over the lives of disabled people, that has become abundantly clear over the past year, but also before that, of course. And just the fact that if the two options are getting medical care where maybe you'll start to get more funding and you'll start to, treat maybe one of the illnesses that is, causing you to have pain or causing whatever problem in your life, if the option is between that or the doctors constantly giving you this option, obviously there'll be coercion involved. Like disabled people don't always have the agency that they would need to like resist suggestions like these. And it's just terrifying to think, and I know that it might sound like an exaggeration to think that doctors would be pushing this on disabled people, but then you think about all of the things that happen in, not only just the medical care, but like everyday life. And some people just, their attitudes are so deeply ingrained in them that disabled people aren't supposed to be a part of society, or they aren't supposed to do this, whatever they think about us. It's just scary to think how that could evolve with a law like this, I guess. Is there anything else? I'm starting to run out of things. Again, I don't know if I've said anything of substance.
You've said lots of things of substance. I just wish it's easier for more people to put their questions forward
I guess.
as well, but
I mean, thank you, Matt.
It takes like a lot of, it takes a lot of moxie to put yourself out like this in front of everybody and, talk about who you are and what you want to do with your life and, to speak out against a bill that, is so plainly wrong. It's wrong for our society. It's wrong for, it's not the society that we keep saying that we want to be. It's exactly the opposite, so
exactly.
Yeah.
I mean, I'm happy to do things like this, I guess, because, I mean, first of all, I do enjoy talking about myself, and I am sometimes a little bit full of myself, but I think that translates well, because when people see me on the internet, like being confident with my disability, because that's something that I had to work really hard for, and I'm still not always like 100% confident with the way I look, because I don't get to see, any people that look like me. So I guess I'm trying to change that and just sort of force people to see me and perceive me and realize that I am like a human with dreams and hopes and, etc. Anyways, someone said something.
We've got a question here from someone in the room. Gabriel is wondering, 20 years from now, so you got to imagine yourself almost 40, 20 years from now, what would you like to imagine life is like for the next generation of people with disabilities?
I mean, thank you so much for asking that. That is so fun. First of all, I just want to say most of my best friends are other disabled people who are my age, and some of them have done so many amazing things for the disability community. Like the amount of people I see, like when I was a kid, the disabled people I saw were, like charity cases in movies played by actors who weren't actually disabled, or like the one random kid in a wheelchair they would put in the textbook for diversity points. Those I always remembered because there was always like a hospital wheelchair and nothing ever made sense. Anyways, but like now I just get to see so many just like such cool disabled people who are like so loud and so confident with their disability, and like they don't take anything from anyone, and they're like, I have learned from other people like me to be involved in things like this because it's us who have to deal with the consequences of it. and we're just all trying to sort of make life easier for each other. So I think in 20 years, like, especially with technology, like how close I've been able to become with other disabled people from all over the world. I can't imagine in 20 years that like that won't be even better and even more possible. I think that like the community of disabled people will just be so powerful that like nobody's going to be able to stop us. I truly believe that because we are all so angry, we are all so cool, and we are all like so connected. I have to imagine that like we're gonna be like a threat to like ableist society, and that makes me very happy. That's what I think. I don't know. I hope so.
Yeah, I hope so too.
I mean, the tools that are available to us with things even like this and like technology and social media and being able to be so loud and like visible, I am so thankful that we have those tools. Yeah.
Yeah.
That's my answer to that question. I guess I could talk more about social media for a minute, because that's how I spend my days. I am still a silly little teenager who is always on her phone. But also my phone has like given me such a community, and I would not know any of the things that I know. I would not be as, like adamant in fighting the things that I do. I wouldn't know any of that if it weren't for, just like randomly coming across a certain profile on Instagram or Twitter or whatever it may be. And like, I genuinely don't know if I would be here and like alive and surviving if it weren't for like so many of my Crip friends. I call them that because I am also a Crip. But like, if I hadn't been connected with these people who had similar experiences and who could give me advice and who I could share my experience with, I'm so thankful that I have that. Every day, I am so thankful. Anyways, I saw that someone said something in the chat. Oh, advocates on social media. So what makes for good social media advocacy content? So I do spend most of my time on TikTok, which is an interesting app because half of it is very, they don't respond well to disabled people, but the other half is full of super informative disabled advocates who can make content that like genuinely changes people's minds. I'm trying to think of some of my favorites. From TikTok, there's a deaf advocate named Chrissy. She does so much. She talks about like ASL, like deaf and hard of hearing problems. She's a university student. She's in film school. She's just like super cool and very informative. On Twitter, I learned so much from, I'm trying to think of my favorites. Lots of my friends, there's someone named E who, they are just the coolest person ever. They have SMA and I also have SMA, and I've learned so much from them. Also, there's people like Jackie Quinn. She was a writer on the show, I can't remember the name, but she was like a comedy screenwriter for a show with a disabled character. She's so cool. On Instagram, oh, Ruby Allegra, they are the coolest person ever. They have, I can't remember the specific condition they have, but they use a wheelchair and they're so vocal about like ableism, and they're not always, they don't sugarcoat things. And I think that that's really important. And that helped me sort of, that helped me to, I guess, elevate or like evolve my own activism, because I learned that like I can pander to able-bodied people and I can make them feel nice and I can say, hello, ableds, please be nice to me because I am a little cripple and I need your assistance. But But I could also say, listen here, you're doing this and you should feel bad about it. And I am very angry about it and you should be afraid of me. And I much prefer the second, only because I find it much more effective in making people realize like how their attitudes are genuinely affecting me. Yeah, I just like in my content, I like to let people know that I can see what they're doing, that I see everything, and that's if they're being ableist, they're not going to get away with it because I will call them out. Yeah, that's what I think good social media content is. I think that it should make able-bodied people, or at least ableist able-bodied people, uncomfortable. I think that that would make for good content. Anyways, that was my answer to that question.
That's it. It's great. It's great to hear you and your for me to hear your generation. And people are saying, thank you, great answer.
Thank you.
Another person has a question, Heidi. She says, something that struck me in listening to you, Erin, is that many of the obstacles you face are the same ones that I faced 30 years ago. What do you think it will take to break that ableist cycle?
So that, I mean, the first thing I have to say is that like, the more I learn about disability history, and I must say it's not much because they don't teach us anywhere. If I ever want to learn about like a disabled person who did a really amazing and powerful thing from 40 years ago, I have to genuinely like scrape through like tiny pieces of information, and I have to like go through a maze and like pick up, I don't know, books from the local library that are hidden in the back storage room. Like, it's just ridiculous to try and learn about like the history of my community. But even from the little bits that I have, like, I'm so thankful for activists who were doing things 30 years ago, because I just know that like if it weren't for them, if it weren't for them fighting and like doing all the things they did, I would not be where I am today. I wouldn't even be close. So like thinking about the fact that there are the same barriers, I guess is sort of disheartening for a moment, but like I try to remember that like there were more, you know, I mean, like 60 years ago, instead of only struggling to receive home care or whatever, I might have been just sent to an institution. And like, it's still a struggle, but I am a lot safer, and generally society is moving forward. I say that very generally, because obviously bills like this are proving that that's not always the case. But I guess like to break that ableist cycle, I think that people just have to keep being angry. And I know that that sounds maybe negative, but like I truly believe that like at a certain point, I know me and my like friends who are disabled, we're not gonna take it anymore. Like we're gonna have the choice to either let ableist society win, or we're gonna keep being loud and we're gonna recruit more people and we're gonna convince more allies to help us. Like it's just gonna take more and more, I guess, like yelling into the void. I don't know. I have to hope that that's what would work, because I don't know what else would work.
Mm-hmm.
Yeah, that's my answer to that.
Yeah.
Not sure how helpful.
Did you see the movie Crip Camp?
I did. Crip Camp genuinely changed my life. I got to write a review for it for a magazine that I work for called Cripple Magazine. I'm actually the social media editor. My friend Emily, who is also disabled, she started this whole publication when she was 17. Anyways, I could talk about her forever because she's really cool, and she started this whole amazing brand. But anyways, I got to write about Crip Camp because I think I've watched it about 8 times now, 8 or 9 times, because every time I do, it just makes me so incredibly happy. And like Judy Human, she followed me on Instagram the other day, and I almost cried of happiness because I just thought that was amazing. Anyways, she like everything that she did in the 70s and 60s, like it's just so empowering, and I am so thankful. And like even just the clips of like them at the camp, like all the fun they had, and like watching just a bunch of disabled people get to be disabled people and like not have to worry about anything else. It just like made me so incredibly happy. Anyways, I recommend that movie to every single person I meet because I love it so much. It is just such a beautiful film. Yeah, I love that movie. It makes me so happy.
What was okay, think back to the first time that you saw the movie and what struck you about it?
I remember there were the clips of like the protest for the 404 is the number 404 sit-ins, I believe. And like just the clips of seeing like they were talking about how people with different disabilities were helping each other with the things that they couldn't do. So like the people who knew ASL were signing out the window to get supplies, and like the people who were blind but physically like could help the physically disabled people turn at night. And like I just thought that was so beautiful, and like it really reminded me of my own community and like how we really couldn't do anything without our other like little community of disabled people. I don't know. Yeah.
Yeah, I mean, because I'm retired now, so I've been around for a while. I didn't grow up in the States, but for me, I'd heard about some of those things and they were a legend. Like I didn't think it really happened. The scene with them crawling up the stairs, right?
Yeah.
I thought, oh, that's just something we heard about. That couldn't really have happened. But there was the news footage, right? So you know that this happened, right? And to know that people had the guts to do that kind of thing, you know, was amazing. And maybe like to, you know, in answer to this other, you know, question about what's it going to take to deal with ableism, it might take some very bold action like that.
Definitely.
One, Heidi liked your answer to your question. She says, thank you for that great answer. She says, I'm so, lots of O's, so encouraged and thankful for this new generation of shit disturbing Crips coming up after us.
I love that so much. I genuinely, that is the best title that we could be given. I am so proud to be a shit disturbing Crip. That is just like the best thing that I could call myself. So thank you for giving us that name.
In fairness to Heidi, she wrote the word with a little star between the H and the T. So just to let you know, I uneditorized what she wrote. So
she was more polite a little bit.
Yeah,
I
way
like
more
the
polite than me,
version.
apparently. Yeah.
No, it'd be hard to pronounce like that anyway. Yeah, no, but I just love the fact that like so many of my friends are just so confident with their disability. They're so like motivated to get things changed and fixed. And like I truly believe that like our community and like the fact that we can all share our grievances and like everything that we dislike about this ableist little world that we have surrounding us, like I think that we motivate each other to just like get through it and like do everything we can to change it, even if it's just in a little way, and even if it's just like in our own little friend group or community. Like everything really matters, and it all helps, and it all goes towards a bigger change. So yeah.
Like what would be, you know, we've been trying to work in so many different ways to kill this bill. What are some ways that you think we could use social media to make a difference, or what techniques do you think we could do or could have done to really, you know, press upon the government? Like help them understand like what they're doing that's wrong. Like, you know, we've met with you know, we've met with the senators and individual MPs, and you know, like I don't know, like what would be your ideas if you were going to tell, you know, a group of people of advocacy that they could take around destroying a bill?
I mean, so it wasn't quite the exact same scenario, but in the past I have, like, there was a decision made, there was a life-saving treatment it was the first one ever for my disability, and the government decided that they weren't going to fund it for people over the age of 12, even though it was like proven to be just as effective in people over 12. Anyways, so I used social media because, I mean, that's the platform that I'm comfortable on, that's what I grew up on, and that's what I like know how to do. So I used it to, like, first of all, just explain to everyone who might possibly see it, like, why this was a problem. And then I asked them kindly to take a moment of their time to send an email to an MP or to phone an MP and complain about it, because I found that, like, and it would be the same for this, like, you know, there's power in having large numbers. So, like, the more people who can understand that this bill is just an atrocity and it's dangerous and it's hurtful, I mean, you can convince some of those people that this is true because it is true. And then you can convince them to take some of their time, phone their MP, be loud about it, or share the problem with their friends. Like, with things like Instagram, it's so easy to just like repost things, and like it's easy for people to read, it's easy for people to comprehend. If they're interested, it's easy to like connect them to more information. So I've been trying to do that. I've been like talking about this issue and this filibuster, like on Instagram, on my platforms, just to like have people know about it, because that's the first step, is just like getting people to realize that there's a really bad thing happening and that they have the power to make it not happen. Yeah.
That is great. I need a coach for social media. So I don't know if you're available to coach.
I would love to
gonna,
help. I will
because,
say social media is probably one of the things that I could help someone else out with. So
okay, well, that is good to know. We're at the 2 o'clock magical hour. I want to thank you so much, Erin, and I hope you don't mind if I arrange to stay in touch with you, if
of
that's all
course,
right
yes,
with you.
I would love that. Thank you so
Okay.
much for letting me share all my silly little stories.
No, they're not silly. They're very important stories that need to be shared, and there's a lot of resonance for people who have been through similar things, and even over the generations, right? Like there's still things that we have to work on. We're not there yet, but there's never going to be pressure to get there if we all get killed off, right?
Definitely.
Yeah. So
anyways, thank you for having me.
Thank you for coming. And I think our next person up is Shelley, I believe. And I think the person doing what I'm doing is going to change as well. So thank you very, very much.
Can you hear me?
Yes, we can hear you, Shelley. Thanks.
Okay.
Thanks for coming.
So I guess I can just begin. So I'm going to read something from my screen, so I won't know if there's anything happening on your screen. So my name is Shelley Tremaine, and I'm an unemployed disabled philosopher of disability. That is, I have a PhD in philosophy from New York University, and my area of specialization in philosophy is disability. So I write about what disability is, how the category of disability came into being, philosophical analysis of the sources of disabled people's oppression, what social justice for disabled people and other marginalized groups requires, and so on. I've written books and articles on a range of topics, including ableism in philosophy and bioethics, disability in prenatal testing, disability in nursing homes, disability in language, and disability in stem cell research. I've also done some policy research around disability and human rights and community activism, including community radio programming. And I heard Jane Field perform her song Poster Kids No More. She actually wrote that for an multidisciplinary art exhibit that I coordinated for A Space in Toronto in the mid-90s. So today I'm going to read you a paper that is an abbreviated version of an article that is forthcoming in a special issue of the International Journal of Critical Diversity Studies that I've guest edited. The theme of the issue is philosophies of disability and the global pandemic. Before I begin, I want to convey my deep appreciation and immense gratitude to Gabriel Peters, Catherine Frazee, the captioners, the ASL interpreters, Trudeau Lemons, Sarah Jama, Andre Demise, Springhalls, and everyone else who has organized and participated in this urgent and important event in the history of disabled people's struggles and activism in Canada. I think that this filibuster is a significant intervention into Canadian politics with respect to disability in general, and Bill C-7 and MAID in particular. I also think that if there's anything good that has come out of the current struggle against Bill C-7, it is that many of us have a renewed sense of solidarity and comradeship with other disabled Canadians, that we're finding each other, that we're showing up for each other. I think this is significant. It's meant a lot to me anyway. I also want to acknowledge that the land from which I'm joining this momentous event is the traditional territory of the Haudenosaunee and Anishinaabe, covered by the Upper Canada Treaties and directly adjacent to Haldimand Treaty territory. As a settler, I want to humbly offer my contribution to the disability filibuster with respect for the original peoples of Turtle Island and in the spirit of decolonization. So the paper that I'm going to read a condensed version of is entitled Philosophy of Disability, Conceptual Engineering, and the Nursing Home Industrial Complex. The first section of the paper is entitled Naturalization and Structural Gaslighting in Philosophy. Disability and its naturalized foundation, impairment, are typically represented in philosophical and popular discourses as naturally disadvantageous human characteristics, attributes, or properties that certain people embody or possess. That is generally regarded as self-evident, natural, and politically neutral phenomena that science and medicine can accurately represent. In recent years, however, an increasing number of disabled philosophers have challenged this individualized and medicalized understanding of disability, helping to consolidate a subfield of philosophy that I initiated and to which I gave the name Philosophy of Disability. For example, some of these philosophers of disability assume the tenets of the British social model of disability, arguing that although impairments are pre-discursive and hence, that is before society, pre-social and hence politically neutral human characteristics, disability is a pervasive form of social disadvantage imposed upon people with impairments. In my book, Foucault and Feminist Philosophy of Disability, and in numerous articles I argue, contra the British social model, that both impairment and disability are socially constructed, invented rather than discovered, made rather than found. By drawing upon disabled French philosopher Michel Foucault's ideas, I have argued that disability is a historical construction all the way down. Is a dispositif, to use Foucault's term, a complex apparatus of force relations that produces impairment as its naturally, that is, prediscursive disadvantageous foundation, to camouflage its own thoroughly contingent political motivation. An aim of my research is to indicate how this apparatus of power, that is the apparatus of disability, has been naturalized within the discipline of philosophy, especially to bring impairment into being as that kind of thing. Philosophers generally do not regard this sort of critical examination of disability and its production as philosophically defensible and pertinent to the research and teaching. Nor do they appreciate the critical importance of philosophy of disability, but rather remain resolute that philosophical inquiry about disability is appropriately and adequately conducted in the subfield of bioethics, a contestable subfield that both rationalizes and legitimizes eugenic practices. In Canada, for example, philosophers and bioethicists have played a fundamental role in the creation of a culture of eugenics within the discipline of philosophy itself and in Canadian society at large, both influencing the development and promulgation of some of the ableist legislation that I discuss in this presentation, and ensuring that specialists in philosophy of disability, especially disabled philosophers of disability, do not enter the ranks of professional philosophy in Canada. Indeed, more and more bioethicists in Canada and abroad dedicate considerable effort to the task of reconfiguring bioethics in ways that safeguard their own disciplinary, professional, and institutional jurisdiction over philosophical claims about disability. Thus, one dimension of my philosophical writing and activism in the profession is designed to show how disability and impairment are naturalized in philosophical and popular arguments, in what context these claims are mobilized and advanced, and for what social, economic, institutional, professional, and political purposes. In this presentation, I'll lay out some of my recent work on COVID-19 outbreaks in nursing homes, psychiatric hospitals, and other institutions in which disabled people and seniors are segregated in order to identify an additional context in which we can recognize that the naturalized ontological status, which just ontological just means what there is, what something is. So the naturalized, another context in which we can recognize that the naturalized ontological status attributed to disability and its conceptual objects is always already political. I will also argue that philosophers must engage in radical conceptual engineering that construes disability as an apparatus of power, a mechanism of which is the nursing home industrial complex, as I refer to it. One of my aims in this work is to show that the naturalization of an individualized and medicalized conception of disability in philosophical and other discourses about nursing homes and other institutions in which seniors, elders, and younger disabled people are put is a form of structural gaslighting. Feminist philosopher Nora Berenstain defines structural gaslighting as, and I quote, any conceptual work that functions to obscure the non-accidental connections between structures of oppression and the patterns of harm that they produce and license, end quote. My argument is that the epistemologies and ontologies of domination in philosophy that persistently naturalize disability repeatedly sabotage attempts to improve the situation and professional position of disabled philosophers, in part because these epistemologies and ontologies facilitate the reconstitution within both the discipline and profession of deeply entrenched prejudices according to which disabled people are defective, unreliable, and suboptimal, and thus not viable colleagues. Against the individualized and medicalized conception of disability that prevails in philosophy, I maintain that disability, as I indicated, I maintain that disability is an apparatus of power in Foucault's sense. The structural gaslighting about nursing homes, which the individualized and medicalized conception of disability bolsters and reproduces, is one strategy of this apparatus of disability. The exclusion of disabled people from the profession of philosophy and from other professions of epistemic authority is another strategy of this apparatus. As Foucault explained it, an apparatus is an ensemble of discourses, institutions, scientific statements, laws, administrative measures, and philosophical propositions mobilized in response to a perceived social need in a particular historical moment. My argument is that the perceived social requirement to which the historically and contextually specific apparatus of disability responds is biopolitical normalization. The next section is entitled Conceptual Engineering and the Nursing Home Industrial Complex. Philosophers have ignored the oppressive social, economic, and political features of and circumstances that surround nursing homes, assisted living centers, and other congregate settings in which seniors, elders, and younger disabled people are placed, preferring to understand and represent these settings as politically neutral sites of care, love, and benevolence, rather than understand and represent them as carceral environments that enabled the segregation and management of certain populations deemed to be unproductive and disposable. Not even philosophers who advance proposals about how society should respond to COVID-19 have interrogated the relationship between the outbreaks in these institutions and the insidious nature of the institutions themselves. This refusal on the part of philosophers to closely examine the social, economic, and political circumstances and contexts in which COVID-19 cases and deaths have occurred has enabled the ageist, ableist, classist, sexist, and racist conditions that precipitated these infections and fatalities in the institutions to remain obscured and unchallenged. By contrast, my recent philosophical work has called upon philosophers to pursue a form of conceptual re-engineering with respect to nursing homes. That is, to acknowledge that nursing homes, so-called long-term care facilities, supported living facilities, and other institutions in which seniors, elders, and younger disabled people are confined, constitute the fulcrum of a massive network of control that, as I've indicated, I call the nursing home industrial complex. This revision of our perceptions and understandings of nursing homes and their functions could be described as a process of semantic amelioration. Semantic amelioration, as feminist philosopher Sally Haslanger defines it, involves the expansion and improvement of the discursive resources available to us with which to understand phenomena. To illustrate this definition, Haslanger points to the movement from an understanding of the concept of race as a biological kind to an understanding of the concept of race as a socio-historical kind. Haslanger notes that the distinct conceptual schemas available in the respective historical milieus in which these disparate understandings of the metaphysical status of race have circulated constitute divergent understandings of the concept of race. With my own terms of reference, I want to argue that the conceptual schema that currently generates perceptions and understandings of nursing homes and other congregate settings in which seniors and disabled people are put is a historically contingent mechanism of the apparatus of disability. That is the conceptual schema that construes these institutions as paradigmatic sites of care and love, rather than as the linchpin of an industrial complex of governmentality, is an artifact that is a historically contingent mechanism of the apparatus of disability and other apparatuses with which disability is entwined, such as the apparatus of class and the apparatus of race. On January 17th, 1961, during a televised farewell speech broadcast into the living rooms of a predominantly white middle-class America, President Dwight D. Eisenhower introduced the idea of an industrial complex by invoking the term military industrial complex. Eisenhower's use of the term military industrial complex was intended to warn this sector of the American public about, and I quote, the unprecedented conjunction of an immense military establishment and a large arms industry, end quote. Eisenhower coined the term military industrial complex to articulate the concern that the more money that could potentially be made at home from military aggressions abroad, the more that military aggressions abroad would be made. And the more money at home and wars abroad that were made, the more influence that American manufacturers of military-related items would wield over elected US government officials in the states in which the items would be produced. So that's the definition of military industrial complex. After Eisenhower, Angela Davis, Ruth Wilson Gilmore, and other members of the US-based prison abolition collective Critical Resistance coined the term prison industrial complex to refer to the system through which prisons have become a mechanism of racial segregation in the United States and a primary source of profits for many American manufacturers and multilateral corporations. Likewise, I use the term nursing home industrial complex to refer to an expansive neoliberal economic network that comprises nursing homes and other so-called care facilities, medical clothing and linen suppliers, healthcare and administrative temp agencies, professional associations and trade unions, housekeeping and laundry service contractors, prepared food companies, medical equipment manufacturers, pharmaceutical corporations, and other entities that benefit fiscally from the ageist and ableist segregation of senior and disabled populations in nursing homes and other institutions, with powerful nursing home lobbies informing the decision-making and actions of governments, universities, and even financial institutions themselves. Indeed, the boards of directors of nursing homes and other so-called care facilities are, for the most part, made up of the CEOs of financial institutions and their legal representatives, rather than disabled scholars and activists, as well as other community advocates for elder, seniors, and younger disabled people. In short, the nursing home industrial complex has increasingly come to hold the coercive economic influence over elected officials about which Eisenhower had forewarned. Note, for example, that the term nursing home industrial complex aptly describes the relationship between the American nursing home industry and US politicians, as was starkly evident when, in the summer of election year 2020, US Senator Mitch McConnell initiated legislation that would grant legal immunity to the owners of American nursing homes for liability related to COVID-19 deaths and any other fatalities that occur on their premises, something that's also been taken up by Doug Ford here in Ontario. As a mechanism of the apparatus of disability and ultimately neoliberalism, the nursing home industrial complex traverses across the borders of the United States, however, extending far beyond them, with the nursing home industry now an integral part of economies worldwide. The next section is entitled COVID-19 and the Nursing Home Industrial Complex in Canada. Since early March of 2020, discourses about COVID-19 cases and deaths in North American nursing homes and other institutions in which elders and disabled people are put have unraveled in the North American mainstream press and on social media. In the terms of these discourses, the COVID-19 cases and deaths in these institutions have been largely naturalized and medicalized, represented as an inevitable consequence of a vulnerability inherent to the residents of the institutions due to their age or an apparently intrinsic characteristic now commonly identified as an underlying condition, or in more technical terms, a comorbidity. Only sporadically has the succession of COVID-19 outbreaks in North American nursing homes been attributed to the very nature and functioning of the institutions themselves, including their carceral rationale, their architectural design, the scarcity of supplies and resources that beleaguers them, the isolation and disciplinary regimes that characterize them, their socially marginalized character, and the precarious, unskilled, and transient nature of the labor that sustains them. All of which elements constitute the individualizing and totalizing power and economic bottom line of the nursing home industrial complex. By late April of 2020, more than 1,000 of the 1,350 COVID-19 deaths that had by that time occurred in the Canadian province of Quebec were tied to nursing homes. In May 2020, the progressive conservative government of the province of Ontario issued a call to the Canadian Armed Forces to assist with the emergency in Ontario nursing homes, following the lead of the government of Quebec, which had already done so a month earlier. By June, that is only a month earlier, rather a month later, more than 80%, that is more than 6,000 of the total number of COVID-19 deaths in Canada by that time had occurred in nursing homes, with nursing homes in Quebec the hardest hit. From midsummer of 2020 on, Canada distinguished itself internationally as the country with the highest ratio of COVID-19 fatalities in nursing homes to total COVID-19 fatalities. By October 20th, 2020, there were COVID-19 outbreaks in 87 nursing homes in Ontario. By October 24th of 2020, almost a fifth of the COVID-19 deaths in Canada by that time had occurred in Ontario nursing homes, a figure that does not account for the COVID-19 deaths in other Ontario institutions in which elders and younger disabled people are incarcerated. Despite these ghastly figures, however, Ontario's neoliberal progressive conservative Premier Doug Ford has consistently refused to launch a comprehensive and transparent public inquiry into the circumstances surrounding these COVID-19 cases and deaths, forming instead an independent commission to which his government has continuously failed to provide adequate information. In addition, Ford has repeatedly ignored expert advice according to which COVID-19 testing of nursing home staff and provision to them of paid sick days and full-time hours with increased wages would reduce the spread of the virus by part-time staff who work in multiple locations to scrape together a livable wage and are compelled to do so even when sick. Instead, Ford and various members of his government have frequently admonished the people of Ontario to be better team players who should stay home, wear masks, practice social distancing, and wash their hands, effectively downloading to individual Ontarians full responsibility for the catastrophic transmission of the virus in nursing homes. This responsibilizing, to use Wendy Brown's term, of the people of Ontario has deflected attribution of culpability from both the Ford government's ongoing reluctance to prioritize people's lives over the economy and nursing home corporations, whose shareholders have accrued enormous profits throughout the pandemic that the Canadian federal government has supplemented with millions of dollars in pandemic relief. Indeed, for-profit nursing homes and so-called long-term care institutions in Ontario and other provincial jurisdictions are first and foremost lucrative real estate investments with substantial returns on these investments, which various levels of government in Canada both subsidize and protect. Most COVID-19 deaths in Ontario have indeed occurred in private for-profit nursing homes, resulting in public outcry and demands for the Canadian federal government of Justin Trudeau's Liberals to take control of long-term care, although funding and oversight of nursing homes in Canada fall under the jurisdiction of the provincial governments, not the federal government. This public outcry and these demands became more insistent, nevertheless, after military medical personnel deployed in more than a dozen Ontario nursing homes with outbreaks during the first wave of the pandemic, roughly March to August of 2020, released a whistleblower report about health and safety violations in several of the facilities, almost all of which are for-profit nursing homes. The violations included cockroach and rodent infestations, verbal abuse of residents, dirty linen or no linen on residents' beds, inadequate cleaning and sanitizing of residents' rooms, fecal contamination, inedible food served to residents, force feeding residents to the point of audible choking, lack of personal protective equipment, lack of hygiene, understaffing, and lack of staff training with respect to infection control. The story that the military reports did not tell is that the abusive and neglective conditions of this report have been pervasive in these institutions for decades. During the second wave of the pandemic, family members of nursing home residents, geriatricians, and other advocates for seniors and elders have become politicized, organized, and more strident about the horrors of nursing homes that the pandemic has revealed. For example, they've launched a highly publicized protest in front of a Scarborough nursing home, circulated petitions, called for the Canadian federal government to develop national standards for these institutions, and so on. Nevertheless, the seeming necessity of nursing homes and their covertly carceral character have remained uncontested and uncritically accepted by this cohort of family members, friends, geriatricians, and other advocates of senior nursing home residents. Furthermore, the modest challenges to the nursing home industrial complex that these family members and advocates have advanced are concentrated more or less exclusively on the mistreatment of seniors and elders in for-profit nursing homes and other long-term care facilities, neglecting attention to or even acknowledgement of the younger disabled residents in these and other institutions, which is a divisive neglect compounded by the lack of political analysis of systemic ableism, disability, and ableist eugenics in the public statements, including their Twitter hashtag #Senocide that they've made to the mainstream press, on social media, and in other venues. Disabled scholars and activists have, however, repeatedly attempted to draw attention to the connections between the neoliberal agenda of the Ford government and other provincial governments, nursing homes, supported living facilities, and other institutions in which disabled people and elders are confined, and the history of ableist, racist, and eugenic government policies and practices in Canada, including the Canadian federal government's policies and practices of extermination and assimilation of First Nations, Métis, and Inuit peoples. Although the collection of COVID-19 related data for group homes and supported living centers, the congregate settings in which most institutionalized disabled people are segregated, has been sparse throughout the pandemic, manifesting the myriad ways that the federal and provincial governments of Canada have in general neglected disabled Canadians since the outset of the pandemic. The issues with respect to staffing and crowded living space quarters are similar across all of these institutional settings. By February 4th, 2021, 1,195 outbreaks had occurred in Ontario nursing homes since the outset of the pandemic. And in addition, 459 outbreaks had during this period occurred in Ontario group homes and the other Ontario institutions in which most institutionalized younger disabled people had been placed. Nora Laredo, an independent journalist who has diligently collected data throughout the pandemic on the number of outbreaks and deaths in all residential settings across Canada, reported on February 6, 2021, that 14,867 of the 20,702 COVID-19 deaths in Canada by that time had occurred in 1,484 of these institutional settings. Laredo emphasizes the fraught nature of the data. In Canada, as Megan Linton and Alan Minkiewicz point out, no disaggregated data has been released on the impacts of the pandemic on disabled people. Indeed, whether it be data collection, COVID-19 vaccines, financial support, or housing and food security, disabled Canadians, a sector of the Canadian population that is disproportionately dying from COVID-19, have been systematically and consistently left out of the Canadian government's policies and planning during the pandemic. As Laredo puts it, and I quote, "Of all the systemic issues that have been exacerbated by COVID-19, none has been more significant than ableism. Ableism," Laredo writes, "is," and I quote, "the thread that has run throughout every aspect of this pandemic and explains why Canada's response to it has been negligently inadequate." For Laredo, the COVID-19 deaths in nursing homes and other institutions across Canada in which elders and younger disabled people are segregated is tantamount to mass murder. I call it neo-eugenics biopolitics. Even well-kept, adequately staffed, publicly owned and operated nursing homes and so-called care facilities cannot be the adequate response to the question of how societies should respond to elders and younger disabled people. On the contrary, such apparently genteel institutions should rather be recognized as the window dressing of the nursing home industrial complex, which is a carceral network of power that operates in the service of ableism, ageism, and racism, while underwriting a neoliberal socio-economic and political environment in which productivity and profit are steadily prioritized, and elders, seniors, and younger disabled people are devalued, disenfranchised, and deemed disposable. Indeed, government-owned and operated nursing homes are no more ideal alternatives to privately owned for-profit nursing homes than government-owned and operated prisons are ideal alternatives to privately owned for-profit prisons, the latter of which institutions also operate in the service of forms of power that disenfranchise and render disposable certain populations, especially racialized, Indigenous, disabled, poor, and trans populations. So the last section of this version of my paper is COVID-19 and vulnerabilized populations. Disabled philosopher of disability Joseph Stramondo has argued that residential institutions where disabled people live should be defined in terms of the power relations that structure them and circulate within them. Whether disabled people live in them with or without control, proxy control if necessary, a control of the types of support and care that they receive, whether they live in them with or without control of when support and care are provided, where they are provided and by where they are provided and by whom they are provided. Nursing homes and other so-called care facilities in which seniors, elders, and younger disabled people are put, insofar as they are total institutions, do not, however, enable such discretionary acts or even allow for the possibility of their execution. In a total institution, Irving Goffman noted, and I quote, "minute segments of a person's line of activity may be subjected to regulations and judgments by staff," end quote. In his classic 1961 text, Asylums, Goffman wrote, and I quote, "A total institution may be defined as a place of residence and work where a large number of like-situated individuals cut off from the wider societies for an appreciable period of time, together lead an enclosed, formally administered round of life. Prisons serve as a clear example, providing we appreciate that what is prison-like about prisons is found in institutions whose members have broken no laws," end quote. As total institutions, nursing homes and other congregate facilities in which elders and younger disabled people are segregated constitute significant mechanisms of government, where the term government should be understood in the sense that Foucault adopted, that is, should be understood to refer to any mode of action, more or less considered and calculated, that is bound to structure the field of possible actions of someone else. In nursing homes, Sarah Luderman remarks, and I quote, "Residents depend on and are at mercy of the staff. Nursing home residents do not choose with whom they live or what activities they can do on a given day. Feeding, washing, and otherwise seeing to the needs of elderly and disabled residents all at once is more efficient than addressing those needs on an individual basis. But this efficiency," Luderman asserts, "comes at the expense of human dignity." End quote. Nursing homes, with their scheduled bath days and bowel days, wake-up times and bedtimes, frugal meal planning and food rationing, locked wards, visitor restrictions, and other signposts of carceral logic, are formulated upon asymmetrical relations of power that require compliance and homogeneity to ensure that their senior and disabled resident populations are rendered manageable. Indeed, as Goffman pointed out, the handling of many human needs by the bureaucratic organization of whole blocks of people, whether or not this is a necessary or effective means of social organization in the circumstances, is the key fact of total institutions, which enables personnel whose primary activities are observation and surveillance to more efficiently supervise these people. To put the point another way, residents or inmates of nursing homes are deprived of freedom of non-domination, are the subjects of and subjected to the arbitrary power of nursing home staff and the machinery of the nursing home industrial complex. That is, seniors, elders, and younger disabled people put in nursing homes and other care institutions are subject to a form of power that can be exercised over them at any given time, on any given day, at the behest or whim of any staff member of the institutions. A form of power that implicitly depends upon a certain obedience and deference from these resident inmates or their proxy decision makers, as well as abrogation of privacy and self-determination from them. Complaints and reports of, for instance, rough or otherwise harsh treatment, of undesirable or inedible food, of unwashed clothing, of missing personal property, of breaches of privacy, or of sexual and physical abuse can and do result in reprisals from nursing home staff and administration. In short, insofar as nursing homes and other so-called long-term care facilities in which seniors and disabled people are confined require of them and their advocates a certain docility, these spheres of domination contribute to the production of the carceral archipelago of modern societies, though they're not widely recognized and acknowledged as doing so. Claims to the contrary, that is, claims according to which nursing homes and similar institutions are sites of care and love, constitute acts of structural gaslighting. Foucault introduced the term carceral archipelago to refer to the ways in which forms of power that condition the management and organization of the modern prison have come to characterize the management and organization of contemporary society more generally, that is, society outside of the prison. in the carceral archipelago as Foucault envisioned it. Institutions such as nursing homes and other entities and sites which are not usually associated with the prison, with the carceral, and with the punitive, are in fact islands of the carceral, whose architecture, routines, schedules, and purposes mirror the physical and conceptual design and functions of the prison. As Foucault sardonically asked, and I quote, "Is it surprising that prisons resemble factories, schools, barracks, hospitals, which all resemble prisons?" End quote. Throughout this presentation, I've aimed to show that the COVID-19 pandemic has thrown into relief the ways that nursing homes and other long-term care facilities are like rather than unlike prisons. Jonathan Marchand, a disabled activist, captured this understanding of nursing homes and so-called care facilities when in his testimony to the Senate deliberations on Bill C-7, he stated, and I quote, "I'm appearing before you from what I consider my medical prison cell, a long-term care facility in Quebec. I oppose Bill C-7 because death with dignity doesn't exist without life with dignity." In his statement to the Senate committee, furthermore, Marchand repeatedly pointed out that disabled people are compelled to access MAID due to systemic ableist and racist discrimination against them, lack of community care and community supports, poverty, medical bias, and lack of accessible housing. That is due to systemic problems that ought to be addressed through political change and transformation, rather than incarceration and eugenics. In short, nursing homes, so-called long-term care facilities, and other institutions in which seniors, elders, and younger disabled people are confined, like prisons, must be abolished. That is, the nursing home industrial complex, like the prison industrial complex, must be dismantled. Replaced with adequately funded, culturally and ethnically appropriate home care, accessible housing, financial stability, and other government and community supports and services where people live. Many feminist philosophers and some disability theorists, rather than embark on a path of sustained critical examination of the concept of vulnerability, have worked to redeem the allegedly prediscursive status that is customarily ascribed to vulnerability and simultaneously disparaged. The apparent self-evidence of the natural status of vulnerability is, however, an artifact of structural gaslighting. Hence, the concept of vulnerability too should be the target of a feminist project of conceptual engineering. Rather than a prediscursive inherent human trait, vulnerability is a contextually specific social phenomenon whose politically potent and artifactual character could be recognized and acknowledged if feminist philosophers, among others, were to take up Foucault's idea of eventualization. Foucault's term eventualization refers to a breach of self-evidence that exposes the singularity of a given practice or state of affairs. Eventualization, as a kind of conceptual engineering, aims to show that things are not as necessary as they seem. As Foucault remarked, and I quote, "It wasn't as a matter of course that mad people came to be regarded as mentally ill. It wasn't self-evident that the only thing to be done with the criminal was to lock him up. And it wasn't self-evident that the causes of illness were to be sought through the individual examination of bodies. End quote. One need not search for these sorts of historical exemplars of eventualization in the distant past. Consider, for example, the efforts to defund the police, which gained momentum throughout North America and across the globe in the summer of 2020, were acts of eventualization designed to undermine the allegedly self-evident necessity of these islands, namely police forces of the carceral archipelago. To take another example, consider the now decades-old movement to abolish prisons as a coordinated set of eventualization that refuses assumptions about the seeming necessity of the modern prison. As Ronaldo Walcott has pointed out, contemporary ideas about abolition are founded on the history and logic of the movement to end slavery in the Americas, the first abolition movement. Walcott thinks that when people understand that the contemporary abolition movement is built upon this history and logic, then they can appreciate that contemporary abolition is not limited to abolition of the prison industrial complex and police, but rather encompasses the abolition of property and the redistribution of the Earth's resources in a more equitable way. All goals that to many people have seemed too idealistic or even preposterous. Nevertheless, Walcott has described the philosophy of contemporary abolition thus, and I quote, "An abolitionist philosophy says that we need to redistribute resources so that everyone has adequate housing, so that everyone is housed. You need livable wages so that people who are working are not poor and precarious. It means everyone being able to have access to great, thorough health care. And we believe that when all those things are put in place, that people will live fundamentally different kinds of lives, and that we'll be building the foundation and more towards the abolition of police and the abolition of the prison culture that we have and beginning the process of moving towards seriously redressing and redistributing the Earth's wealth and bounty as opposed to what we have now." End quote. Activists and authors who implicitly engage in a form of conceptual engineering to advance these abolitionist endeavors argue that no one is illegal, but many people are illegalized. That no one is a criminal, but many people are criminalized. Likewise, I have argued that no one has a race or a disability, but people are racialized and disabled. No one is vulnerable, to use the philosopher Eva Katay's term, but many people, including elders, disabled people, and prisoners, are made vulnerable, that is, are vulnerabilized. Contra the implications of racist medicine, epidemiology, and popular discourse that have circulated throughout the pandemic, residents and staff of nursing homes located in predominantly Black and brown neighborhoods of American cities are not disproportionately represented amongst COVID-19 cases and deaths because Black and brown people are somehow innately vulnerable to contracting COVID-19 in ways that white people are not. No one is more naturally vulnerable of contracting COVID-19 than anyone else, nor is anyone, or because no one is, more naturally immune to contracting the virus than anyone else. Black, brown, Indigenous, and disabled people, which are by no means mutually exclusive groups, are rather disproportionately vulnerabilized to COVID-19 by, among other things, the service sector jobs in which many of them are employed, by the crowded nursing homes, prisons, and other carceral institutions in which many of them are segregated, and by the proximate relations to personal assistants and other service providers that are routine features in the daily lives of many of them. The naturalization of vulnerability and risk in the context of discourse on COVID-19 is both individualizing and totalizing. The ableist and racist naturalization of vulnerability and risk in the context of COVID-19 is individualizing insofar as it attaches vulnerability and risk to the bodies of certain subjects, ensuring that they will be regulated and disciplined by virtue of this individualization, and in most cases will be enlisted to become self-regulating and self-disciplining. In addition, this naturalization of vulnerability and risk in the context of COVID-19 is totalizing insofar as it creates risk groups, statistical subpopulations whose respective naturalized gradations of susceptibility to the virus cover over the systemic, structural, and institutional mechanisms, such as the nursing home industrial complex and apparatuses, such as apparatuses of disability and race, that breed transmission of COVID-19 amongst marginalized people, fostering their vulnerability to it, and thus positioning them under increased scrutiny, surveillance, quarantine, and other forms of control. Seldom has this naturalization of vulnerability and susceptibility to COVID-19 led to increased social assistance, the expansion of paid sick leave, job, housing, and food security, or the other forms of economic and institutional change that would systematically and socially distance vulnerabilized people from the virus. A comment that African-American feminist legal scholar Dorothy Roberts recently made about the futility of care ethics for work on prisons and so-called child welfare systems also captures the futility of a care ethics approach, which with its assumptions of disability, vulnerability, and risk, to nursing homes and other institutions in which seniors, elders, and younger disabled people are incarcerated. As Roberts put it, and I quote, "You can't fix prisons or so-called foster care by training their agents to be more caring. The very logic and design of these systems are antithetical to care," end quote. I want to argue likewise that the eugenic logic of neoliberalism, which provides the impetus for the nursing home industrial complex, makes a mockery of care and concern. To quote Roberts again, "The only way is abolition," end quote. In short, nursing homes and other institutions that confine seniors, elders, and younger disabled people must no longer be regarded as necessary and inevitable features of modern social existence to which there are no alternatives. Rather, we should regard upscaled regulation, renovation, and public ownership of nursing homes and other institutions in which seniors and younger disabled people are put as a kind of gentrification of apparatuses of power. Gentrification designed in large part to ease the minds of the community at large about the segregation and dehumanization that these institutions facilitate. In other words, gentrification that effectively expands the scope of apparatuses of power and the systemic injustices that they constitute and comprise. So I see I've run out of time, but I just want to make a few closing remarks about the presentation. So as I indicated at the outset of this session of Disability Filibuster, the paper I just read is a condensed version of an article that will be published in a special issue of a South African journal that I've guest edited. The published version of the paper that will appear in that journal will be dedicated to the memory of my disabled father, Robert Frederick Tremaine, who died in a Chartwell-owned nursing home on December 9th, 2013. I just want to say that I think it's crucial for us to make the connections between Bill C7, carceral logics, and the history of eugenics in Canada. Not doing so reproduces structural gaslighting about how power circulates. We also need to continue to ask the questions that government officials, medical professionals, academics, and mainstream journalists continue to cover over. Last evening, Sarah Jama pointed out that some individual physicians need to be accountable for their abusive and negligent treatment of disabled people. I agree, and I think that this call for accountability also relates to nursing homes. In accounts about nursing homes in COVID-19 that are now commonplace in the mainstream press and on social media, etc., a number of male geriatricians now take up the role of experts on the subject of nursing homes. Why did it take this pandemic for these doctors to speak out about the abysmal conditions in these institutions? We need to ask this question. We need to demand that doctors be accountable for the predictable catastrophe that has taken place in these institutions, not just the government, but the medical profession, especially the doctors who have been taking salaries from nursing home corporations, enabling the nursing home industrial complex and allowing the dehumanizing conditions in nursing homes and other so-called long-term care facilities to persist and expand. So that's all I wanted to say. I'm sorry I went over my time.
Just unmuting. Hi, Shelley. It was amazing, though. Really, really amazing. I kept getting distracted from the thing I'm doing on the side because I couldn't stop listening to you. So I really, really appreciate it. That was incredible.
Thank you very much.
And yeah, I did want to say hello to the next people who have come in. I'm guessing that you're Candace.
I am. Hello.
Hi, Candace. So nice to meet you. It's I'm so happy you're able to come at the last minute, like everybody, and come and participate in this important event. And I'm totally going to put you on the spot right now. And I apologize for doing it live, but I'm just realizing that, you know, it's probably been about an hour since we've done any kind of land acknowledgement. And at the time, you know, you don't necessarily have to, but I could, but I thought maybe you might prefer to.
Thank you.
Okay.
Thank you for having me. I'm honored. I hope I can fill your hour. My name is Candace Botha, and I'm the Senior Disability Case Manager at the BC Aboriginal Network on Disability Society. We call it BCANS. And today I want to acknowledge with respect the Lekwungen people, also known as Songhees and Esquimalt First Nations, on whose traditional territory BCAN stands. I want to give thanks to the Lekwungen people for allowing us to live, work, and play on their lands. I also want to give thanks to their ancestors for looking after and passing on their cultural teachings of this amazing and beautiful place. Lekwungen people have been caretakers of this land for thousands of years. Lastly, I would like to recognize the traditional and ancestral unceded territory of the First Nations, whose territories all of you are joining us with from today. Please take this opportunity to learn about the history of these lands and honor the original inhabitants. Thank you all for allowing me to make these recognitions and acknowledgements today. Land acknowledgements are necessary steps towards reconciliation. Thank you. Today, I'm going to cover two areas. I have a presentation with a PowerPoint, if I'm able to share it, about BCANs and all of the programs that we deliver. And I'd also like to give you a background of my history and what has shaped my perspective on disability. So I have the lived experience of having a chronic illness. And I have been working in the disability field for probably much more than 15 years now. I've been saying that for a while. I've been here at BCANS for 2 years in the case management program. And before that, I spent several years setting up a arts collective with deaf and disabled filmmakers. It's called Camcorder Productions. It's based in Toronto. And we've made several films, including all ASL films with all deaf casts. We have a horror film called Deafening Darkness and a historical film that's coming out soon called Old Mother Tongue. I've worked for the Ethno-Racial Persons with Disability organization based in Toronto, the Ottawa Independent Living Resource Center. I've worked with landmine survivors and deaf organizations in Zambia and Africa. And I could go on forever, but I've also done a lot of personal care work through direct funding programs in the UK and here in Canada. I've had a very rewarding career in disability and have had many disabled mentors, colleagues, and friends throughout my life. Before that, I was raised by a mother with a physical disability and chronic illness. She is the best, most fun, adventurous mom in the whole world. She also happened to be a leader in the disability rights community. Some of you may know who she is, Tracy Walters. She was the executive director of Independent Living Canada for 17 years. So my little brother and I would pile onto her scooter and go pretty much everywhere she went because she was a single mom. And that included a lot of time in hotel swimming pools and underneath boardroom tables with seeing eye dogs in every major Canadian city. Growing up in the independent living movement was like growing up in an equitable future, kind of like when you watch the Paralympics. You're surrounded by passionate and determined professionals and all kinds of new interesting technologies. Sorry, I didn't notice my paper was in front there. We went to Parliament Hill a lot. We were both invited to meetings within the offices, but we also attended a lot of protests outside of Parliament Hill. In 1993, when I was 9 years old, it was when I first heard of the concept. It was called mercy killing. And it's because it hit the headlines that Robert Latimer had murdered his 13-year-old daughter, Tracy Latimer. She was 4 years older than me, and she had the exact same 90s haircut that I haven't forgiven my mother for giving me yet. She was a girl with cerebral palsy, and I attended many meetings and protests with my family about what the court outcomes were going to be for her father. I overheard lots of conversations about slippery slopes of what this could mean for other people and how it's possible for someone to judge another person's quality of life. In that time, in my, young mind, I really questioned if Robert Latimer ever hung out with people like us. Because I always saw people in chronic pain, people on ventilators and all kinds of contraptions. people with communication barriers who use communication boards and headbands with pointers in order to point to the words that they wanted to communicate. And all of those people were the most important people who flew to these conferences every year. They were the people who went up on the panel stage and spoke to hundreds of professionals. They were people who had their own attendants and personal assistants and highly trained service animals. They were parents and they were heroes, and they were all of my role models and people who made money and paid taxes and joked around. It was very hard to understand a different perspective about disability. In an inclusive community like that, and as a child, I was also very important. And I had a lot of jobs, like bringing service dogs out for breaks during meetings. And every year at the annual general meeting, there would be a dinner at the end and a dance. And it was my job to get the dance floor started. And there were wheelchair conga lines, and there were all kinds of different dances, which included crutches and sign language. And there were some people slow dancing where they would sit on a person in a motorized wheelchair's lap and spin around. And it was totally normal and so much fun. And I have never felt embarrassed or needed to drink in order to dance. Like, it's just a natural, my absolute most favorite activity, because I grew up in a place where everybody belonged. Everybody's body mattered, not just 25-year-old bodies that the media likes to glorify. And I want to ask, like, do you know how nice it is to live in a world where you matter and belong and you have that unshakable sense of security? It's incredible, and there is such a depth of knowledge and richness that I wish that the rest of society could learn from the disabled community. I wish that world for disabled people, but I also wish that world for what we like to call temporarily able-bodied people who are able-bodied but might be living in denial about that disability happens to all of us, whether it's an experience of an illness, accident, difficult pregnancy, if your eyesight or mobility declines with age. Like, I wish that people would stop othering people with disabilities, because you're gonna feel pretty silly if Bill C7 turns around and bites you in the butt. It is something that happens to all of us, and I don't think that there's a grasp on reality of who disabled people are. In the 1990s, and probably still to this day, Alan Simpson was like the archetypal hero of this disability rights movement. Him and his wife both used wheelchairs, and they had 2 adopted girls who were my age. And so when I went for a sleepover at their house, and we had to pull out the couch, and one of the girls happened to lose their teeth, the tooth fairy didn't come that night. And when the idea was proposed to us that maybe the tooth fairy used a wheelchair, that was completely plausible in our world. Like, that wasn't a question. And that was the world that the disability community presented to government officials and high up business people, because they would come to our events and our meetings and they would see world-class CEOs managing multi-million-dollar organizations when they may have had hearing impairments and only the use of 2 fingers. And that's a shout out to Sandra Carpenter, who was the best manager who ever lived. Rest in peace. Today, as an adult, as the senior disability case manager at BCANS, I'm shocked. I'm still shocked every day about the lack of services for people with disabilities and the things that people are denied of, the rates of homelessness, the lack of accessibility funds, the poverty, and the disgusting racism that people have to face in all areas of society, but often from medical professionals. It's a daily occurrence that happens. Yesterday, a woman called me who goes to dialysis 3 times a week, and she's completely ignored. And when she is spoken to, she's been told things like, if you don't like it, you can go home and die. She's been being gurneyed into surgery and told that she was taken off a transplant list, like exposed to stress that she doesn't need to be in a time like that. She's been suspended from life-saving supports for a week at a time. And recently she asked a security guard to help push her wheelchair over the threshold of the door, and he used his foot. And these are stories that I hear all the time. They're stories that are documented on social media, in mainstream media outlets, and in medical reports. Like recently in BC, we had In Plain Sight published, and it speaks of these awful experiences that people are experiencing every day. So my question to the government officials who are debating Bill C7 is, how are you going to enable people to die with dignity when they're not able to access care with dignity? You cannot die with dignity when you haven't lived with dignity, period. I can go into my PowerPoint about BCANS and our programs, and if I have more time, we can discuss more of the challenges that people with disabilities, Indigenous people with disabilities, are facing every day.
I mean, I've sort of blocked you in till, just going to double check the schedule, but I think I have you until 1, because I had gotten an email from you and from Neil, and I wasn't sure who exactly wanted to present. And so I thought, I'm just going to block off an hour, and that way there's lots of time for whoever wants to speak, because I think, your organization is very unique in Canada, really, right? And important to share what you know.
I hope I fill the hour.
I'm here too, and I don't know if anyone else, it looks like there's a lot of people in the background that I'm sure you can see, but some of them may not actually be here right now, but if anyone is and they're interested, if you're willing to talk with people, I'm totally open to more people joining in.
Yeah, after the PowerPoint, I'd be happy to take questions.
Great.
Let's see, I'm gonna try to share this screen.
Should be, maybe you might not be allowed. Oh, no, yay, okay, good.
There we go. Whoops. So the BC Aboriginal Network on Disability Society, we're here on Vancouver Island. We serve people all over the province, phone, text, email, any medium that works for people. And more and more, we're end up serving people outside of the province because we are such a unique program or organization. We're the only Indigenous disability organization in Canada, and we're internationally recognized. We hold a consultative status with the United Nations, and I'll get more into the programs of how we work with individual clients, but we see how policies are interpreted into the lived experience and how they're put into practice and how they work and how they don't. So we use this knowledge and experience and these relationships to help inform and make recommendations on how to have a more inclusive and accessible Canada for all Indigenous people and their families, or Indigenous people with disability and their families, all Indigenous people. So we have an Indigenous disability case management program where I normally define it to begin with, but with what we don't do, because we'll try to do anything and be as flexible as we can to meet people's needs. So we don't give legal advice and we're not counselors. We help. We do intend like an intake interview where we learn about each individual, identify the goals that they've come to us with, but also other goals, and come up with strategies on how to have their needs met. And this is very broad. Sometimes they're trying to navigate human rights commission complaint processes. There's a lot of people experiencing homelessness, who don't have accessible housing, who live in remote areas, who are not receiving the supports that they might in bigger cities. Education, accessible technology. Basically, we try to assist with whatever issue that people bring forward to us. Soon we will be opening a Jordan's Principle program, where at the moment we do help people with their applications or the processes they need to partake in before they're eligible for Jordan's Principle, but we will have a program that addresses those issues and focuses on them. We also have an Indigenous registered disability savings navigation program where we help people get their disability tax credits and then open up their registered disability savings plans. Because we serve people who are both within First Nations community and who live in urban settings, there are many different jurisdictional issues and tax issues and things that might scare some other service providers or banks. So we also help people with their taxes and how to maximize their entitlements, and there's all kinds of things that you learn about each individual as you're helping them access a service. So it often leads much further than that. We also try to help people maximize their grants and bonds that they're receiving in their registered disability savings plan. So in each province, there's a disability income assistance program that's administered provincially. And in each province, we have First Nations communities who are somewhat autonomous, or maybe you would say like on federal land. And in BC anyway, the Disability Income Assistance Program on federal land very much mirrors the policies of the provincial programs, but the funding comes from the federal government, Indigenous Services Canada, and people apply through their band offices. And so BCANS provides a service to all of the bands who ask or require them, where we have an adjudication department here, and it's a third-party neutral department where all of the persons with disability applications can be sent to the adjudicators to decide on whether or not they're approved for their disability designation, and then also administer the appeals that might come along with that, as well as the monthly nutritional supplement, which is another supplement having to do with persons with disability income assistance. So it's very much like the provincial program, but it's done a little bit differently, and we provide that service to bands and First Nations communities. We are the lead organization for the domestic monitoring of Canada's compliance to the United Nations Convention on the Rights of Persons with Disability, in partnership with other civil society organizations and disabled persons organizations. Some of our staff have gone to Geneva during the compliance reviews, and we sit on committees and collect information from other organizations in order to assist with the shadow reports. This program is wrapping up right now, but for the past, I think, 6 months, it's the BCAN Support for Student Learning Project. We have been providing laptops to Indigenous students across the country. So they've been applying if they're attending school. There wasn't an age limit, and we were shipping out laptops, mice, and headphones for people in order to have equal opportunity to education during this time while there's a lot of distance learning happening. We have a BCAN's Indigenous Employment and Disability Project, and we engage Indigenous and non-Indigenous communities and organizations to identify barriers that people experience in obtaining employment and hiring Indigenous people with disabilities. The data is collected and shared with governments to raise awareness and suggest solutions. And we're pushing to create new resources and policy change, as there are many issues that are unique to Indigenous people with disabilities, living remotely, discrimination, and so forth. Indigenous COVID-19 awareness support. This program has been running for about a year, and when you're an Indigenous person, especially if you have a disability, there are a lot of jurisdictional issues of where your medical benefits come from, or if there's a policy change at the province, there might be like a small lag between if that's adopted federally, and then how that's administered, and to see if all the communities are aware of these policy changes, because it's not equal access to communication the way that it can be centralized through the provincial government, as a lot of places are self-governing. And there's so many nitty-gritty details of how things work. Like if you are First Nation status and you're living in a First Nations community, how do you prove your income to access CERB? At the end of the year, how do you claim CERB, and what do you do? Like, there is so much learning that all the people who work at this organization have to do constantly, because the policies are constantly changing and they just don't translate the same to different populations. So we have to have constant communication and constantly constantly trying to adapt the way that we do things so that it works for all people equally. We have First Nations Accessible Canada Act engagement, where we engage different communities and community members in consultative meetings on how to make the act reflect the unique experience of Indigenous people with disabilities, and make recommendations on how the legislation, how those views can be incorporated into the legislation. We have National Indigenous Accessibility Week. So we're the lead organization in promoting and raising awareness in relation to Indigenous accessibility during this week. And, oops, sorry, I thought I was scrolling down. So we promote this through social media and other avenues and events when you're allowed to have events face-to-face. I think 6 years ago, we started Indigenous Disability Awareness Month, and we have different provincial governments and organizations officially proclaim that November is Indigenous Disability Awareness Month. We host events and lectures and, social media campaigns in order to promote the awareness around Indigenous disability. And in the old normal, we've been having an Indigenous Disability and Wellness gathering, a conference for people to come together, to collaborate, to learn about different programs, a conference for both like federal and provincial programs, people throughout the community, people have been coming from across Canada. It's not just provincial. It was delayed last year, and who knows what November will bring. Oops. I can't scroll anymore. These are a list of different awards and recognitions that BCANS has received, and the committees where BCANS represents the needs of Indigenous people with disabilities, both provincially and nationally, and several international committees. There are Indigenous people in all parts of the world, and it's important to learn from other experiences and successes. I think my computer's freezing. I'm not sure if I'm still live. Can someone confirm that to me? Okay, thank you. I'm live. and I'm reading people's chats now. So there's a question about Jordan's principle. The program is going to open soon, but we've always helped people with Jordan's principle applications. So if there's family who need support with that, I suggest that they contact BCANs. Sometimes there's a little bit of work that needs to be done before the Jordan's principle application, like you need to show some denials that you didn't receive the supports in other places. So I will go back to the first slide so people have my contact information. Oh, it's not there. Well, I can tell you, our office number is 250-381-7303, 250-381-7303. You will likely be connected to a case manager right away. We have release of information forms that we will send to you in whatever medium works for you. We will do an intake process and get to know you and your unique situation, and getting to know the answers to the questions also help us analyze which programs you would be eligible for, and we can set you up that way. So please do contact. Does anybody have questions about BCANs or the services? Okay, well, I'm gonna take this screen off and then I'm gonna talk about another topic. I highly doubt that a lot of the people discussing this bill have a good understanding of who disabled people are. And one of the examples that I have is that there's almost nothing for disabled mothers with disabilities. There is one program in Ontario that I know of, which is fantastic. It's through the direct funding program, through the independent living centers. It's funded by the Ministry of Health, and some of your attendant services can go towards the routine daily task of parenting. But I don't really see anything here in British Columbia for parents with disabilities. And among my clientele, I have a lot of mothers with disabilities. I have some mothers who have 5 children. I have one mother who has 10 children who has a disability. And where are the programs? There used to be a long time ago in the 80s and early 90s homemaking, where you could get some assistance a few times a week. It's just like totally unrealistic. Like a lot of people's ideas of who disabled people and disabled women are. People say to me, oh, your mom had a disability, so you have a different view. But I've seen a number of amazing professional women who are paraplegic or have other mobility issues, using power chairs, with big pregnant bellies, and yeah, like beautiful husbands and wonderful families who they're supporting through their work. Many times in passing, there was a woman that I used to see at conferences, and she was a lawyer, and she didn't have any arms, so she pulled the baby carriage backwards on her chest, and like, she was so graceful in everything she did. Like, I remember seeing her at when you're at a conference back before like Wi-Fi was on everybody's phone, they would have like the little stations where you could use the computer, and she would be sitting up on the desk and typing with her toes, and you know, completely graceful and capable, as well as like being a mother and a professional. Like, disabled mothers, it's a very, very common thing. A lot of children are raised by people with disabilities. And does the government know that? I don't think so, because I don't see any policies or programs for those mothers or fathers. So why are we discussing a bill about assisted dying when it doesn't seem like there's recognition of who disabled people are? And if we don't understand who disabled people are and who and what their needs are and how they're accessing services and how they're being discriminated for services and some often being demeaned during medical or any interactions with government, employment settings, like if we're not fully understanding that, then why are we so easily speaking about the death of people with disabilities? Tracy, do you have any further questions or anything? I'm feeling that I might not be on air now because I'm not hearing any feedback. Okay, I'll keep going. Thank you for the reassurance, Inclusion Canada. So yeah, every day people are calling constantly. I have new clients every single day. I have issues that seem so basic, like deaf clients who don't use sign language, who depend on lip reading, going into hospitals, and they're not being access to face shields or clear masks, and medical professionals refusing to take off their mask or find an alternative. I'm like, if you depend on reading lips, you don't need to take off your own mask. It's being able to see the instructions being given or the advice being given by the medical professional. So I've had this come up a lot, and it's even been to the point where there was a 5-hour medical imaging appointment. So there were many instructions and many different things to do, not being able to eat when you're allowed to eat, to allow the next test to go on, and how my client survived this, I don't know, with not being able to see lips for lip reading. I have a huge issue with the standard of housing. Provincially, not during the pandemic, but for many, many years, there have been like home adaptations for independence, renovation funds for keeping people in their homes, in the communities, and having accessible houses, being able to do renovations. And if you live in First Nations community, this funding is just not equally accessible to you. There's programs that are advertised through CMHC, and I have not seen any funding announcements for the last 3 years. And this is an issue that affects a lot of people, but especially children, where they're living in homes where they don't have access to mold remediation, they might not have adequate heating, or like the houses are not finished. Like you can see the snow through the spaces in between the doors and the frame. Completely inadequate. People who are disabled and can't access a private bedroom or bathrooms or kitchens, who are living in overcrowding, and the funding is just not equally accessible from the provincial to the federal funding. Sorry, I was just reading in chat. The standard of living for some people has absolutely shocked and appalled me. Before being in this role, like I just didn't imagine that there were people in Canada who had to live at this standard, but there are many. I have clients who live outside. They live in like a camper without water or electricity for 7-8 years. I have people who have been living on the street on the waiting list for subsidized housing for decades. I have clients who live in pain, who are treated like they're drug seeking. I have so many people who aren't accessing basic services that I had completely taken for granted before. And it's disgusting to think that when you're just trying to survive, to live a minimum standard of living, that one of your only options may be given is MAID. Like it's so cruel to think that that would someone's only they would think that was their only option, just because they're not accessing their basic services, because they don't have privacy, because they're not able to have an assistive device, because they're living below the poverty line and their rent prices are insane, because they're being discriminated against for apartments because of the color of their skin. I just keep coming back to, how do you die with dignity if you aren't able to live with dignity, if you're not treated with dignity and respect on a daily basis? How can we even begin to discuss dying with dignity? How does that make sense? I think that's all I got for you guys today.
Just unmuting myself. Yeah, that was pretty amazing. So much important things to say, and I know Jonathan is here as well. But we've still got 10 minutes. I don't know if anyone else is present and wants to chat about any of this stuff. It's so hard to know who's actually here versus all the people that have been kind of popping in and out and are, involved in the organization. But there's Jonathan.
Yeah, hi there. So yeah, it's very interesting what you were sharing, and you said that you grew up in a household where independent living was very influential. I find that very interesting, because here in Quebec, independent living exists in some organization. It's not well known, and they seem to have a very deep impact on your life and your worldview. And I find that very fascinating. And can you tell us a bit more about that? What you know about independent living, its history, or what's dear to you in that movement? And how do you think it can be used to further the rights of people with disabilities in Canada and in the world? If there's coalitions to be built, if there's any barriers that you see to have independent living from coast to coast in Canada, um, because it's not something that's well known in every part of the country. And when you look at its history as a movement, it really um, shaped the lives in the future of those countries that adopted this view and these policies tied to it. People who implemented independent living fully, like in Sweden, in Norway, and other parts of the world. Uh, People with disabilities have more choice and control over their lives. Um, so, how do you see independent living um, in this struggle for our rights?
Thank you. Um, a little bit about the history. Um, so the movement started in the States in Berkeley, California in the 60s at the university. And in the United States, it grew quite large. I think they have over 300 centers across Canada. I mean, sorry, across the United States.
Yeah.
And they are very involved in politics. I sometimes see emails about voting in bloc amongst the disability community. And they have a unique philosophy. Instead of saying patients or clients or things like that, the people who use the services are called consumers. They're consumers of services, which is a kind of an older concept, but I guess to be in a more like self-controlled kind of capitalist model for other people from other fields to understand. It's based on peer support. So people with disabilities are employed. They're leaders in the program, in the organizations, and they're giving advice from lived experience. There's a lot of information and referral, research and development. In Canada, the last I knew, there was 29 centers across Canada. So they take the core principles, but then they get they have flexibility within their own communities, which is based on community need as well as available funding. Like sometimes they have unique programs where they they're lending medical devices, or they might get government contracts to be delivering the parking passes or whatever it has been. Like when I was growing up, the old guard of the disability rights community used to talk a lot about all the friends and relationships that they would make in schools and institutions. So they were, you hear a lot about Blue Oordale Hospital for Children in Toronto, or like the special needs program. So kids with disabilities, although I'm not promoting institutionalization or anything like that, but they used to be together more when they're in mainstreaming. It seems like there's less opportunity to meet and make other friends with disabilities and unique experiences. So you need organizations like BCANs, like independent living centers, like all these social places for people with disabilities to get together and to talk about these things and to find commonalities, because you can have so many different types of disabilities, like what if they're language or physical. It might be hard to see each other's issues as common issues. So there needs to be places and social momentum, you know? So like we're probably moving into a new wave of the disability rights movement. Things are changing, you know, as society is. There are independent living movements in other countries. I remember my mom went to Russia to help set up an independent living organization, and they had no concept of what we do with the board of directors, to have a volunteer board of directors above the, you know, it's a more hierarchical society. There's just one person at the top. So the philosophies have to be very flexible for whatever community that they're in. But I love this filibuster because there's so much like feeling of momentum and like liveliness and togetherness when we've been separated for so long, like not just this year, but like as society's changing, we're trying to like refigure out how to come together and how to build momentum and what our common challenges are, and you know how to work together to overcome those. So it could be a very exciting time, you know.
Yeah, definitely. It's a good opportunity to network among us and build momentum and a movement going forward. And people, it's always shocked me because people don't necessarily see, you know, this euthanasia, assisted suicide, MAID issue as a disability issue, right? They think it's separate, has nothing to do with that. It's about choice, you know, individual choice. But they fail to connect the dots that it really impacts the lives of people with disabilities, and it's just, you know, ableist policies. Um, so I think there's a lot of work as well to be done within the community to educate people and, you know, help them to connect the dots. And even in the general population, people have very simplistic views as to, you know, why MAID is a good idea. But goes so deep, you know, you can spend a whole lifetime studying these questions, and it's it can get very complex. Um, so we definitely need to do more about that and come together as well to exert pressure on the political class so that they make the right decisions. And I think that people need to represent ourselves as much as we can. Um, so I don't know how it's gonna look in a few years' time, but it's definitely a critical time for us as a community. I think otherwise, if we don't push back, then our community will just shrink. I think, and where there's, you know, people with severe disabilities, they make, you know, a very very small portion of the population in Canada. Even fewer are able to live really in the community with the available services right now, and that could be, you know, decreasing if there's no pushback, you know, to get more assistance to live. I don't know if that can be used as a bargaining chip to get more or anything like that, but we definitely need to do more to get the help we need and to push back against all the discrimination we face. So yeah, I find it very cool to have seen so many younger people participate to the Zoom filibuster. It gives me hope that we can come together and do something. It's very cool. So yeah, you were booked until 4. That's it.
Make the last statement.
Yeah, Tracy.
Yes, hi. Yeah, I was exactly thinking the same thing, Jonathan, just looking for our next presenter, but I don't know if they're here yet. Let me look in. Yeah, there we go. Look. So smart, Aislinn. You raised your hand. I may have said your name terribly there. Maybe you can correct me when I let you in here. Come on in.
And thanks a lot for your presentation.
Thank you, Candace.
Yeah, thanks.
Hi.
Hello.
Hi, and thank you so much for having me. And thank you, Candace and Jonathan. I've really been enjoying all the presentations so far. I'll just dive in if that's okay, Tracy. Yeah, okay.
Yeah, sure.
Maybe just a little introduction since I haven't done that. Yeah.
Of course. Yeah, hello. My name is Aislinn Thomas, and yeah, I'll begin with a self-description, a visual description. I'm a white cis woman in my late 30s, and my pronouns are she or they. And I'm on the lower end of the weight spectrum. I have relatively short, curly auburn hair that's relatively contained at the moment. And today I'm wearing an olive green sweater, and it has a colorful yoke. And I think my great grandmother actually made this, but yeah, and behind me is a light gray wall. And I'm an artist, and I'm super grateful to be joining you from Peace and Friendship Treaty territory on Unama'ki, colonially known as Cape Breton Island. And actually, I'll just put that in the chat for the captioner, because I know there are some, just to get the spelling right. But yeah, so Unama'ki is one small part of Mi'kma'ki, that ancestral and unceded land of the Mi'kmaq. And I've just been so humbled by the welcome and hospitality of the Mi'kmaq Nation. I moved here in August and feel such a debt of gratitude. It's actually a return for me, but it's been many years since I've lived here. And I'm super grateful for this space, despite the at times heavy subject matter. It's just so nourishing to be able to tune into this conversation and to feel not only connected to all of you, but yeah, also very, I suppose, affirmed. It's very affirming to hear all of this. And thank you so much to everybody who's been working so hard to make it happen, including all the access workers and presenters. And I should just say, for people who are here in the Zoom room, that I'm not really visually oriented, so I just keep it really small. So if I miss any visual cues, it's best if you can jump in with audio. Hopefully I'll catch chat messages, but I don't always, so just let you know that. And I was expecting to be on here with my friend Carmen, but it looks like hopefully we'll be able to be on together tomorrow. There are just some scheduling snafus, but it was actually his suggestion that we read an essay by Mia Mingus. That's MIA MINGUS. And Mia is a Bay Area disability justice activist. And Carmen said I could go ahead and read the text here today. And it's one that's been really important to how I understand my own lived experience, and is also very validating. And I think it's pretty relevant to this space today. To prepare you, I've usually cried when I read this. Hopefully that's not going to happen today, but I trust that it's okay if it does. And yeah, and just to position myself further, I'm I would say grateful student of disability justice. I really endeavor to be an accomplice. However, I'm not really super connected to that community, and so I just want to make that clear and to position myself that way. Okay. So I think this is about an 8-minute read. And if it's helpful, I could share the screen. I'm reading from like a Word document. Would that be helpful?
Yeah, you can go ahead. Let's see.
Thank you. Okay.
Yeah, try.
All right. Okay.
There you go.
Okay, great. So this piece was posted on May 5th, 2011, and the title is Access Intimacy, The Missing Link by Mia Mingus, and the website is there. It's on her blog, leavingevidence.wordpress.com. So it begins, there are many ways to describe intimacy. For example, there's physical intimacy, emotional intimacy, intellectual, political, familial, or sexual intimacy. But as a physically disabled woman, there's another kind of intimacy that I have been struggling to name and describe, what I have been calling access intimacy. I have been using the term loosely, and I'm still realizing different aspects of it. This is in no way a complete describing of it. Instead, this is an initial naming and the beginnings of giving it shape. I'm offering it as something that has been useful for me, and I hope is useful to others to describe all kinds of access, not just in relation to disability. I think access as a framework is powerful for so many of our lives. Here I am speaking from my own lived experience as a physically disabled person, but I know access intimacy can also happen in many different ways for mamas and parents, women of color, queer and trans folks, etc. Anyone can experience access intimacy. I have never had words for access intimacy before. For years, I would feel it or crave it, but not know how to describe it. It has always been just out of reach, just beyond my grasp. I have mistaken it for emotional or political intimacy, sexual attraction, or romantic desire. I have mistakenly assumed that it would be there based on one's identity or experience. I have grappled with how to describe the closeness I would feel with people who my disabled body just felt a little bit safer and at ease with. There have been relationships that carried emotional, physical, and political intimacy, but sorely lacked access intimacy. And there have been relationships where access intimacy has helped to create the conditions out of which emotional, familial, and political intimacy could grow. Access intimacy is that elusive, hard to describe feeling when someone else gets your access needs. The kind of eerie comfort that your disabled self feels with someone on a purely access level. Sometimes it can happen with complete strangers, disabled or not, or sometimes it can be built over years. It could also be the way your body relaxes and opens up with someone when all your access needs are being met. It is not dependent on someone having a political understanding of disability, ableism, or access. Some of the people I have experienced the deepest access intimacy with, especially able-bodied people, have had no education or exposure to a political understanding of disability. Access intimacy is also the intimacy I feel with many other disabled and sick people who have an automatic understanding of access needs out of our shared, similar lived experience of the many different ways ableism manifests in our lives. Together, we share a kind of access intimacy that is ground level with no need for explanations. Instantly, we can hold the weight, emotion, logistics, isolation, trauma, fear, anxiety, and pain of access. I don't have to justify, and we are able to start from a place of steel vulnerability. It doesn't mean that our access looks the same or that we even know what each other's access needs are. It has taken the form of long talks into the night upon our first meeting, knowing glances shared across a room or in a group of able-bodied people, or the feeling of instant familiarity to be able to ask for help or support. In my life, access intimacy is something that has been hard-won, organic, or at times even felt magical. It has taken me by surprise, showing up with people that I never would have expected to have that kind of access connection with. It has been exciting and relieving, like a long, slow exhale. I don't know where it comes from or how it happens. It has felt like an unspoken instinctual language between different people, like an entirely unique way of being able to communicate and connect. Similar to meeting someone you just click with, access intimacy has felt like a distinct form of attraction, desire, and energy unto itself. Access intimacy is something I am coming to understand that I need in my life, something that I cannot and don't want to live without. I need it to literally be my whole self, because access is such an intimate part of my life. Here come the tears. As a queer physically disabled woman of color adoptee. Without it, relationships exist under a glass ceiling or split by thick frosted windows, with huge pieces of myself never being able to be reached. Without it, there is survival, but rarely true whole connection. Access intimacy is not just the action of access or, quote, helping someone. We have all experienced access that has left us feeling like a burden, violated, or just plain shitty. Many of us have experienced obligatory access where there is no intimacy, just a stoic counting down of the seconds until it is over. This is not access intimacy. There have been numerous relationships in my life where I have loved people very deeply, but never felt safe with them around my access. So many relationships where I knew I could only ask for or share so much without getting snapped at, chided, or being punished with reluctant, passive-aggressive access. So many times where I was too afraid because of the lack of access intimacy to speak up and voice what I needed or what I couldn't do, resulting in being isolated or getting very badly physically hurt from pushing myself too hard in some of the worst cases. Access intimacy is not charity, resentfulness enacted, intimidation, a humiliating trade for survival, or an ego boost. In fact, all of this threatens and kills access intimacy. There is a good feeling after and while you are experiencing access intimacy. It is a freeing, light, loving feeling. It brings the people who are a part of it closer. It builds and deepens connection. Sometimes access intimacy doesn't even mean that everything is 100% accessible. Sometimes it looks like both of you trying to create access as hard as you can with no avail in an ableist world. Sometimes it is someone just sitting and holding your hand while you both stare back at an inaccessible world. It has looked like relationships where I always felt like I can say what my access needs are no matter what, or I can say that I don't know them and that's okay too. It has looked like people not expecting payment in the form of emotional currency or ownership for access. It has looked like able-bodied people listening to me and believing me. It has looked like people investing in remembering my access needs and checking in with me if there are going to be situations that might be inaccessible or hard disability body-wise. It has also looked like CRIP-made access. It has looked like CRIP solidarity. In the last half decade of my life, I've been able to experience many forms and levels of access intimacy. Before that, I was not even in a place where I could have had access intimacy with anyone. It has only been in the last 7 years that I have come into myself as a politically disabled person, enough to begin to experience or desire access intimacy, even on superficial levels. Looking back, there have been only a handful of relationships in my life where access intimacy has existed. And in most of them, Access intimacy was not instant, but built and cultivated, with me bearing the brunt of the work. For the first time in my adult life, I am experiencing access intimacy that is not just painstakingly built over years, conversation by conversation, but is already in fertile existence, ready to grow. For the first time in my life, I am in disabled community, meeting sick and disabled folks, and experiencing a kind of mutual access intimacy that feels like family. For the first time in my life, I'm in relationships with able-bodied queer people of color, experiencing access intimacy that is beyond explanation and belief. For the first time this year, I am experiencing a level of access intimacy in my intimate relationships and home life that I have never experienced before. It has been both amazing and saddening now having something that actually cares for me. And it, like emotional intimacy, is also a deep risk because it would be devastating to lose and requires maintenance. Now, when I describe relationships, I include access intimacy along with my many other descriptors. I am watching it, studying it, bearing witness to it as it grows, evolves, and shifts, and as I learn all the different ways that access intimacy can exist. So that's the end of the text. And I don't know, it brings so much to mind. Sorry, I'm just thinking, one of the things I thought of was, I was thinking back to Gabrielle Peters' testimony at during the Senate committee hearings. Sorry, I'm a bit slow today. I have a bit of a migraine, and it just helps me to name that because hopefully you'll be patient with me and my word retrieval. But yeah, just talking about the difference that dignity is and I'm extrapolating here, but the dignity is in relationship. It's held in relationship, not in a specific embodiment. That an embodiment isn't dignified or undignified, but we can be made to feel that way depending on how we're treated, depending on how our access needs are honored and respected and understood. And I think one of the reasons that I've just been so grateful for this space is the way in which just being, yeah, listening to people whom I feel a kind of level of comfort around, like there is some kind of shared understanding. I know everyone's experiences are different. For me, I can relate to what Mia Mingus talks about kind of feeling like I haven't had my access needs all my life, and yet it has felt slow to develop access intimacy and a kind of safety or safe enough, finding safe enough relationships, and at the same time, not necessarily having very many of them. I think I really, in my closest circle, just have one person with whom I have really reliable access intimacy, and it can feel quite precarious, and it's feels so important for us to build that as we're able, and to have community. I don't know if anyone has any reflections on the text or would like to talk about it. I can also just ramble. I have a lot of feelings about Bill C7, but would be happy to be in conversation if anyone would enjoy that.
Yeah, sure, Iceland. Yeah, it's a nice text. And I know that blog, Living Traces, or yeah, it's yeah, she has lots of very interesting posts on there. She talks about the medical and industrial complex as well, and yeah, it's a great resource. Um, and I think I know what she means by access and intimacy. I do experience that with some people because I'm into an institution and I have to deal with hundreds, even thousands of people over the years, and I get that sometimes with some staff members, and people get it. They just get it, and it's just magical, as she put it. And you can't explain why it happens. That link, that bond, and I think it has to do with empathy, has to do with solidarity. It just creates a human bond that goes hand in hand with understanding, what are your needs, and it just works. It just clicks. That's something very rare. It doesn't happen often. It can happen, one time out of maybe 100 people you meet. It's something very very rare. But when it does happen, you do feel comfortable, and it's I don't know, it would be interesting to figure out why it does happen. But in your own life, how do you have any experience you can share where that happened or didn't happen and it was disappointing, or yeah?
Sure. Thank you so much for asking. I've actually written a bit about this. As I said, I'm an artist, and being in art spaces, especially galleries and museums, has become more and more difficult over time. And for context, I have a kind of variety of access needs, but including I'm very sensitive to light and sound, and but also I'm chemically sensitive, and that's added another. That's intensified in recent times, and anyhow, but I had this experience where, well, I'll give you actually, it might help for me to say how most of my experiences are, which is that as I'm sure many here or are familiar, if I want to go somewhere, it takes a lot of work to prepare. Like, you have to call the place ahead of time and get all sorts of information. It's usually not made publicly available on
That's
websites
right.
and so
And
on.
they can even give you the wrong information, and you end up having to go to a place that's not accessible. So yeah, I understand that. It's quite exhausting to have to do that, to plan everything. Yeah.
It is, and I'm often met with like, oh, sorry, no, we don't do that. And there's a big institution, and I won't name names, but and I often follow up about these experiences. Not always. I try to pick and choose my battles, and because it does take a lot of energy, but I followed up about things, and instead of being like, oh, okay, how can I work with you to help support you, or like, what can I do to share the labor and make this accessible to you, instead I'm told how wonderful and accessible they are and how they're leading accessibility in Canada. And anyhow, so that's usually my experience, and I yeah, so I usually don't feel very welcome in those spaces. But there was an exhibition I really wanted to see, and it was video work, which is notoriously like terrible for me because of the motion, and it was a large scale projection, and the combination of the light, sound, and motion, I usually can't manage it. And I just emailed them, and it was maybe like 2 sentences in my email, and they just replied back. And I knew this person as an acquaintance, but really didn't know this person who worked at the gallery. But she emailed back this really detailed email about what the installation was like, and she took photos of it, and she said, like, here are the ideas I have for how we could adapt it for you, like turning down the brightness, turning down the volume. She offered all these options, and so there's so many things that were amazing about that. First of all, the level of detail and care that went into it. Also, that I'm not the only, it was a very collaborative approach. She's not telling me what is best for me, but she's offering me all these options and is asking me questions about how that sounds, and giving me opportunity to say yes, no, or maybe, or whatever. And I honestly cried, and I still get teary thinking of it, because it just happens so rarely, and it meant a lot. And especially since I can't travel independently, and so everything about going to this place took a lot of energy, and I had to coordinate with my partner to get a ride there. It was like an hour away. Anyhow, it just meant so much. And yeah, sorry, I went on there a lot. Yeah. Do you have any examples, Jonathan, that you feel comfortable sharing?
Yeah, sure. And it's yeah, I can share, but it's not very positive in the end, even though people have the best intentions. But the if for example, I'm still in the institution right now. I'm about to leave though. I got the ID assistance I requested to finally get out of the institution. I'm working on that, and in the next 6 months, I should be able to go back to live in the community. But I've been living for 10 years inside the walls of this place, and when you find someone, a staff member, for example, where you have more of a kinship with, who gets it, who gets you, who um, you have a good relationship. There's so many barriers that basically the system is made that you cannot have those kinds of relations, closer relationship with the staff member. If they um, start to treat you more humanely, like get closer to you, then they can get reprimanded by the managers, by the institution, and it's really frowned upon. So you always have to be careful um, for yourself, to protect yourself and to protect the staff members. So you always are treated pretty much at arm's length, and even though you find someone that you can even become the friends with, it's not allowed, and that person can be fired for it. So people pretty much put their jobs on the line just to talk to you and treat you like a human being. Um, so that's my experience. Is that I'm pretty much radioactive in this place, and if people get close to me, then they might get burned, and they might lose their job, and at some point they might be met with the managers so that they stop and talk to me and all kind of things like that. So it's pretty traumatic. Um, to live in a place like that and to be managed like that. I can't wait to be out in the community and to have real bonds with other people, and to be free to do as I wish in my life. Um, that's one aspect I'm looking forward the most. That basic freedom, and it goes so deep when you start to look into it. It's for example, nurses. Nurses are managed by a professional order, and there are rules. You cannot be close to a patient. You cannot be friends. You cannot, for example, on your break, go see the patient and have a cup of coffee with him. You can lose your license, be sued, get into court, and the whole 9 yards. And there's so many layers to that. Also, the managers can do the same thing. The organization, the institution, the health authorities have all kind of, a code of ethics and all kind of things that prevent basic human contact between the residents, the patients, and the staff. So it's pretty much incompatible with social life as we know it in the community. And the more you dig deep into that, the more absurd it becomes. It's all about the institutions, the need of the organization, and it's like an hierarchy where you have the management at the top, and you got the workers, and below all that, you got the patients who got pretty much objects who you profit of, that you exploit. And so yeah, it's not very rosy to live in a place like this, but outside, I think I'm gonna have good chances to have a meaningful life and have people around me who care about me. I'll be able to hire my own attendants and train them according to my needs. And it's another world out there, and I can't wait to experience that.
I just want to read and echo what Teddy has written in the chat, which is that is a truly horrible dynamic to be put in place by the system. Thank you for sharing.
Yes, there's so many layers to that. It's, as I said, it's very depressing to look at, but just shows how absurd and not needed our institutions. We need to move away from that model and offer the assistance people need to live in the community, to abolition institutions, as another speaker was saying earlier today. And that's the only way. And it's not necessary what we're doing to people with disabilities. And there's always this threat that someday you won't get the support you need, and you're gonna end up in a place like this. And then we're talking about BSC 7, and the guy who fought for this so-called right was like me in Quebec, trapped into a long-term care facility. And he was pretty discouraged. He was suicidal, pretty much. That's all he was talking about. And he didn't get the assistance he needed to live in the community.
That was something I was really struck by, is that even the people who fought so hard for Bill C7 in the courts, Nicole Gladue and Jean Touchon, that it wasn't like the way people talk about it. I hear out in the world, it's so much about fear of disability and not wanting to suffer intolerably, but it's not, even for Gladue and Touchon, they cited fear of long-term care or their experience of long-term care as the reason they wanted MAID. And so let's go after that. That's personally how I feel.
That's right. That's right. And they didn't, the courts did not, dig into that. They didn't explore that question. They just took it for granted. Institutions are unnecessary and nothing's going to change that. And, it's, and the judge was pretty ableist, I'd say, in his views, in her views. So, yeah. And Tracy, I think we need to shift another break for about 25, 30 minutes.
We do, yes. We're going to, this is a continuous stream, but we have to switch over to a different backend source. It will still be the same YouTube link, so nothing will change for any of you who are watching out there. But on the back end here, we have to shift some things over and go to a new link and do things magically behind the scenes.
All right. Yeah, well, thank you. Thanks a lot, Aislinn. It was very interesting.
Thanks so much, Jonathan. I appreciate the conversation.
All right.
May I just pop in to say, Aslan, it's wonderful to see you. I've been listening, but I've been actually getting dressed, so I thought it would leave my camera off, but that was a beautiful presentation. And please, thank you to you, and please thank your collaborator and for her beautiful illumination of something that we know so deeply. But yeah, as she says, we haven't had words for. So thanks. I look forward to talking to you more about it.
You too. So nice to see you, Catherine.
Great to see you.
Yeah.
Okay, I don't really know how to do this, but I guess we need to maybe close
Yeah.
down the live stream just for a short time.
Absolutely.
I'm guessing.
Yeah, so what
okay.
I'll do is just end it for everybody. Thanks everyone for attending. And we'll transition over to that new link and be back live in the next kind of 15 minutes or so. So we'll see you over there.
See you soon.